I would like to go to do this, if you don't mind, and you can change. We can change it if you want. Maybe we can talk about what do we think happened with COVID-19 and in transportation, and what is happening right now. Quite a bit of institutions have announced that we are going to be post COVID-19. Well, no, we are not. We are in the second wave. And then, what do we think will happen in the near future and the longer term future? And we are interested, all of us. I've seen papers you wrote or presentations you gave, that we are interested also whether or not some things will work better. You know, you all know the examples of pedestrianization of some major cities in Europe and United States, and the opportunity that local governments find to introduce innovation where they didn't have the political support to do that. But now we see this happening. But, you know, I can tell you stories about the travel behavior of people and surveys where they told us that they relocated, they changed modes, they changed the way they use their time. And if you don't mind, I would try to, I will start with Kai Axhausen from ETH Zurich, and then go to Eric in Canada, and then work our way south. So it's a, and I start with Kai because Kai was one of the first persons to publish some data, interesting data, from a monitoring exercise that he's doing. And then I know Canada has quite a bit of initiatives on this. Maybe Eric can tell us something. And then Hani, I know Hani has quite a bit to say. In fact, he wanted to organize this panel with the illustrious panelists, and then Pat, and then at the end Susie. And Susie asked actually to listen first to what we have to say, and then make her intervention. So with no more delay, welcome everybody, and let's start with Professor Axhausen from ETH Zurich on what do we think happened with COVID-19?
Okay.
Hi.
Yes.
Yeah.
Yes, here I am. Okay. As Kostas just mentioned, I was in the lucky situation that we had an existing panel of people using a GPS tracking app, and we were able to replenish this so that we are at the top. We had about 1,100 people at the start of the lockdown period, and we are now down to about 600. These are volunteers, so we cannot actually win new ones. But anyway, what is the main story? The main story is that behavior had changed before the official lockdown. The fear of the virus had kept people at home. And after the announcement of the lockdown, they started to travel more again, as if kind of the acknowledgement of the severity of the situation kind of removed some of the worries. And this trend has continued over the different stages of the restrictions, i.e. The lockdown of all non-essential business to the relative opening, which we currently have. Switzerland is nearly back to normal business. The main thing, which is still different from previously, is that the share of people working from home is still substantial. My guess is that about 15 to 20% of the people are still working part of the time or all the time from home. But what happens as well is that the total amount of travel in terms of passenger mileage is back to where it was before. And we see that the speeds which people travel at are at the level of before. One thing which is also visible is that public transport has lost a lot of customers, and in terms of mileage, they are still down 40 to 50% of their pre-COVID mileage. Now, the question is, what will happen in the fall? I.e., we are still in holiday period, there are still schools that are out, universities aren't back in session. So the key question is, what will happen in the fall? Will firms ask their staff to come back to the office? And if so, how? And happily, the federal government has given a contract to a second ongoing paddle study in Switzerland to track that fall. So there is a project with about 2,500 participants which will be tracked, and the data will be made available to researchers later on. But that's a different story. Now, the question you asked, what will remain? In principle, this is an enormous, undesired real-life experiment. This is kind of the ideal situation to test how people respond to change. Remember, for example, the Stockholm experiment with road pricing. In principle, this is the same story. The pricing here is the health risk. Now, what permanent changes will we see? I think COVID has accelerated lots of changes and trends which have already been happening. We do know that firms have been talking about hot desking, and that will obviously be accelerated in line with the home office and working from home experience of the last month. That raises all kinds of issues in labor relations, which haven't really been raised yet in the public discussion, but I think the fall will see some of the first discussions on that. Clearly, the remote and e-shopping has been given an enormous boost, and that I think will remain. Now we will have to obviously account then for the total number of disposable income in countries like the US, which will have a much more severe recession than, let's say, Switzerland. Some of the growth in e-shopping will be dampened by the impact of recession, but it's still underlying the trend will show for growth. One interesting result is, which we had with another survey, we saw that there were changes in the preference for the speed of delivery for online shopping. Maybe people will not be quite as impatient in a pandemic situation as they are when everything is healthy. Now, the last thing I wanted to mention is, or two things I want to mention. One is, has this experience really changed the preferences in the trade-off for money and speed? And I think that, in essence, this COVID experience gives us a chance to test and observe and model how the preference for speed and money has changed. Given that we are able to reconstruct the networks of all the services we have. And we are starting a project where we want to test if there has been indeed a change in the preferences for time and money. And given that we have this, now we have a panel for some people since September of last year, we have enough data to test how that changed person by person. So that's work which we are just starting. But finally, there's a second question which you raised with regards to modal preferences. We observed a quite substantial increase from a low base in terms of passenger miles traveled by cycling. Now, if the cities want to take up general policy ideas about encouraging the slow modes and encouraging CO light modes, they will have to start reallocating space. They have to remove parking spaces. They have to put bicycle lanes on the parking spaces. They have to push out all the external uses from the sidewalks to provide for safe and comfortable walking. And all of these changes in those cities which didn't jump at the chance during the COVID period will be bloodily fought. I don't think that the car drivers will just give up all the space they have acquired in the last 120 years to make cycling comfortable. So it will be an interesting time and will very much depend on the local political situation, what will be feasible. But I don't think it's a natural given. And I think with that, I'm looking forward to the discussion.
Thank you, Kai. Yes. Actually, we need to talk also about the social distancing and how some cities take advantage of that as an excuse to reallocate land use in the city. But okay, thank you, Kai. Let's go to Eric, and along the same lines, Kai actually showed us what is a good duration of the intervention. So thank you.
Okay, yeah. So I'll try to pick up from where Kai left off, or reinforce, I think, many of the things he's been saying. I had prepared some PowerPoint slides, but I don't think I'm going to bother using them. So I think, first of all, I think the situation in Canada is much closer to in places like Switzerland than it is to the United States in terms of overall response. After a few false starts back in March and April, I think generally the country has managed to control the first wave, and we're actually in quite a good sweet spot, if there's such a thing in these days, with respect to things, in that we have very low new cases everywhere in the country. We've been very cautiously reopening, very step by step. Canada's a very decentralized federal system, so we have 10 provinces and 3 territories, and all 13 have been doing things somewhat differently. So we have sort of a experiment going on, and just in terms of different policies even within the country, and some are more effective than others. But by and large, I think at the moment, fingers crossed, we're doing very well. I think that's a credit to very strong federal government leadership, which has been extremely helpful, and very good collaboration between the provinces and the federal government, which is something that doesn't always happen, but has happened here. So I think our governance has worked reasonably well. Everybody, and I think it's also attributed to that we have almost universally, not completely, but taken social distancing and wearing of masks very seriously. Unlike our neighbors to the south, masks are not a political, ideological issue here. And I think the proof, I think that's definitely demonstrating the efficacy of these policies. The city of Toronto, 4th largest city in North America, basically reopened for virtual all business about a month ago, and we've had no rebound whatsoever. In fact, our cases are continuing to go down. So that's good news. Everybody's worrying about what's going to happen in September when all the kids go back to school, and there's still a huge debate about how to manage that and what will happen. So we will see what happens in the fall. In terms of transportation, I would agree. I don't have the same sort of great data that Kai has, but I would agree with all his comments. Basically, I think we've seen very similar things here. Public transit was devastated. It's slowly coming back. And the other phenomenon, of course, is the working at home, the online working. So, I mean, to me, those are the two big issues going forward in terms of long-term change. How many people will return eventually to the office, and how will public transit rebound? I mean, to me, the big transportation crisis through all of this is maintaining public transit services. Not only has ridership been devastated, but of course revenues. so I think to me the single biggest policy question on the transportation side is keeping public transit systems afloat while ridership rebounds, and doing everything we can to ensure, first of all, that truly riding the buses in particular are safe, but also that people feel comfortable and confident to be using it. So that's a big push here, is to try to ensure that the transit is safe, and that people have confidence in it, and that financial support is coming to it. The federal government has announced major money to support public transit, particularly in the big cities like Toronto, to keep them and the cities afloat. So I think this is a huge issue, not just for transit, but for cities. In cities like Toronto, any big city, transit is not a nice to have, it's a must have. And we have to come out of this with transit systems that are made whole, I think. So we'll see how that goes. On the work at home, I mean, I think something we tend to focus on the transportation side of things, but there's huge land use and again, municipal, fiscal, and general economic issues associated with that. If the office buildings in downtown Toronto are empty, and if they stay empty, that has huge ramifications for rents, and hence income through the economic system. It has huge impacts eventually on property taxes and municipal revenues. And so while if we have less people commuting, particularly by car, into the downtown from a transportation point of view, that might be a long-term win. The restructuring of commercial activities and the need for commercial space, office, retail, and so forth, I think is very big. And so I think this is something we have to be paying much more attention to. Are the interconnections between all the systems? I teach a course in complex cities as complex systems, and we talk about cities being a system of systems. I think a year ago, I don't think too many people thought of the public health system and the transportation system and the commercial real estate system as being very linked, let alone the education system. And yet we've discovered, how profoundly interconnected and complex and complicated our cities are, and how these systems work. I mean, we shut down our economy because of a public health crisis, and we have created a massive economic and social problems instead. So I think that's what we're trying to manage going forward, is how do we, in the absence of a cure or a vaccine, how do we manage to, open up and stay open and manage the disease? And I think this is a huge challenge, and ultimately, I think in social behavior. And again, I think the differences we see across countries in terms of how society is responding to these challenges is critical. I guess just in terms of some of the research going on here, several of my colleagues, particularly Kangar, Nurul Habib, and Steve Farber, have been running various small surveys. I don't have results of those. I think there'll be presentations at TRB, particularly from Habib, about some of the findings he's been finding. I'll be reporting in the next session on some modeling work that we've been doing. And I think this is a potentially really interesting area for us as travel demand modelers. If anybody's actually looked at the so-called SEER models that are typically used to model disease spread, these models are incredibly aggregate. They have no socioeconomics in them. They have no space in them, and so they, they're not accounting for the fact that some people are much more likely to be interacting with other people who are much more likely to be having the disease. And so I think there's a huge opportunity for using our agent-based microsimulation models to try to address this. Now, they have many weaknesses because they weren't designed to do this sort of modeling, but nevertheless, I think they provide a real opportunity to try to dig deeper into some of the mechanisms of disease spread that I think could be quite illuminating. And I'll be talking a bit about the work we've been doing with colleagues in Sydney, Australia, on that. So, and I guess the final thing is, I guess, again, picking up on something Kai said, is active transportation, particularly bicycling. Here in Toronto, indeed, the crisis has, and particularly in early days, the empty streets. You know, in April, May, you could shoot a cannon down most of Toronto streets and not hit anybody. The city has taken advantage of that to very much accelerate bicycle lanes and lane closures. 2 or 3 different programs, something they call Active TO. Well, forget the labels. One thing they've been doing is in residential neighborhoods creating quiet streets, and while still allowing very limited local traffic to come through, it's at a very slow pace. The street really is taken over by pedestrians and bicycles, and the cars and the people and the bicycles all coexist in these neighborhood streets quite nicely. And on many major streets, they've implemented much more aggressively bike lanes than would have been possible before. Toronto has always had a very contentious political situation with respect to bicycles versus cars, and so we are opening up a lot more bicycle lanes. We will see how they're being used. Curb lanes are also being taken for a combination of parking for people to come for pickups from stores, online ordering and then picking up from stores, but and also to provide a bit of, but also extending for restaurants and bars, extending patios out into the street. So that's been quite an aggressive campaign, something that just wouldn't have happened a year or so ago. Again, we'll see how that persists once we return to so-called normal, but it is an interesting experiment underway at the moment. Okay, so I've probably rambled long enough here, so I'll turn it over to whoever's coming next.
All right, thank you, Eric. We'll address some of the questions that are coming through chat at the end when every panelist made their statement. And the next one, geographical, is Hani Mahmassani, who also has issued all kinds of statements on some other major changes happening, not only the behavior of human beings, but companies, right? So, but I won't give the speech of Hani.
Thank you very much. Thank you, Kostas, and thank you for organizing this panel. Indeed, I thought we should have, as part of this track, kind of a discussion that reflects the collective experience here of some of the folks who have been working in this area for a long time. So I'm delighted to be here with my colleagues, with Eric, with Pat, with Kai, getting to hear from Susan as well. So a quick plug, I guess. Eric mentioned what some of the transit agencies are doing and rebuilding public trust. Our center has done a series of virtual roundtables. We have done 5 of those on the theme of reopening cities. 2 were dedicated to transit, 1 was dedicated to TNCs, and so on. All of those are recorded and are available on our website. So if you go to the Northwestern University Transportation Center website, you will be directed to these virtual roundtables, and they've all been recorded. We've learned a lot by talking to industry, and in fact, during this whole lockdown period, I have focused on learning from industry, whether it's in the urban side. Now, on the freight side, we did 9 virtual roundtables covering all modes of goods movement, technology developments, and so on. Those are also recorded. And so part of what I'm reflecting on, I guess, has been influenced by these discussions. So it's a bit more qualitative compared to, I guess, the information that, for example, Kai has had, which incidentally, Kai, thank you for sharing that information throughout, because I have quoted, your numbers many times, because again, that was, you were already collecting that information, and this has been a very useful set of data to track what is happening during the event. that. Of course, the question is, where do we go from here, and how do we extrapolate from these observations? And I want to caution, I guess, the sort of the trigger-happy approach, which is to say, well, this is what users did, this is what they said, therefore, this is what will be happening in the future. We may be measuring preferences, particularly stated preferences in some of the surveys that people are doing. But in reality, we're forgetting about the constraints. And we're in an environment currently which is driven by constraints, constrained preferences. And so unless we understand how these constraints are going to evolve, how they are going to change, we don't have a good enough basis for projecting what might happen in, in the medium to long term. And that to me is an extremely important element, which says that to really predict demand, you have to get a handle on supply. You have to understand what the e-tailers are offering. You have to understand that whole space of e-commerce. And similarly, when you talk about telework, we have to understand what companies are willing to go with. And I have some comments there as well that I'd like to share. But I want to share a couple of slides first, because I know in this discussion, we're not going to talk about freight. And I want to show a couple of slides, which are, I think, informative. Okay. Only a couple of slides, so it's not going to be long. All right.
Hani, we should talk about freight, because it's exactly what Eric was mentioning, that these are complex systems that are interconnected.
So there's a for those who may not be familiar with this, there is a company called FreightWaves. They have a dashboard called Sonar. FreightWaves is an amazing repository of essentially very real-time kind of data that gives you in every lane and market what the rates are, what the capacity is, etc. They have all kind of indices that you can plot. And this index here that I'm showing essentially captures the volume trend for freight in the US. It's an index called the Outbound Tender Volume Index. And if you look at the blue line, okay, the blue line is essentially the current value of the index. And through that, you can really see the whole pandemic issue. And so looking at the March, April, you can see this huge spike. What was that spike? That's the PPE demand. This is the hoarding demand. This is the toilet paper demand. This is the Lysol demand. You could see this huge peak here that we observed in that period. Then after that, it dropped. That's when the demand was starved, basically. And then look at where we are now. Look at how it's increasing. In red is the same index a year ago. Okay, so it shows you where we are in freight relative to a year ago. And that's an indication, in a way, of where the economy is and what kind of activities are taking place. Now, so if you look at the sort of the trucking side, you could see that increase. Now, another indicator that I think is interesting here, this is called the tender reject index. This is when you call a carrier and you say, I have a load, and then they reject it because they don't have capacity or it's not a load that they want to take. And this is for different categories of equipment. And what you could see here, look at the red one, for instance, again, during the period of the PPE, etc., this huge spike of essentially saying, I can't move it. I don't have the capacity to move it, rejecting a lot of loads. And then it again dropped. People were taking almost everything. And then you have this increase that is now continuing, again, in terms of rejection. So that's another indicator of what is happening there. Okay, so that's really all I'm going to share in terms of these slides. Now, if you look at, so what we've learned from industry is that trucking is doing quite well. Thank you very much, particularly for domestic trucking in the US. But if you look at the ocean side, for instance, there was a drop of about 15 to 20% during, particularly because things were not coming from China anymore and patterns were changing. But I talked to the administrator of the Panama Canal, talked to the director of the Port of LA, and both of them said, really what we're seeing is the impact of global trade disputes. Okay, what we're seeing is that there is reshoring, etc. The whole, sort of the global supply chains that may be adjusting. And so what we have here is not just a COVID effect. This is a structural change that has been already going on that now has been accelerated. And so as we are trying to, I think, extrapolate, it's very, and there's a danger in extrapolating from a disruption. We've all lived through disruptions, 9/11, etc., earthquakes, and it recovers. The time frame may vary, but we recover in some way or another. But where to extrapolate from an adjustment, we have to say, are these adjustments accelerating structural changes that were already underway? And if they are, then we have a basis for projecting. And I can give you 5 examples here, 5 areas, okay? I've already alluded to global trade patterns, okay? In terms, and many will revert, but we're already, again, seeing shifting sourcing from China, let's say, to Vietnam, to other parts, some nearshoring to South America, etc. This will continue. This is not exclusively a COVID issue. A second area, of course, is e-commerce. Okay? If there is a winner in this whole thing, it's e-commerce. I mean, e-commerce is the absolute winner. All of the companies that were omni-channel from the beginning, that were exclusively e-commerce, their stock has doubled, tripled, and so on. And we see the volumes. People, grandmothers who had never used e-commerce are all now ordering. They have Amazon Prime and so on. But if you look at e-commerce versus retail, that was by no means in equilibrium. That had been shifting and evolving, and e-commerce has been getting stronger and stronger, and conventional retail has been changing, becoming more experiential, becoming omni-channel to kind of capitalize on digital. That will continue. This has definitely been accelerated, but I would not write off physical retail being experiential. The first day that Lululemon opened in downtown Chicago, there was a huge queue of people waiting to go and buy whatever Lululemon happens to be selling, which is comfortable clothes. So it's not going away. Will we still have Black Fridays? Probably, but definitely the structural adjustment has been accelerated. A third area is transit. Of course, transit has suffered a lot in this area and will probably be one of the last to sort of recover to the extent that it does, or it might. But we had been in a structural decline in many cities of traditional transit, mostly because of TNCs. And so what we may see is a different alliance between TNC and transit, and a different rationalization through mobility as a service. That's a good thing. That's something that was happening. Now may be the incentive for it to happen, lower overall cost of mobility and improve that mobility. A fourth one, livable streets. We've been talking about livable streets, regaining the public space for years, right? Walking, bicycles, etc. Now it's being done because there are no cars. Some of that will stick. That's a good thing. Again, that's a that's been an adjustment there. And this brings me to work from home. Okay? And it's going to sound like Mitt Romney because I'm going to oversimplify what the world is like here. Okay, so there's 4 categories of activities or workers, if you want to call it that, that has relevance to how we project from here. You have those who are actually producing things, okay? If you produce things, physical things, you will have to be there. You're essential, right? And in fact, about 35 to 45% of the economy in the US is actually productive in terms of producing things, and those workers will have to continue to go to their factory or whatever it is that they need to go to. You have those who produce services, okay? Those have had issues because they were subject to lockdown, etc., and so on. They're also fundamentally essential because if people want that service, yes, they can come to your home, give you a massage, but if you want to have your nails done or whatever, you have to go to that particular salon. That will adjust essentially over time. A lot of it has adjusted, but those are also essential. Those are physical. You're not going to have that done remotely. So that brings us to the sort of the office side of things. Again, 2 types of people. You have knowledge workers. knowledge workers have been untethered for a long time, and we all know that. University professors are an example. We teach, we are there, we interact physically, we like that, we like conferences, but fundamentally, a lot of the work is untethered. We can do it in many countries and so on. Some of that may have accelerated, but I don't think in any major way, because it was already happening. A lot of folks who work in the investment world, and again, higher level interactions, they have been untethered for a long time. So the new thing, I think, in COVID has been the kind of production staff, let's call it admin level staff, people who generally are not the ones who come up with the ideas, people who are usually given tasks and they produce them. They work on those tasks. And I think the verdict is out there. The structural trend there has been, all of that has been outsourced historically. Right? A lot of the work that was office busy work, insurance claims, etc., is in India, is in South America, is in lower cost areas. So cost has been driving that. Now what we're seeing, we have taken those who are still paid a good salary, and we're telling them, you are not essential, you can stay at home.
That's right.
If that trend continues, they're losing their jobs. Those are going to be outsourced to lower cost areas. That's my prediction. And so people better want to go to work, frankly, because if the structural trend continues, they will be outsourced. If everything they do can be done remotely, I believe they will be outsourced, unless they are in the creative knowledge class or capitalist class, if you want to call it that. Either the capital of ideas or the capital of money, essentially. And that's my Mitt Romney simplification of the world. And I'll
All right, thank you, Hani. That's very interesting. Now I know why you want to have a panel, to steer the pot and go to a different direction. Great, thank you. And I will go to Pat, who I suppose you are in Atlanta, right?
I am, and I'm working from home, of course. So let me share my screen, because I do have, how am I sharing my screen?
You went to Texas.
What's that?
You went to Texas, I see.
No. Okay,
no, I can see. Yeah.
Okay, great.
Perfect.
So I'm going to, thanks, by the way, for the invitation, and thanks to all of you who are joining us online. Very interesting discussion already, and I'm sure it will get even more so. I am going to confine my comments to teleworking, since that is a subject that I have been thinking about for a number of years, and of course all the more in the last few months. So some of what I say will echo things that we've already heard, but there are thoughts that have come to my mind, including in the last day when we were listening to the very interesting presentations yesterday in this COVID-19 theme, but also before that. So just making a few points here. Number one, details are important in this case. I know a lot of people want to gloss over details, but when it comes to teleworking and working from home, you really have to know how it's being defined, at least if you care about the transportation impacts, because there are all these different flavors of working from home. Salaried employees, sure, they probably reduce travel on net, although even that's disputed in some research. But if you're talking about checking email at home on evenings and weekends, you're probably not doing diddly to transportation. Now, if you work at home part of the day, and then go into the office in the afternoon. Maybe forms of work from home are actually ambiguous, at least in my mind, with respect to their transportation implications. So it depends on what you would have done otherwise. And then if you want to define telework even more broadly than working from home, then some forms of teleworking, notably working while traveling, field work, at least reduce barriers to traveling, and at most probably actually increase the amount of travel that's being done. So it seems to me that here, more than usual, it really matters to define what you're talking about when you talk about telework or working from home. The second observation I want to make is the self-selection bias, and I think Hani indirectly at least alluded to this a few moments ago. you know, we tend to want to extrapolate from what the pre-pandemic work at home looked like. And these are people who, for the most part, have opted in, you know, before the pandemic. And so, of course, they're self-selected to be pretty effective at it, to enjoy it, to want to do it. What we have now is a whole bunch of people who are thrust into teleworking, whether they like it or not. And there's no guarantee that they will feel the same about it or will want to continue it in the same way after the pandemic is over. I think of Hani's, you know, administrative staff and so forth. They may be much more likely to have distractions at home, smaller homes, you know, less inclination to want to work from home, at least as much. Now, of course, some of the people who are doing it now for the first time or doing it much more than before are going to take to it very nicely and enjoy it, want to keep doing it. But when we do see hesitation or, you know, well-being ratings that are less than stellar, I wouldn't jump to the conclusion that, oh, well, what we need to do is give them more space, or, okay, they're telling us distractions are a problem, so somehow we just need to give them a bigger house with more rooms, or what they need is better Wi-Fi connections. Not necessarily. Again, some of those people will actually continue to not thrive under teleworking. And in fact, some of my own early research suggests that stated desires to telework may be relatively soft. And again, Hani alluded to this, there are certainly a lot of constraints that people may not be taking into account when they say, yes, I want to telework. In one of our studies, we looked at people who can telework, that is based both on their job content and their management willingness. So they were able to telework on both of those counts. And they said they wanted to telework, and yet they were not. 37% of those who could and wanted to were actually, only 37%, excuse me, of those who could telework and wanted to telework were actually teleworking. So how can that be? Well, it suggests to me that when we see that they can telework, and particularly based on those two factors, job and management, there are lots of other factors that may be preventing them from actually doing it, including perhaps some self-introspection that, yeah, I don't quite have the self-discipline that I need, or some of these other external issues that we've talked about with distractions at home and so forth. So I think we do need to be careful about just taking for granted what people say they want to do. Some of you might have seen this in some presentations I've been making frequently in the last few months. This is my going out on a limb, putting together both what I've been talking about here and a number of other factors that we don't have time to go into right now. My own prediction, if you will, or prognostication about where we're going to, quote, end up when we get back to, quote, some semblance of normal, is that we're going to be much closer to where we were before the pandemic than where we are now in the middle of the pandemic. And so I think with a fairly high probability, we will, of course, see some residual increase in teleworking. That just stands to reason. But my guess is that it will be much closer to the left end or the lower end of the scale than to the upper end. But another thing that I've really realized in the last few weeks is that everyone's predictions about what's going to happen afterwards can be right. So if you think about the example that we just saw, putting actual numbers on them, and these are real numbers with respect to the share of the workforce that usually works at home, the 5% is based on the American Community Survey commute to work data. The 50% is based on a, basically best guess, but putting together a number of fairly reliable polls on how much is going on during the pandemic. So we have kind of the lower end of 5% during normal times, 50% of the workforce working from home usually, okay, during the pandemic. So what if after the pandemic, we're back down, if you will, to 10% of the workforce working from home usually? Well, if you want to be a skeptic, you can say 90% of those who began teleworking during the pandemic stopped once things return to normal. So I told you so, you know, it was basically back to business as usual. But it would also be perfectly accurate to say the share of employees who telework has doubled from before the pandemic. It went from 8% to 10%. So, you know, framing really matters here. And, you know, here's another example where the numbers are quite a bit more hypothetical and unrealistic, in fact. But it could be the case if that 5% of employees telework before. They do it an average of, let's say, 1.5 days a week before the pandemic, which is about right. What's probably not going to happen is that this, you know, 5% will continue to telework once we've reached a new equilibrium, but that now their frequency has doubled. Okay, so again, if you want to be, you know, skeptic about it, you can say the share of people teleworking is back to pre-pandemic levels. Only 5% did it then, 5% doing it now. Or you could say the amount of teleworking has doubled, right? Because those same 5% of people are now doing it twice as much as before. So that's another reminder, incidentally, that frequency is important too, not just adoption, at least again, if you care about transportation impacts. So bottom line for me is any study you read on teleworking, read the fine print. You know, how did they define it? Ask skeptical questions about what it means and look at the results from multiple perspectives. Well, yeah, the authors are presenting this perspective, but it could also mean that. And, you know, as academics, it's perfectly all right for us to have a preferred perspective and one that we think is the best way to look at something. But I think as good scientists, we should at least entertain that there are multiple ways of looking at the same facts and perhaps even present some of those multiple ways of looking at the same facts. And then just in case there's anybody out there in the universe who hasn't yet done a survey on teleworking during the pandemic, I would strongly encourage you to think about the definitions of these different flavors of teleworking that we've talked about when you're asking respondents about their adoption. And also then to think about asking something about the frequencies of engagement. And if you do it for each of these various flavors of teleworking, it gets to be a long survey, but think long and hard about what's important for you to know in the end. And I want to say that even after you've decided what forms of teleworking you want to ask about and how you're going to define it, you still need to think carefully about the question wording because the respondents aren't necessarily going to interpret your questions the way you thought they would or intended them to do. And then for everybody, even if you've already done your own survey, and we've heard a lot of great survey research in the last day here, think about the representative of your sample, representativeness, and not just on those demographic traits that it's easy to weight the sample to control for, but I'm always worried about selection on unobservables, as the technical term goes, selection on attitudes or lifestyle orientations and so forth that you can't quite capture with demographic characteristics alone. And then think about using analysis methods that will account for the self-selection issue that I raised before. So I think we have a lot of information coming in now about what people are doing now and what they say they want to do in the future. But I think we also need to keep thinking about the best way to interpret that information. So that was my thoughts, and I'll stop.
All right. Thank you, Pat. Very, very. Of course, I was waiting. I was expecting you to talk about teleworking and all the definitional issues. And that was very, very insightful. All right. Susie, what do you think all these transportation people are doing? What, are we framing the whole thing right, or are we out of our minds?
It's great. I mean, there's so many different ways to think about the issues that have been raised in regards to health. So I'll just chat for five minutes or so with some of my ideas and then some responding to some thoughts that some of the panelists have already mentioned. Okay. If that sounds like a good plan.
Sounds great.
Okay. So I guess the first thing I wanted to mention is just to bring up the idea of what is health, like how do we measure health and what are the health impacts of coronavirus? So I always like to think of health as a continuing property, right? It's not just do you have a disease or not? It's much more dynamic than that. It's adaptive, and it really has to do with how somebody can respond to multiple insults or multiple, and insults I mean like a virus or chemical insult or a social insult, and how someone is resilient to that. And that resilience is really a consequence of lots of exposures over time and space. So it's important to think about health in a more broad conceptualization. So if you think about health that way, you can think about health impacts of coronavirus in 3 different ways. First is, of course, being a direct impact of coronavirus. So either, of course, getting sick and potentially dying from that illness of SARS-CoV-2, or there might be long-term complications like scarring of lungs or something that could be a direct result of coronavirus. But there's 2 other really important ways to think about it. One, or the first other way is an indirect effect. So other causes of death that might not be treated because of COVID-19. So usually if someone, gets sick from a disease, I don't know, or breaks a leg, they go to the doctor and get treatment. But in the day and age of coronavirus, either someone is scared to go to the doctor or can't travel to the doctor, otherwise might have a death or an illness that normally wouldn't result the same way. So that's an indirect effect. But then the one I like to think about the most are these downstream effects. So social, emotional, economic, political, or other disruptions from COVID-19 or a response to COVID-19 that could lead to kind of a delayed, magnified, or recurring poor health. And this is the one that's hardest to measure. This is the one that might have the most heterogeneity in exposures, like who are the people who, like Hani was mentioning, who are the workers who have to go to the fields or the factories, and how are their exposures different? Who are the families who have poor remote learning because of technology, or crowded households, or don't have enough food to eat, so that they can't learn as much? And then that will, of course, have long-term recurring unequal health impacts. So that's just the baseline I wanted to think about. And then I was thinking about like the SEIR models that Eric mentioned. So we can think about travel and kind of how that affects the transmission of an infectious disease like COVID. So the basic way to think about an epidemic model is 3 components, right? Number of contacts somebody has, the probability of transmission given a contact, and the duration of disease. You put those 3 things together and you multiply them, and you'll see what the magnitude of an epidemic might be. So contacts, right? How many contacts does somebody have? That is a function of their job, of their ability to socially distant, or their inability, right? How many people they come into contact with, if they have, have to go work in a crowded factory, or if they can telecommute and work from home, and like I am in the kids, playroom. And then the probability of transmission given contact, that can get really complex and heterogeneous as well. Does someone have the ability to wear a mask or to protect themselves given that they have a contact? Is it a political issue? Are there different types of people who are willing or not willing to wear a mask? So you can put that into these models as well. And then, of course, the duration of disease. This one, of course, the average duration of infectiousness of coronavirus can be estimated. You can put it in a distribution and put it in the model. But somebody also might be more infectious or less infectious depending on the type of care they might get, or how their ability to go to the doctor and understand that they're sick, and maybe that can be thrown into the models as well. So that's one way to think about the movement of people and how that affects the transmission of an infectious disease. But I also really think it's important to think about these other social determinants of health and how that affects coronavirus and transmission. So, things like neighborhood and physical environment, housing, education, food, social community context, those are all things that have long-term and lasting implications for health. And often these are the things that perpetuate disparities in health by race or socioeconomic status. A couple of really thought-provoking questions that I heard are, what would the potential decentralization of cities look like for health of populations? And not all of these are negative, of course. I don't know if I'm a pessimist, but I think about maternal and child health and how people aren't going to get vaccinations and how these are going to have long-lasting negative impacts on health. But maybe some of these changes in land use where people are riding their bikes more, interacting more on streets that have been switched around, that might have good implications for social capital, community context, could have long-term positive impacts on health. One of the things I found really interesting in the news, and I don't think we have the answer yet, but across the globe, we've noticed that the preterm and low birth weight births have significantly reduced during these coronavirus times, which is perplexing because, first of all, this is one of the biggest disparities by race that we see in terms of low birth weight babies, especially with Black mothers and white mothers. And a lot of the reasons for this have to do with like racism and stress and changes in cortisol and blood flow. And of course, coronavirus can be very stressful. So it's interesting, what is it that is driving across the board declines in preterm birth and low birth weight? So there might be some positive impacts as well that we can think about. There was one other point I wanted to make. What was it? Positive effects, yeah, social distancing and reallocation. So yeah, I just wanted to end this 5 minutes just of my thoughts and my rambling about how a lot of these implications for health, whether it be ability to social distance, ability to travel, how people interact with others over space and time, how that might have these disparate and unequal impacts, positive or negative. So I guess that's it. Thank you.
I'm back. I lost the connection for a second. Sorry.
My internet's been really slow too, so I was worried I was frozen. But
no, electricity went down and my Wi-Fi went down, so I connected with my phone.
Okay.
There's always redundancy in our system. This is great. I can follow through what you were saying, Susie. Thank you very much. So I have a couple of questions, and they are related to what our panelists said that maybe you want to entertain. One of them is, we all talk about everyday travel or everyday life and how people use their time and how they are willing or not willing to change the way they used to do things before COVID. One of the behaviors that changed dramatically by the constraints imposed to us is long distance travel. And this might be related to what Hani was talking about, which is the replacement of globalization with regionalization. In essence, there is an Asian market, an American market, a European market that becomes more active as borders are built with tariffs and tariff wars. But the same might happen to people moving, flying from one place to another, and the nature of business is changing. So we did not talk about what does it mean for long distance travel. This past weekend, I crossed airports, it's a completely different experience than in the past. Yet,
I think,
yeah, go ahead.
All I can report from the Swiss data is that the activity space, so a measure of the range of travel, is still down to some extent. But it is kind of 90% back where it was before. And because we are tracking every movement, we see that long distance traveling is starting to happen again. Clearly, the Swiss situation is that the borders to all of the neighboring countries are open, and people are traveling for their holidays and for visits and for hikes and for meeting friends again. What is obviously missing is the intercontinental trips, because there's a constraint, as Hani pointed out. If you can't travel to Japan because the Japanese don't allow you in, you don't travel to Japan.
So the long distance travel in that case, from the answer you gave, Kai, is maybe the 50 or more miles in the United States or 100 or more kilometers.
That range inside the country and beyond is happening.
And in fact, we see also vacation being done by car, and families go on their own instead of picking up a plane and going to from California to, I don't know, Atlanta, I say, or the other way around. But business travel is down by a considerable amount. You can tell from the airlines that are parking their airplanes, but it goes back to what Hani was saying. Maybe these are trends that existed before, and they are, everybody, all of you said, and maybe they are accelerated. The pedestrianization, the different nature of commerce, maybe the globalization of the labor force, or maybe the automation of some tasks of the non-essential workers not going because they are automated and they are out of the labor force. So we see an acceleration. Do we see an acceleration of trends that they started with, of course, the caution that Pat told us that, we will go back to normality as normality was conceived before? Is that what we see? And then, actually, Susie is pointing out that maybe, again, along Pat's also direction, are we measuring the right things? For example, equity and distribution of justice. Maybe some people will be impacted in a negative way, some others in a positive way, and the spectrum of impacts is very wide depending on your situation. Well, so many of us. Go ahead.
Okay, if I may address sort of both of these. And incidentally, on the issue of business travel and particularly air travel, there was an article in the Wall Street Journal yesterday where they had interviewed a lot of sort of former airline executives, and they were kind of giving their speculative predictions. But essentially what they were predicting was that for business travel, that yes, there will be a reduction because of some of the telework that is going on, and which is again accelerating a trend that we had seen previously. I mean, companies had been trying to control the cost of business travel. The federal government for many years has stopped sending people places, to conferences, for example. Have been using webinars for ineffective ones, I would add, for many years. But I think, like everything else, things will adapt in that realm, and some types of business travel will not happen, but other types of business travel will happen. That's the complementary aspect that Pat had been sort of documenting for many years. Exactly what kind will be happening, I'm not sure, but it probably will reemerge. On the other hand, what they're predicting is booming personal travel. And indications are kind of beginning to appear, at least again, sort of domestically. I mean, I've seen pictures in Europe of Ryanair flights being completely full, for instance. In the US, the TSA data at this point is right at about 850,000 kind of scans per day compared to about 2.5 million on the same day a year ago. So it's still, you know, quite a ways to go, but it has been trending upwards. This is domestically. Now, on the other, on sort of the more kind of discretionary travel for recreational purposes, you know, I went out on a limb in March on Facebook, in fact, and I right as the lockdown was beginning, and I said, I predict an increase in recreational discretionary travel. You know, that VMT will increase, and my respected colleagues all laughed at me. Well, you know, kind of very politely said, "You're out of your mind. That's not going to happen. All travel is coming to you know, is going to shut down." And sure enough, if you look at the you know, of course, you look at CHI's data, but also if you look at Google's sort of community activity data, yes, work travel down, you know, between 33%. If you look at recreational travel, it's up by over 100%. And
yes.
Pat mentioned this yesterday with her driving a lot more. I mean, anecdotally, of course, but there is clearly data that is indicating that people are, you know, that desire to sort of get out, the cabin fever, is being manifested, and so that evidence, I think, is there. Air travel, I think, as the constraints get removed, there will be more and more people going back to flying. Now, there's a fraction of the population that is in mortal fear, and they will not travel until, you know, there are 5 vaccines and 10 therapies, and then they will travel. And that is different. But I think if you look at the sort of overall numbers sort of recovering, there is clearly, I mean, I'm amazed. I talked to friends of mine who are flying from, you know, Dubai to Los Angeles. How can you do that? Say, yeah, we quarantine here and we quarantine there. And it's like, and we test before flying. It's like, oh, wow. Okay. So, I mean, you know, yes, people are traveling.
Yeah.
I think one point, though, is that, and we see this a bit in Switzerland, is that in terms of longer term development, lots of people in Switzerland, because there we were never completely locked down, experienced and their own country much more than before. So I think there has been an increase in the set of known places, and I think that will have a longer term impact, but it might not be really all that revolutionary.
Yeah. They turn inward for a while and then go back. Eric, I think.
Yeah, Kostas, yeah, again, on sort of both points have been raised. In terms of the international travel, this is a bit of more of a request for help than hard information. We've just started a project with Transport Canada looking at passenger car travel across the Canada-U.S. border and trying to look into crystal balls and project how that might change over time. I think everybody knows the Canada-U.S. border is officially closed except for commercial good movement and very essential travel, and so the bridges and tunnels, etc., have been devastated, as with everybody else. So I think some of the comments about air travel may apply. But I think the border crossing is a very complicated one. In populous border areas, there always has been a huge integrated economy across the two countries, particularly along the Niagara River, between Canada and Buffalo and Niagara Falls, and then the Windsor-Detroit area, and similarly out in the west with Vancouver, Seattle sort of thing. So there's commuting traffic that goes across there in terms of people live on one side, work on the other side, but also obviously a huge commercial traffic, but also just business travel back and forth, and tourism. I mean, tourism is huge, particularly for the U.S. coming into Canada historically. So similar to Hani's comments, I think that the question is, I mean, nothing's going to happen till the border reopens, and the border's not going to reopen anytime soon. But once it does, the question is, well, to what extent will American tourists, for example, start coming back to Canada? it's interesting, after 9/11, it never really rebounded to the same level. I think that it existed before, but that reflected the fact that Americans had to have passports. Anyways, I think that's the if anybody has any data from your side of the border relating to people driving into Canada or vice versa, I'd be interested in hearing about that. The other thing, though, I want to pick up on is, Hani talked about accelerating structural changes, or, where are the big changes? And I think Susan and both also mentioned, and Kostas, the issue of equity. I mean, certainly here, and I think it's been the same in the States, the pandemic has really, really brought to the forefront the inequities in our economic system, in our social system. We have sort of an echo of the Black Lives Matter issues, which are very paramount, but just in general, low-income workers, low-income households. I think we're seeing a huge call for change here, and that this may be, the disruption may lead to, very different social organizations and actually trying to invest in things. And again, the interconnections. We don't have a universal daycare policy in Canada, but people have been talking about this for years and years and years. And one thing that the pandemic has illustrated, and who's been laid off, who can work at home, who can't, is the impact on women in the labor force. Without things like universal daycare, it's going to be very hard for women to return, and continuing school problems, it's going to be very hard for women to return to work, even working at home. We've had people at the university take leaves of absence because they can't cope with working a full-time job at home with, their 2-year-old and their 4-year-old running around. So I think this is another example that there could be structural change. Maybe has already been going on, at least people talking about this, and this is an opportunity to really change that. And that'll ripple through some of the, from a transportation point of view. Then the final thing, I'd just like to pick up on Susan's issue about decentralization. I think this comes back to some of the things I was talking about in terms of impact on the downtowns and so forth. I mean, to me, the COVID is a direct attack on cities, because cities exist to bring people together and interact. And that's why we do centralize in the office buildings downtown. That's why we do all come together in bars and pubs. That's why we do get together to innovate. And so I think we have to be very careful about what a decentralization would look like, not just in terms of consumption of land and again, just, making transit that much more difficult to use, but also in terms of innovation. And I think, again, talking about the work at home thing, I think companies will discover that there's still advantage to bringing people together physically around a conference table to brainstorm things. I know the tech companies do a lot of long distance working from home, but certainly in the university setting, I can't wait to get back to where my grad students are sitting across the table from me and not just staring at me through one of these Zoom screens. So I think I agree very much with Pat's assessment of the work at home, that I think people are going to gradually discover, you know what, it's maybe even worth spending a little time in congestion to get to work, because there's many reasons why that might be a good thing to do.
Yeah, actually we knew quite a bit about telecommuting a long time ago, that some of the barriers are internal and external to the workers. The loss of opportunities when you don't go to the office, the management style. These are themes that come back with COVID-19 again and again. I have one more question about for the panel, that is again about acceleration of trends. Quite a bit of data, including the National Household Travel Survey. If you do the analysis with an eye towards the work location of people, you will find that quite a bit of persons that work either part-time or full-time do not go to work at the same place during the day. It's one-day diary, and they go from place to place. And they are not salespeople, and they are not movers, and they are not working for UPS. So there is quite a bit of literature that says now we have flexible workplaces, or ubiquitous. We have the nomad, the worker nomads, or we are all on this call, on this panel. We have done that. We travel to conferences, we go for projects across the world, we go to meetings with customers, and we do it naturally, part of our job, you know, to go to different locations of people and work with them on research projects. But apparently, this is happening in some industries that are not, you know, plumbers and electricians and salespeople, but are services that can be done in different locations. Do you, and that this is related to the epidemics, because if you go from place to place and you are COVID-19 positive, you're going to spread the disease much more than if you go just to one place where you're checked by your employer. What do you think? What do we know about this?
I think in our data, the COVID data is based on a study we did in the fall where we tracked 3,700 people for 8 weeks. And yes, we had people who had clearly visible multiple workplaces, but the overall share was small. I think what is actually more important, I think, in terms of disease spreading is if somebody is ill but doesn't know it yet, joins a pub crawl and shrieks and shouts in small spaces for a whole evening. If the same person joins the choir in his church and spreads out the disease.
Wow, Kai, that's a disaster.
But I think the point is that these to spread, there are two things. You have to have the ill person, you have to have the other persons in a confined space for a substantial length of time. That person who works an hour here, an hour there, with lots of space around her, she will probably not be as problematic as if she were sitting in a shared office space and share her viruses with all the others sitting in that.
Yeah, but Kai, you know the example of the Edge, the building Edge in Amsterdam, which is a shared space by many people. And thinking about Susie's definition of the continuum of disease, it's not just COVID-19, but it's a variety of other diseases that can be spread. We are moving towards the flexibility of a workplace, shared workspace, right? Is COVID-19 going to accelerate or decelerate this? It's the same. It's a very, very similar question to transit. We will avoid being crowded in places. We might avoid sharing facilities because we don't know how clean they are, right? And it is also the same reasoning that people use that we will return to the single occupant vehicle commuting even stronger, because we can clean our own car and take it from our garage and park it in our employer's garage. Are these forces changing things? And this is also related to urban sprawl. Maybe we will seek less dense areas with the excuse of COVID-19 and crowdedness, you know, against the city, as Eric said. Are these forces we see happening? People moving to bigger places outside the city, commuting alone in their car, avoiding public transportation, not going to multiple places to work. Is this happening? Do we think it's going to happen? And this is speculation, of course. You know, the data today don't show all that. What do we think?
I'm not an expert in transportation, but I just wonder how quickly our collective memory will decline, you know, of like how bad it was to be scared about getting sick, or we know friends who got sick, but then a vaccine comes out and we're quickly like, oh, okay, technology will fix that. Let's go back to these creditors. I don't know. I mean, it's interesting to think about.
You know, after 9/11, people said, oh, who wants to live in the target-rich environment of Manhattan? And, you know, it's the death of, you know, CBD, central business districts everywhere. And yeah, there was some that left and never came back. But so I think everything you're describing, Kostas, will happen. The only question is how much. I mean, anecdotally, again, people are reporting that suburban homes are being snapped up within a day of being put on the market and so forth. So yeah, it's definitely happening. The question is how much and for how long. And again, I think Eric alluded to all the reasons why, being together, the agglomeration economies of density haven't really been repealed despite all the technology. And so it's still going to be desirable to live with a bunch of other people.
And in fact, when you go to the bars, when they open lately, they're crowded.
Choirs, on the other hand, not so much.
yeah, choirs, no, yes. So Kai, sorry, there will not be any choirs, but bars will survive, I guess. We have about 8 minutes, I think, if we are to stick to the time. Any closing comments? We did not have any time to take questions from the audience, although I looked through the chat questions, and apparently we have covered quite a bit of them in a different way. But shall we go in reverse order from Susie back to Kai at the end, if you remember the order? Any closing comments in the next 7 minutes? Susie,
I really appreciate some of the comments, not just about equity and who's moving how far and what the context of those places are in which they're spending time, but also the spatial configuration of, where someone's working and how dense those places are versus the ability to separate for the duration of time, like being able to interact with someone for a little bit and then go back home. So it's both the spatial scale and the temporal scale that's really important for risk of infection and the spatial spread of disease.
So the duration of the exposure, in essence.
Yeah, right. The time
Thank
and
you.
the space.
This is wonderful because it helps our activity-based models that some of us are advocating for a very long time.
Yeah, time of course matters a lot.
Yeah. Thank you, Susie. Pat?
Yeah, just to reiterate what we've already touched on, that is, for me, the fascinating thing with any major disruption like this is where in between the status quo ante and the disruption height of whatever change was forced on us, where will we land when we get back to, quote, normal? And I feel like we're always either jumping on one extreme or the other. We're either proclaiming that everything's changed now, that it's all different, here's what's going to happen. And then there's others who say, we've seen it before, it'll all go back to the way it was. And neither of those things are true. And it sort of matters how, where in that continuum we fall. And I don't think we're very good at predicting that at this point. But to me, that's really the question. We can all say, yeah, it'll be in between somewhere. But, that doesn't really help very much.
Yeah, actually, your comment reminds me something that Hani said a long time ago, that maybe we are facing multiple equilibria. So maybe we will have temporary multiple equilibria as we hop around these different scenarios, that different people will be able to reach those. So, Hani, you are next for your closing comment.
Don't underestimate resilience of people, I think would be my closing comment. I think people generally are resilient, and I think resilience will get people through a lot of the disruptions. But the one point that I think is important that Eric alluded to, really cities exist for a reason. Cities have emerged because they're an efficient organization of space of activities. You have all the sort of central place benefits of culture. None of that is going away ultimately. So yes, again, as Pat said, some will move away to the suburbs because maybe that's what they wanted to do anyway. But the trend has certainly been one of returning to the cities, making them more vital. And I think that structural trend will not be appended. Maybe it's delayed, maybe it'll transform a bit, but ultimately it's going to continue because that's the efficiency model. The other thing to keep in mind as we perhaps contemplate multiple equilibria is, where do we want to be? I mean, this is really the part of intervention. This is an opportunity to also guide, I think, how the system might evolve from here. So there's just ideas to throw out that will keep us probably busy for the next few years.
Yeah, decades. Thank you, Hani. Eric?
Yeah, just agree with Hani's last comment. People talk about a new normal, and certainly here there's a lot of talk about, well, maybe that new normal shouldn't be the old normal, and that we can help guide it. So the challenge to all of us, I think, is how do we help identify what that new normal should be and help policy provide guidance in that respect. Just the other comment is that I talked about activity-based. Yes, but I think one of the real challenges, I think, is so much of the spread is actually due to hotspots. 80% or more, I think, of the deaths in Canada occurred in long-term retirement homes, where things just went in and spread and just went crazy, and the low workers, very low income workers who here in Ontario, often they're treated as part-time employees to save money, so they worked in multiple nursing homes and they just spread the disease from home to home and then within their own social networks. Similarly, meatpacking plants, there have been certain types of industries where people are working very closely together. Migrant farm workers in southwestern Ontario. So, I think, if we had a much better handle on this, I don't know how we will do it, tracking and so forth, arguably we might not have had to shut down the entire economy if we could have had a much more focused policy of identifying and containing hotspots. So, I mean, maybe that's an area for research going forward, not necessarily transportation, but it's kind of an activity-based idea.
But also services, pay attention, the healthcare, focused healthcare independently of insurance, or I don't know what's.
Yeah, although at least here, I mean, we were very badly hit in Toronto by the SARS epidemic, and that was almost entirely a hospital-based event, and in fact it didn't spread. We didn't get community spread. So this time we were really prepared and had the whole focus was, let's not overwhelm the hospitals and let's protect the healthcare workers. I mean, a few have gotten sick, but by and large that worked because we knew how to do that. But then we were caught by surprise by new things.
Yeah. Yes. And Kai, you got the very last minute.
Okay, I think picking up on Eric's point, I think to identify such hotspots and such people traveling between different hotspots is a major challenge for all activity-based work. And I'm pretty sure you and your agent-based modeling of the spread and Kai's, Nagel's work and my upcoming work, we will have to focus on just getting that right and modeling that. Now, on the other hand, I do believe that it's most likely that COVID will turn into another serious influenza. And just like we had serious influenza epidemics every 2 or 3 years, killing quite a substantial number of persons, we'll probably see COVID turning into something similar, managed to some extent by treatment, some extent managed by vaccines, valid for a year or two. I think we will just integrate that resiliently into everyday life. And that is, I think, my expectation and my best hope, how the system will stabilize.
That's very positive, very nice. Okay, so thank you, everybody. This has been fascinating. It's I know we we have a couple more decades of research work in front of us, but thanks again. Thanks to the organizers that set up this panel, and enjoy the rest of the conference. I think it's going very well, and I will turn off this And go join the party at my house.
For managing this. Thank you. Bye-bye.
Bye-bye.
Cheers, everyone.
Cheers.
Thank you. Bye.
Bye.
All right, so welcome to, I think, what should be a very interesting session. My name is Ram Pindiala. I'm a faculty member at Arizona State University in the School of Sustainable Engineering and the Built Environment. And I have the distinct pleasure of moderating this session, which I think really brings together two very interesting domains, both the transportation modeling domain and the epidemiological domain, thinking about how transportation contributes or could help inhibit the spread of COVID-19 or any disease of that nature. Transportation has certainly been thrust into the spotlight in the context of COVID-19 because transportation is seen as a potential vector for disease spread. Both in terms of the actual act of traveling, especially if you're in a shared mode of transportation, as well as at the activity location where you spend time and potentially interacting with others, or you're in the vicinity of others. And so both activity engagement as well as travel itself can serve as a vector of disease spread. So in that context, there have been epidemiological models. In the previous panel, there was some discussion about the SEER model, which has quite a bit of limitations. And the transportation world has really stepped in with some very innovative work and models to try and better inform what might happen with disease spread through transportation and activity engagement. And so we will start off. There's 5 presentations in just about 90 minutes. So we will be efficient, and I ask all the speakers to adhere to time. I will not dwell on lengthy introductions. These are all very well-known teams doing great work. And so without further ado, I'm going to turn it over to our first speaker, Oded Katz with TU Delft.
Thank you, Ram. I will go ahead and share my screen. All right, it should work now. Good. So hello, everyone, and good evening from the Netherlands. So I'm based in TU Delft, and I will present work together with 2 colleagues of mine, Panchamy Krishnakumari from the same Smart Public Transport Lab at TU Delft, and with Kostas Gkiotsalitis from University of Twente. And as the title also suggests, epidemic modeling in public transport networks and capacity redesign. The talk will also be divided into 2 topics. First, looking into how indeed the virus may spread in mass transit. And obviously by definition, as the name implies, mass transit is exactly where contact tracing can be an issue, and also the transmission of the virus. And the second part will be devoted to how we can potentially also redesign our services to try to comply and accommodate distancing regulations. 2 disclaimers that I would like to make up front. One is that, as Ram mentioned, it's bringing together transport and epidemiological models. We are not experts on the epidemiological side, but we do see the advantages of going more detailed than the macroscopic epidemiological models allow for. And the second disclaimer is that recently, together with Alejandro Tirachini from the University of Chile, we have an review paper that looks into the safety and health issues of public transport with COVID-19. And the remaining of the presentation will certainly portray public transport as one where there are health risks, and that is indeed the case, but also there is quite some evidence by now to suggest that especially face masks can be have a great influence there, as we see from countries where mass transit and face masks go hand in hand without any outbreaks, but are being traced back to public transport. So this being said, I will go ahead immediately starting with the first part of the study that I would like to cover, which is virus spreading in mass transit. And both studies are in collaboration with WMATA, Washington, D.C. Metro Transit Authority, and available as preprints. The first one is looking into people movements in metro networks, in this case, Washington, D.C. network. And we are fortunate to have access to tap-in, tap-out data for all passengers in the Washington, D.C. network over a long period of time. And the smart grid data allows not only to, of course, charge fares and look into origin destination patterns, but also to, after applying a sequence of inference algorithms, including transfer inference and what we call passenger to train assignment. So identifying the train most likely to have been used by a certain passenger given the time at which you tap in at the time at which you tap out. Then we can superimpose all this information and obtain the sets of travelers that have been sharing the same train leg or have been waiting at the same time for a metro at the metro platform or have been transferring at the same place at the same time. So in other words, we can leverage on this marker data after subject to different inferences to compose what we call a contact graph. Thereafter, we apply a series of transmission assumptions. We had very little information at the start of this study. By now, of course, there is quite some empirical knowledge from medical research in relation, for example, to the impact of proximity on the transmission rates, as well as the impact of exposure time-wise on transmission rates. Then using epidemiological models and then applying different scenarios to test the extent to which the virus spreads in the network. So we'll quickly go through this, starting with going from smart grid data to the contact graph. So as mentioned, we have tap-in, tap-out information by assigning passengers to individual train itineraries. We slice the passenger journey into waiting time at the initial metro station, the sequence of legs or track segments that a passenger has traversed, the transfer location, and so forth, and the destination station. Using this, we can construct can compose a contact graph depending on the proximity that you assume to be critical. We can construct a graph where each node here is a station and a link indicating a passenger originating destined from a certain station that has been in contact with another one. For the smart grid data we have for a given day, that can reach in the hundreds of millions of such connections, or if you wish, one-to-one interactions within the metro network between two passengers being in certain proximity. When we look into the distribution or the histogram of a number of contacts, we can see that many passengers have a fairly substantial number of interactions, but there is also this tail of relatively few individuals with a very large number of connections or interactions, meaning that there are potential super spreaders in our network. So when we look into the four compartments, suspectable, exposed, infected, and recovered, which characterize viruses such as the COVID-19. And we're interested in identifying the probability of a passenger in this case to change state from suspectable to exposed. And doing this by looking into the product of these conditional probabilities, where in order to get infected, you have to be first in sufficient proximity to other passengers, and secondly, that one of these passengers which is in sufficient proximity is also infected, and then still there might be a chance of you getting infected or not on top of that. So there is a sequence of conditional probabilities there, and this applies to every single slice of your journey. So that applies for the time at which you wait on the platform, for the time you spend on board, on each individual segment, and so forth. And this has to be calculated over all first-degree connections in your contact graph. So all these people you have been in interaction with during your journey. So if we do this, then we have basically a transition matrix for people to change from one state to the other, from suspectable to exposed, and then the rest is dictated by the incubation period and the recovery period, and then you can make assumptions about whether passengers then become immune or not, and whether they get back to the system or not. So by applying this, what you see here is also the evolution of a network in terms of segments on which infection has taken place. So one passenger has been infected by another, and at some point this happens anywhere in the network, but then gradually it also recovers. You can also see here the typical kind of plots for different states as a function of a number of passengers which are initially infected. These are under very conservative assumptions about the transmission rate as a benchmark scenario. But you can see here in the case of about 3,000 passengers being initially infected, effectively all passengers traveling in the network are at some point exposed. One more thing I would like to highlight here is that it's not only about the share of passengers traveling. So if we talk about now reduction in demand as a consequence of all kind of shutdown measures, even when you have a scenario, for example, here with only 30% of the demand traveling, the consequences of which depend greatly on who are those 30%. So those are different instances of 30% of the total demand, but depending on where they travel from and to, and the time, that will of course determine the density of your contact graph and will result with very different consequences, some of which can be even worse off than some of the full demand scenarios. This methodology has also been applied to ride pooling contacts in Amsterdam with the same principle, looking into the contact graph between fellow travelers and riders. But I will now go into the second part of the presentation, where we move beyond characterizing how a virus may spread, even the contact graphs, which can also be potentially used for contact tracing, which is another interesting application, into how transit agencies which face these circumstances and now the need to comply with social distancing measures, how can they potentially adjust their services to accommodate that? So what we did here is, again, using the Wamara case, where we want to avoid this kind of situations, thinking how we can potentially reallocate resources to best cater for the demand. And I will not dwell on the mathematical formulation, but just to give you a bit of intuition for it, we look into allocating a set of trains, and we have here 3 terms in the objective function, where we want to minimize the cost of train assignments to different lines. Number of trains translates directly per line into certain service headways, and we want to minimize waiting times of passengers. And thirdly, we want to minimize the number of passengers denied from boarding, and this is heavily penalized because obviously that has great consequences for travelers. And then we formulate the relations between the fleet size, cycle time, headways of services, waiting times, conservation rules for passenger flows, and the requirement in terms of capacity allowed, given the distancing scenario. So here's the case of Washington, D.C. again. What I would like you to think through is that you can make a choice, if you can make a choice, what travelers are denied from boarding because you don't have sufficient capacity to absorb all the demand. You can choose potentially between those passengers that may travel very long trips from one side of the city to the other, and as a consequence, they overload the core part of the network, preventing others from boarding. Or instead, you can deny those who do travel within the core because they travel short distances, which presumably can be easily replaced by alternative modes, such as biking or taxi or whatever, Uber. So those could be different strategies, and it's not, I think that's not obvious which one should prevail. So we look into average weekday and different scenarios in terms of the capacity reduction. You see a typical train can accommodate 1,700 passengers, but with 1 meter, 1.5 meter, 2 meters distancing, that goes dramatically down. And here we can see the distribution of passenger demand for the different lines and also over different travel distances. So some lines, such as the blue line, are characterized by most passengers traveling 5 to 15, while the red line, you can see many short trips, but also many passengers traveling more than 20 kilometers. So we developed an optimization model and solved it after making some simplifications there, and then applying different scenarios in terms of the distancing requirements. And here are some of the results for the do nothing scenario, so no capacity, so the normal capacity constraint, which is never binding, and then different social distancing requirements, or physical distancing in this case. And what we can see here is that when the 1.5 or 2 meters scenarios are in place, then we do use the entire fleet, which consists of 140 trains. And we use fewer trains in the other scenarios because we can save costs without making the level of service much worse. What is also interesting to see is that while at the red line, for example, you deploy more and more trains as distances becomes more prevalent. For example, the blue line may actually see first an increase, but then a decrease in the number of trains as you decide to shuffle around and reallocate to other lines, where distances becomes binding. We can also see passenger load per train distributions, where the red dot indicates the turnaround point, so the two directions of the line are divided here. And of course, as you apply social distancing measures, those go down, and refused passengers start to cure, but only in the 1.5 and 2 meter scenarios. This is for the all the results here are for the optimal solution. Different KPIs that we can look into, for example, the number of utilized trains as a decision variable. We see that we reach 140 with these two scenarios. The number of refused passengers, which increases greatly, but also the refused passenger kilometers, as we see here. So what we see is that when we move from 1.5 to 2 meters distancing, then the number of refused passengers doubles. So there, it's the exact standard set has great consequences, and even more so triples when you look into passenger kilometers. And the question is also, what do we offer as an alternative to these passengers which are refused? Do we offer them a compensation or an alternative service, maybe a voucher for an Uber ride? That of course has consequences for the penalty associated with it. And all this, of course, assumes that demand is fixed and we have to accommodate it and allocate resources accordingly. But here we also now look into behavioral aspects of this topic. Together with colleagues, Sanmei Shelat and Sander van Korenburg, we look into, by using choice experiments, where people can choose between different train rides, and they can see the level of occupancy characterizing those in terms of onboard crowding, and then also a trade-off that could be made with waiting time. So this kind of trade-off is made always when you make crew choice in public transport between crowding and waiting potentially for the next train. What is new about it is that it also has a different context in terms of infection rate. So a certain perceived risk associated with this trip. And we allow people also to opt out. So we can also find out how many will not take train altogether. And some initial results there as well. You have a link here to the preprint. If you look at the slides later, we can identify two main segments, those crowded various travelers and these willing travelers. If you wish, those are people that are now very much loomed by the risk of traveling by public transport, as opposed to those that are fairly careless to some extent in the extreme cases. And then we can use this information to also learn something about how we can expect ridership for public transport to evolve as the risk level changes. So that's all I wanted to share at this point, and happy to take any questions. Thank you.
Thank you, Oded. Very interesting. Just in the interest of time, we will proceed to the next speaker, but I ask everybody who is in attendance, please feel free to type your questions in the chat window, and we will try and do our best to get to your questions. And of course, the speakers, you're free to respond to questions that show up in the chat box as well. So with that, we will transition to our next presenter, coming from the TU Berlin team, who have been doing some simulations using mobile phone data. And the presenter is Christian Rakow. The original presenter, Sebastian Alexander Müller, I guess is on vacation. He assured me he's on a socially distanced vacation. So Christian, all yours.
Okay, yeah, thank you. Let me share my screen. Okay, so yeah, hello everyone. I'm Christian. I'm from the TU Berlin, the Transport System Planning Group, supervised by Professor Kai Nagel. And today I would like to present some of our recent work we have been doing with agent-based simulation in regards to epidemic simulation and the simulation of lockdowns. And to give you a short description and overview of the general idea. So yeah, we are transport planners and most of the time work with agent-based simulations. And what we have is synthetic populations. So we know about the demographics and how much people are there. And we also know some kind of movement profiles. So we do activity-based modeling, and so we have these movement profiles. And we asked ourselves the question, so if there's maybe a way to use this data and information and extend our models to model an epidemic disease spread. And basically what we do is we take our existing data and extend it with, for example, an infection model that will tell us how likely it is that an agent gets infected, and furthermore a disease progression model that models the different stages of the disease, and at last also some kind of model to say the government restrictions. So what could happen if we reduce certain activities or ban certain activities. And this project is supported by the German Ministry of Education and Research, and I would also like to thank our project partners Xenozone for providing data, and also the HAU Berlin and SUSE Institute for their cooperation. And so at our institute, we are in most of the cases using MATSIM and also actively developing MATSIM. And on the right, you can see some example output. So in MATSIM, every person, street, and vehicle is individually represented. And you can see in this video, for example, all the agents driving around, and there's also one agent that was selected, and we can see its daily plan. So it's starting at home and then driving to work, and then after work going to a leisure activity. And the question now is, so the question now is, how do we get from these movement profiles to a virus spreading? So, and as you can see here on this timeline, so for example, we see now a multiple trajectory of different agents in a different color. And so if we assume now that maybe the green agent here is infected, then potentially it's meeting with another agent at the same location, and there the virus could spread. and from there on, also from this agent, the virus could spread even further at other activities. So the question is, how can we describe this probability of infection? And what we use there is an infection model from the literature, as you can see here. And yeah, it's parameterized by one calibration parameter I will tell you later about. And yeah, what is also important, the viral load. So how much virus material one person is shedding, and there's a contact intensity that depends on the activity. So, for example, you could imagine that during a leisure activity, there's a higher contact intensity, so this spreading and infection is more likely. And there's also the duration of the activity. And in this case, this comes from our mobility model. And what this model is doing, it basically determines or every contact an agent is having with another person, and then calculates the infection probability. And in the base case, we set most of these constants to 1. For example, there's the shedding rate and the intake is something that could be reduced with mass, for example. And yeah, again, looking at this equation, so yeah, everything depends on the probability. So if an activity is only twice as long, then it's roughly also only half as probable to get infected. The same as if I reduce the intake of viruses with a mass, for example. And so, yeah, now what happens if a person gets infected? So they will always be exposed to the virus and not being infectious yet, but then after some time they will also develop infectiousness, and then even after some more time probably showing symptoms. But there's also the case where agents can directly recover, and all of these state transitions depend on the persons, and also the duration of the transitions. We modeled them as log normal transitions with a certain median. The reason was to model also some kind of long tail in the transition. So what we observed from the literature was that also some people stay a lot of time in the hospital, for example. So you can see here the complete disease progression, and after showing symptoms, there's a probability that person go into seriously sick. In our model, this means that the person would need to go into the hospital. From there on, the disease could get even worse, so it would go into the critical state, which would mean the person would need intensive care unit. And but afterwards, a person always goes back into seriously sick and then recovers. In our model, we basically don't differentiate if a person recovers or dies, because it's for us it makes no difference. So persons that are recovered don't get infectious anymore, and also people are only infectious during the early days of the disease. So when they are infectious or showing symptoms. And the probabilities to go, for example, to require hospitalization also depend on the age group. So you can see here it's the probability to require hospitalization is much higher if the person is older, and the same for going into or for needing the intensive care unit. And as I said, the infection model works by determine the contacts with different agents, and yeah, what it does is yeah, storing all these encounters that agents have, which can be either in a facility or in a vehicle. And yeah, basically then we are looking at the agents that are also at this location at the same time. And in our model, then 3 other agents get selected randomly, and the infection probability is computed yeah, based on the duration these agents have been staying in the same location. And yeah, at the moment we bound this yeah, infection dynamic to 3 other agents. Yeah, because we assume that and yeah, one agent does not interact with everyone in the facility. And so what we have is the yeah, trajectories of the agent. So we know their full daily plans, and we have the for a typical business day, Saturday and Sunday. And yeah, but all of these are only typical days, so the simulation repeats these days again and again. And yeah, now you could ask that maybe the mixing is not strong enough if you always simulate the same day. But in our data, it's the case that facilities are quite of a large size, and so even if we simulate the same day, a person would meet different persons every day. And also we have some kind of disease import, and yeah, we model this by randomly infecting one person every day. And so yeah, about the calibration of our model, here's the calibration shown for Berlin. And yeah, as I have shown you, there's this theta parameter in the infection model. And yeah, we calibrate it like this so that the infection numbers are roughly doubling every 3 days. And yeah, this is what we observed in the data. And yeah, this is also accounted for unreported cases. And yeah, basically, if we only calibrate for this unrestricted case, we could see that yeah, this would be the number of new infection cases throughout the time, and these violet dots are the actual cases. So yeah, we add some more data, and what we did, we looked into the activity participation. So on the right, you see that yeah, basically because of the lockdowns and people got more carefully, the activity participation was reduced quite a lot. So meaning that people would spend more time at home and yeah, less time at other activities outside home. And what is also interesting here is that that this reduction also started before any government intervention. So here, for example, for Berlin, was the ban of schools, clubs, and bars, but even before that, the activity participation has gone down. And so, if we now add this data,
Christian, you have about 1 to 2 minutes, please.
1 to 2 minutes. Okay. So if we add this into our model, we can see here that yeah, the infections go down, but still it was not enough, even if we scale this activity reduction. So yeah, what we concluded is that there is some kind of behavior change. So people started yeah, keeping more distance and yeah, following the contact social distancing, and yeah, so we assumed some change of contact intensity and also calibrated for that. So the final calibrating what it is shown in green, and I will go to the results now. And yeah, we modeled basically kind of different interventions. So I have no time to show the video now, but if you're interested, you can go to our website, given at the bottom. And okay, so we define kind of different matters, and yeah, we wanted to see how much they reduce the reinfection rate. And in this table, you can see some of these. You can also find them in the preprint if you want to have more information. And yeah, what you can see from this list, basically the reduction of all out-of-home activities has the largest effect, which is basically similar to a lockdown. And yeah, but only second is the contact tracing. So meaning we trace contacts, and also 75% of the traced contacts, so they go into quarantine where they don't affect anybody else. So this is also an important a measure to reduce the reinfection rate. And yeah, to summarize our insights, yeah, the reduction in activity participation even preceded government interventions. We were also interested in what happens if we close educational facilities, and the effect is not so large, but we have also not modeled secondary effects like parents staying at home. And the third important thing is that the contact tracing works very well, but yeah, the capacity should be enough, so the contact tracing is not over one. And yeah, this brings me also to an end. Thank you for your attention. If you have any question, you can also send them by mail and have a look at our website or as a preprint for our paper. So thank you.
Thank you, Christian. Very, very interesting. And so, folks, if you have questions for Christian, please feel free to type your questions in the chat window, and Christian do monitor that to see if you're getting any questions. We will transition to our next speaker, Hani, and his group at Northwestern University. I guess they have now gone from DynaSmart to DynaSpread.
Yep,
and
you got it.
Hani, all yours.
Great, thank you very much. I will try to adhere to the 12 minutes that you instructed us to follow, though I certainly have slides and material for a lot more. But well, just try to give you a flavor of some of this work. So this is an agent-based model of viral spread through social networks and mobility dynamics. We're gonna present the basic formulation, and our initial attempts are at calibrating and applying it for policy evaluation. In many ways, it follows a similar sort of pattern as what we've heard previously, where you have agents, you have interactions, you have probability of getting the disease, and then that's gonna be influenced by these various policies on distancing, masks, etc. This is work that Josep Abkarian, a PhD student, has been primarily leading with the contribution of Dr. Ying Chen, who's research faculty in our center. So first of all, caveat, this is not sanctioned by the CDC, World Health Organization, or any medically qualified entity. This is a mobility model and a model of interaction through mobility rather than sort of reflecting the medical or biological aspects of disease transmission. Okay? One of our concerns with the susceptible infectious recovered, the SIR model that was mentioned earlier, said it doesn't capture individual heterogeneity of the individuals, particularly in terms of social networks and travel activity behavior. And that's really why we got into this business. We wanted to try and capture the mobility side of things and its impact on disease transmission. There's an assumption of instantaneous incubation period that we're moving away from. Also doesn't capture symptomatic agents change in behavior, such as staying at home, quarantining, and so on. And most importantly, that model doesn't capture responses of individual agents to targeted mitigation measures aimed at controlling the spread of the disease, I would add, through mostly mobility-oriented measures here. Okay? So in this work, what we did is we actually built on a previous model that we've been working on. The origins of that go back to, in fact, 2009, work that Aaron Kazuki and I had done which is a model of opinion diffusion and an opinion of attitude formation, essentially, through word of mouth and mass media, where we had simulated social network and its agents and the dynamic interaction of these agents. Here, we adapted that. Of course, there is no spread through social network. You don't get the disease through Facebook or through Twitter, but you get it through your physical social network, people with whom you are in actual interaction. So a virus can traverse from one agent to another within her social network if proper social distancing is not practiced, and it's practiced also through random encounters. And this is where, you know, the traveling through transit, going shopping, etc. So random encounters can occur due to travel activity behavior, and that's the connection to the mobility side. For example, interactions with an infected agent who may not necessarily be within your social network. Also interactions at grocery stores, malls, and parks, and touching surfaces that were previously touched by infected agents. This is essentially that exposure is through the, you're essentially exposed anytime you are performing an activity out of the home where there are others. And so it's a matter of then, so it becomes essentially proportional to the time that you are spending engaged in those activities. In terms of mathematical formulation, to try and simplify this, all individuals carry a virus holding value. And so if you could see this, so you have green nodes and you have red nodes in a social network, where the red nodes are those who are infected and they carry, their virus holding value is infected, and green nodes are those who are susceptible. They have a virus holding value of 0. And essentially what happens is that every time step, there is a probability of contact with that virus, thereby changing the value of your virus holding value. So there's an increment to that. And that probability of contact occurs either directly through your social network or indirectly through random contact, as we've mentioned. If contact occurs with an infected agent, then the value holding, the VH of susceptible agents increases probabilistically, and then if that the VH exceeds a certain threshold, then the person becomes infected, and that gets updated at every time step. Okay, so again, as you can see here, is there a contact? Yes. Update the infection level. Are you infected? Yes or no. And so some of the green nodes become red, and so on. So in the first phase, then we have contact. And a contact, as I said, it could be direct, and this is probability then of communication of people who are in your social network. This is building directly off of the attitude formation, opinion diffusion models earlier, where we consider similarity and dissimilarity between agents. We consider their social status, and so on. And so that probability then is going to be, as I said, a function of the dissimilarity between agents. And then we don't have time to go through all of the mathematical formulations. If you're interested in the earlier work on opinion formation, our latest paper on that was with Borowski and Ying Chen, published in Travel Behavior and Society. And then, whether a contact happens, of course, that's all handled through Monte Carlo draws in the agent-based model. The indirect contact model is going to be then a function of the distance traveled, as well as the dwell time at a particular activity. As you can see, there are parameters associated with that kind of give you the the probabilities ultimately, which would be a function of, again, of that distance and that dwell time. And again, through Monte Carlo draws, we determine whether that indirect contact has in fact occurred with the virus. Then the second phase is then the change in this virus holding value. And that's going to be essentially that delta the additional VH value change from the interaction of agent I with agent J is going to reflect of course, the virus holding values of the agents, an impedance function between them, which is affected by two things, by the cautious behavior of agent I and the cautious behavior of agent J. And this depends on two factors, on the physical distancing tendency and the mask wearing of the agent, where the physical distancing tendency characterizing how much distance they tend to keep with other agents, and that is distributed across the population. Similarly, with the mask wearing behavior, here it is a binary value, and again, we have the expressions for these formulas. Okay. All right. This was through direct contact. Through indirect contact, then again, you will have the essentially change in this value through indirect contact with the probability that was specified earlier. What you have here, in addition to that, is a home-staying behavior of the asymptotic agents and the symptomatic agents before they stay home. So we explicitly capture home-staying behavior, of course, because in this case, indirect contact depends on the mobility of the individuals and the time that they spend in different locations in different activities. Okay? So through these processes, you update the virus holding value, and then you update this is in phase 3, the infection class. This is when the virus holding value, as I said, exceeds a particular threshold, which itself could be a parameter to be calibrated. So it's a fairly simple model that, as I said, built on the opinion spread. In this case, it's disease spread. And when you put it all together, then you have this simulation framework here that kind of essentially is simulating the behavior of a population given their social network, given the extent through which they are traveling, reflecting the cautious behaviors in terms of distancing, reflecting wearing masks, and reflecting whether they are asymptomatic infected or symptomatic infected. Again, another probabilistic process. So it's again, we don't have time to go into all of the details of the simulation framework. I want to kind of give you a quick application of this framework to show you that it produces reasonable results. This is still fairly early preliminary work. We took an area in Chicago, the Loop. We really want to apply this to Evanston, which is kind of a more sort of integrated area, but that's coming. But we started taking the Loop in downtown Chicago, in fact, and we have data that's available at the zip code level from the Illinois Department of Health. This is a relatively small population here of only 21,000 individuals in these selected zip codes. We generated their social networks in this case, it's a scale-free network. Again, there's a lot of background on that particular aspect. We disaggregated them by social demographics in terms of age and income. That's also part of creating that population. And then the mobility behavior is based on data that is provided by a sort of a cell phone tracking company called SafeGraph. And SafeGraph has made this information publicly available. And so we have a stay-at-home fraction for this particular area. And we could see here its evolution over time, in this case from March through essentially mid-June. And we also from SafeGraph, we have the travel distance probability mass function, and we have the median dwell or activity time, which are very important for us for these random interactions that I have mentioned. So we made various assumptions here about, again, asymptomatic, symptomatic, and so on. To the extent possible, we try to use national data and assumptions as well about wearing masks and so on. But the key issue is that, so on the epidemiological side for in terms of how long does one remain sort of sick. And so using World Health Organization information, we have a normal distribution for the time remaining sick for those who are younger than 60. In this case, the mean is 2 weeks, and 3.5 days is the standard deviation. But for older patients, then the distribution is also Gaussian with a mean of 31 days with standard deviation of 7.75 days. And you know, based on that, then, you know, this is the sort of recovery period. So we tried to calibrate this. And one issue with calibration, of course, is that do you take the reported, okay, calibration here is using a genetic algorithm. We have over 13 different parameters. These are disaggregate level parameters, but they're being calibrated against aggregate information. The aggregate information is the total number of cases in this area, okay? And so one of the issues is that you can, we all know that the reported cases are all sort of smaller than the actual number. And the number that's been floating around from the CDC is there's actually about 10 times the reported number, that the actual number is 10 times the reported ones. So do we calibrate based on actual reported? Do we multiply by 10? So that was one of the questions that we have here. We, in fact, in this case, multiplied the CDC numbers by 10 to do our calibration, which in fact we only calibrated initially with 10% of the population as opposed to all of the ages, mostly for computational reasons. And this is, so anyway, we get the values. This is what we get. So the calibration results are, you know, kind of better than we had expected. This is the cumulative number of cases, which starts out higher than the reported ones times 10, and then eventually that narrows down, partly because there also has been more testing. And so in the early stages, you only were tested if you were about to die, basically from respiratory problems, whereas testing starting in May, essentially in Illinois, in the Chicago area, has become very widely available. So that's the results of the aggregate fit that we have. We tested various interventions starting April 3rd, where one is a home staying intervention, another is a quarantine intervention, a third is a mobility intervention, and a fourth is an early mobility intervention. All of them work. All of them work compared to the green line in terms of cumulative number of cases. The best one, of course, is when you have early intervention. And so you know, being by far sort of the best one. The others in terms of homestay, quarantine interventions, mobility interventions, all lead to about the sort of same level of reduction, with the, again, the early intervention leading to about a 71% reduction of in total cases. Very kind of, again, preliminary results, but we're getting sort of the right behavior from the model here. Many limitations, obviously, and a lot of opportunity for future work. In this case, we're operating it on a daily basis without specifically incorporating activity chains. This is something one can do by just doing, you know, hourly simulations, essentially, or even finer than that. But then the computational effort explodes with that. We have not incorporated location-specific virus prevalence that would could, you know, for instance, location of train stations and so on, that would improve it. Our, you know, system is closed. We can have exchanges with the outside, people coming in, etc. That's work to be done. Calibration is, you know, we spent a lot of time really trying to calibrate that, and I think there is more that can be done here in terms of improving the calibration. So with that, I will stop and turn it over to the next presenter. Thank you.
Great, thank you, Hani. Very interesting model. And so we will indeed transition to our next speaker. So Shinwoo Kian and I guess working with Satish have been developing a model. Perfect.
Okay, cool. Okay, so I'll just start this. So good afternoon and good evening, everybody. And I recently started as assistant professor at University of Alabama. And I'm presenting this work on modeling the spread of COVID-19 in urban areas with travel contagion. And this is a joint work with my PhD advisor, Dr. Tasha Rashidi. And we have very nice simulation studies before for 2 of them. And I think this serves as a good complement to them from an analytical point of view. So talking about the motivation. So the first motivation, of course, is the fast urbanization process. We have so many people in the city. And of course, an infectious disease has been identified as a major threat right now. And COVID is a perfect example. But even worse than that is, unfortunately, COVID won't be the first one and it won't be the last one. So we're having probably 5 to 6 diseases per year, and this sort of thing probably will happen into the future. So we need to take some measures against it. And the other motivation of this work is a reason why everybody's here is transportation actually is viewed as a big contributor to the spread of infectious disease, and mainly because it was designed in a way to serve as many people as possible efficiently. That's in its philosophy. But this creates a very ideal environment for the spread of infectious disease, which have high population density, a very close contact distance, a long duration, and frequent visitors that take the system every day. So here's some statistics of a recent study, which actually shows how the risk of getting infected scales with the travel time and how the risk of the disease scales with the distance to the co-riders in terms of number of columns apart from each other. So you can see some quite linear relationship and a quadratic relationship over here. Now, since we're viewing transportation as a big contributor and we see many cities taking measures against it, like Wuhan in early stages shut down the public transportation entirely, so this leaves some research questions that have remained unaddressed, such as, well, can we quantify how much does travel contagion actually contributes to the spread of infectious disease? So if there's no transportation system, what it will be? And another thing is, how can we curb or impede the disease outbreak by placing some control over urban transportation systems without even shut down this entirely? And all these actually renders to another question, that is essentially how we can model the spreading process at city level, jointly with transportation and with the spread of infectious disease, which will provide answers to these 2 questions. So this gives rise to our study, which we propose actually a trans SCIR model. And you can tell from the name, it's actually a kind of interdisciplinary model where we combine some of the knowledge in transportation field with epidemic model, which is the SCIR model, and trying to model the co-evolution of the population dynamics and the disease dynamics from an analytical point of view. And for the model, I'm not going to talk about the details, so I just give you a high-level description of what it is. And feel free to ask me any questions after this. So for the model, the input includes a zone-based network, which provides you a spatial context of it. The people travel on this network, and we need some commuting data to calibrate how people travel. And we need some disease parameters or disease data to calibrate the incubation period, the spreading rate, the recovery rate, like this. So having this data, we can plug into our model, and our model actually works by with 2 processes. The first process is actually activity sequences, where people we view for daily commuters, where they stay at home and then they leave from their home to some activity locations by using transportation systems, and then arrive at the activity location. And towards the end of the day, they take the reverse path and going back to home. And during this process, there are actually 2 contagion processes. One is activity contagion, where you may spread this disease to your family members at home, to your friends, or to some grocery stores. And at the same time, you're going to spread or get infected where you're at work by your colleagues or at school. At the same time, while you're traveling, you have a chance of getting infected by your co-riders. And these are captured by different SCIR models in the system. So you can see these are the 2 layers. And from this model, the output will be the disease dynamics. We're able to predict the trajectories to see how the disease is going to evolve. And we're able to develop some optimal control policies over it to stop or trying to reduce the risk of the disease. And here's a little bit more information. So again, I'm not talking about the equations, but just give you an idea. On the bottom layer, we have a mobility network, like on this spatial network. We have population moving around, and we separate them into 4 compartments where they leave home, they return home, and they at their activity locations, and they're at home. And then for each of these activities, for each of these commuting dynamics, we embed a SCIR model, which previous speakers have already explained, so I'll just skip this. So you can see, like an example here is the E compartment, which is the latent compartment, breaks into these 4 parts. And for these 2 parts, for each activity location at home, we have activity contagion characterized by some function. And for during travel, we have some travel contagion, which there is a underlying contagion or adjacency matrix that describes how you get in contact with others during travel. So with that, actually, we can put up a sub-infectious sub-disease system. This is all we're interested in. So this subsystem only focuses on the E compartments and I compartments. We have F describes the rate of new infections, and we have V describes the reduction in infections. So basically describes how long people are going to remain in this infectious department or compartment. And with this F and V function, we're able to develop several theoretical properties of them to gain deeper insights. So first of the thing is this system has 2 equilibrium points. One is the DFE, which I call the disease-free equilibrium. Everybody is healthy. We don't need to worry about it at all. So the disease, even if we have some initial infected people, this disease will eventually die out. And the other is the endemic, where we have always a positive proportion of people that will get infected. I would say this actually will be in every corner of the city. So, and then the stability of the system depends on stability of these 2 equilibrium points, depending on a very important notion called the basic reproduction number. Many of you probably know that. It quantifies, on average, the number of secondary infections and new infectious people can produce. So if this value is smaller than 1, the disease is going to die out. If this value is higher, we can see it's going to be more severe. And we have a very important proposition here, which hints several things. First thing is because the city is highly connected. So you will never observe a single zone that is disease-free. So if there's a certain area that has an outbreak, this will for sure going to spread across the city because it's connected by transportation system. And another thing is the dangers of this disease actually depends on 2 things. One is the most dangerous activity location, either at school, at a company. As long as it's above a certain threshold, this is going to outbreak. And another thing is even we implement perfect measures. Everybody is doing social distances perfectly well in their activity locations at school, at work. But if you don't do this very well during travel, any travel segment has been highly infectious will still lead to a citywide outbreak of the disease. So this is what it tells us from the model. And from this, based on this model, we're able to deliver some or devise some control measures. So what we're studying here is an example of entrance control, but this model can be implemented with other type of control as well. So what is interesting here is like before you're entering our transportation system, say at a bus station, at a metro station, we're doing some screening for you, like a body temperature check. We're doing some random on-site tests. We random draw some passengers and we test for their positiveness of like, COVID. And we have a success rate, which is like a true positive rate, saying, well, we maybe have a 70% of chance that we're successful remove of the really infectious people. And then we have a percentage of travelers we want to screening. And this goes back to the constraint of a budget constraint. So essentially we can't screen everybody. So we want to see how we can optimize our limited resources. Then the problem becomes we want to minimize R0, which is a basic reproduction number, to really decrease the risk of disease. And this happens to be a super hard problem because it's kind of minimizing an eigenvalue of certain matrix, and the variable, which is the epsilon here, comes to the denominator of your equation. So, but fortunately, we're able to come up with upper bound, and we just need to minimize the upper bound. And this upper bound can be minimized through a linear programming problem, which is easy to solve. Okay, so with this information, we're just taking a look at some of the results. So we did a case study for the COVID-19 in New York City, and the network was created using the 2010 peripheral transportation study in New York City, which is early, 10 years ago. So we project all these values into 2020 values. The spatial context you can see is we divide the city into 15 zones, and we connect those edges based on the transportation connections, buses, the metros. And we have those, so we have different modes considered in the system as well. We have different level of infectious rates. And then we use the COVID-19 data to calibrate some of disease parameters. And what we focus on is the early disease period. Basically, there's no interventions, and that best reflects what the disease will naturally evolve without any other external factors. And the estimated R0 value from our model is around 3.3. and the initial patients were found arriving late February in New York City, which is quite consistent with what's reported in other fields as well. So, and you can see this model actually can model the reported, can mimic the reported data very well, especially during the early stages, not only from the city level, but also for individual boroughs as well. So then we have a little bit more insight. So the figure on the top actually shows you, so for those residents in different zones of New York City, what is the percentage of infections coming from, or what is the number of infections coming from travel, and what is the infections coming from activity? What we find is actually on average across New York City, it will be around 28.6% of total cases. That is because they travel and they get contracted by the disease. And this value varies at different locations. We see Staten Island, most of them come from activity contagion because they barely use any public transportation. Whereas for the M3, which is the upper Manhattan area, where those residents over there, they rely heavily on public transportation. So you can see that the travel contagion actually is higher than activity contagion, and there's differences across other places. Now, this value may seem not very high for you, but we have to keep this in mind that if you remove all transportation contagion, it does not mean the remaining activity contagion will be like 70%. It's because we have some induced travel contagion, meaning that when you contract a disease during travel, you're going to spread this further when you arrive at activity location. And we see this travel contagion actually contributes to around 10% of induced travel contagion. And we also plotted a alluvial flowgram, basically shows you for all the residents on the top, and where do they get contracted of these infections during travel, by traveling to where, and then you get infected during travel. So you see, actually, for most of the residents, they have been affected by traveling to M1, which is this part, the West Lower Manhattan area, with a lot of job opportunities for sure. And that actually contributes to most of the travel contagion. And we also see two other places like M2, which is the East Manhattan, and BK1, which is the Bay of Brooklyn. So you see from this figure, M2 is this area, and BK1 is this Bay area for Brooklyn. So you see these two places are the two other major locations. Where interestingly, BK1 is you see most of passengers coming here are from Brooklyn itself, not from Manhattan for sure, right? But for Manhattan, those are mainly external travelers from other boroughs. Okay, so this gives you the idea of where these infections coming from. Now, the other thing is we're showing how the control works by setting some parameters. And we compare this optimal control strategy with two other things. The one thing is a uniform one, the top one. So it means we randomly distribute the resources across the network. Another one is more intuitive, the high demand one, is we're targeting on those travel OD peers that have the highest passengers. So we rack them and we distribute the resources. So you see, for the other two benchmarks, the R0 decreases linearly with respect to a higher budget level. But for the optimal control, you can see clearly this exponential reduction in early stages. And what I mean here, the highly effective and comparable to individual level control is because if you know exactly who are infectious and you remove those infectious people sequentially, you're going to achieve an exponential reduction as well. So in that sense, they're achieving a similar reduction rate, exponential versus linear. This is what I mean by highly infectious. And we see the R0 can be cut down to 1.2. If we're going to screen, we're able to screen almost 4.5% of daily commuters, but that's super expensive. But if we're only able to stay screening 0.9% of the commuters, we're able to cut down this R0 value to around 2.3. And this figure on the lower, on the bottom, shows you the dynamics before and after implementing a 0.9% of screening for those travelers. So what we see is here, eventually it's going to save 700K travelers from getting infected. And also they're going to delay the peak by 25 days based on the differences in date from the infections curve. So finally, a little bit more insights on where we're going to place this control based on the results of optimal control model. So we see it's largely consistent with the alluvial flow diagram we showed earlier. So when we have a low budget, we almost distribute them exclusively to those passengers traveling to M1. That's the main contributor. But as long as we have increasing level of budget, we're going to see is we're going to focus not exclusively on M1. We're not going to control them all, but we're going to distribute those resources to prevent those people from Staten Island, Queens, and Bronx getting contracted. So this avoids them bringing this disease back to their activity locations, to their local areas, to induce a further large outbreak. Okay, so that's mainly the things we present today. So we propose a trans-SCI model. This model can be used to predict disease trajectories and understand the impact of travel contagion. And very importantly, it can be used to derive optimal control strategies analytically. And this can be super useful, I think, in terms of the after reopening, when we still want to operate a transplant system, we're going to focus now. So there's some more details. You can look into our paper. We have a preprint over there. And some limitations, I think Dr. Mahmassani already mentioned, like compartment model, people are perfectly mixing the homogeneous assumption like this. And the other motivation, the limitation is passive control. Here is the control effectiveness is limited by the transportation network structure, but it'll be more effective if we can change the transportation network a little bit or change the mobility pattern of the people. So we did some study over there to understand how these two couples together. And another thing is behavior is assumed to be fixed after implementing some of the control strategies. But in reality, when people are traveling, they observe the neighbors, they have adaptive behavior. They're going to put on masks if I see some others putting on masks as well. So we have some other analytical models to reflect this aspect as well. So with that, that's what we want to present for today, and feel free to contact us for any questions.
Very nice. Thank you very much, Xin-Woo. You already have a few questions in the chat window, which hopefully you can catch up with as we transition to our next presentation. Last but not least, by any stretch, Professor Eric Müller, University of Toronto, and several colleagues, I think, also from the University of New South Wales in Sydney. Eric, all yours.
Okay, I'm trying to figure out.
Great.
Is that so everybody can see my screen?
Yes.
Okay, very good. Yes, well, thank you. And I think this has been a really interesting session. In that to see all the great work going on. This presentation is with my colleagues at the University of New South Wales in Sydney, and indeed the Greater Sydney area is the study area. This also is a talk about using an agent-based activity travel microsimulation model to try to track COVID spread, in particular try to look at the impact of different policies. So I'm not going to bother trying to motivate why agent-based modeling. I think we've heard from everybody a common theme about why this may make sense to do. So let me go directly into talking a bit about the model. So we are looking at the Sydney greater metropolitan area. We'd already started work prior to COVID in transferring the Tasha model, which is the operational model for the Toronto region, to the Sydney region for general research and modeling purposes. So a caveat is that transfer, I would say, is not absolutely complete in that we are actually still using many of the Toronto model parameters to model the Sydney area. They seem to do a not bad job, but clearly more calibration could be done there. Advantages of Tasha, I think, for this purpose is it's a fully household-based model. We have a synthetic, an entire 100% population of persons, but they're all within household groups, and we're simulating the entire activity travel behavior of every person within a household context. So that includes joint travel and so forth. And this is also a weekday model. We're not trying to model weekends. And I think the other caveat that we should note is that this is, even though it's completely disaggregated by person, it is a It is a spatially zone-based model, so we're modeling trips to and from traffic zones. So the best we can say is person A and person B happen to be in the same traffic zone at the same point in time. Similarly, we can't say that person A and person B work in the same building or are in the same store. They are participating in work or shopping in the same zone. But nevertheless, we think that's a very good step forward to clearly, if you're in the same zone at the same time, you have a much higher probability of interacting with somebody than just a person at random. So similar to many of the other models, we've set up an agent-based microsimulation flowchart where we basically take each person in each household through a day in the life. They travel about, they interact with people, they come home, they are exposed, and so they have a chance of if they are exposed, they have a chance of becoming ill, and so on. And if they become ill, they are quarantined, and so on and so forth. So, and then we run this day after day after day. Other people have talked about the various parameters in their models. As I say, the travel behavior parameters that are controlling the participation in out-of-home activities and choice of mode and everything else have been pre-calibrated or borrowed from Toronto. But we have built a probabilistic model for the disease-specific parameters, the probability of contact, the probability of infection, and so forth. As I'll talk about in a minute, those have been calibrated within this model. And then the main reason we're building this model, as with others, is we're interested in looking at various policy-specific parameters that we can alter in various scenarios to explore their impact on disease spread. So I'm not going to go into any details, but I think one feature of this research is that we've used quite a formal method for estimating the disease spread parameters using a central composite design process for calibrating parameters within large, very large simulation models such as this one. Accounting for all the interactions within the model and trying to find the parameters that best fit aggregate data. We've published, this is the work of Ali Najmi, one of the lead authors on this work for his PhD. It's published in a couple of transportation papers, so we can refer people who want to know more about the calibration process that we underwent and so we calibrated the disease spread parameters to try to match the actual experience in the Sydney area in terms of disease spread. This is just showing the list of the parameters that exist in the model and the calibrated parameters that came out of this calibration process. I think we're very happy with the calibration results. This slide is showing, the top A and B are showing daily infections as reported and as simulated, and then the cumulative, and then the part C is showing, breaking that down into how we're modeling the model outputs in terms of total infected cases, et cetera, et cetera. So as I say, I think the model is replicating the aggregate outcomes of spread through the first number of months in Sydney. And so then what we've done is we've taken that model and try to investigate the impact of different policies, and in sort of a counterfactual way. We know what the policies were and the behavior was in Sydney during this time period. So we're simulating the same time period, but saying, well, what if people social distanced more or less? So based on we can't observe the percentage of social distancing, but we have found in the estimation that the social distancing compliance in Sydney seemed to be very high, around 85%. But we could ask the question, well, what if fewer people had social distance, 70%, 60%, and so on? And so what we see are the results of the simulations, where we compare different average compliance levels in terms of the impact on spread. And I think in this slide, looking at A and B are showing the daily and cumulative cases, and then we have just taking the logarithms of them. I think looking at the logarithmic graphs are very, very interesting, are easier to look at, although everything is telling the same story. And we see a very high social distancing compliance, a very abrupt and a very short spreading period and getting disease under control. But as social distancing compliance lessens, things spread out very considerably, and this is not a surprise. But I think it's interesting to see the model seems to be working reasonably well, and effectively what these numbers are showing, and again all of this is with many caveats, is that a social distancing is extremely important, holding all else constant, and that you need 60, 70%, preferably 70% at least compliance to be able to effectively control spread. Anything less than that, it's not very effective. Similarly, I think a very interesting one is the Sydney area lockdown reasonably early in the process. And we know around the world the rate at which the timing of lockdown varied considerably. And what we asked in this simulation is, well, what if they had locked down a week earlier or 3 days earlier, or what if we'd waited another week before they shut down? And again, we see a very very big differences that even waiting a week longer might have had enormous impact on the spread of the disease. So again, whether the numbers are exactly correct or not, I think that the general behavior and the implications of this, that moving promptly to lockdown was extremely important. I think that's a lesson we can continue to pay attention to. And I think certainly in many regions this was a challenge that it's argued certainly in Canada and in Ontario where I live that we didn't lock down soon enough, and we should have locked down sooner. Quarantining families. What if we didn't? If somebody was found to be infected, what would be if we didn't enforce travel restrictions on household members and on the infected person? Again, I think the general behavior is something that we expect to see, that enforcement of quarantine is very important in terms of having impact. Similarly, face masks, another extremely important policy, and varying in contentiousness, shall we say, from one country to another, is the combination of face masks and social distancing is extremely important. So in this graph here, for example, we have different levels of social distancing compliance, and then we see the effect for social distancing compliance, the effect of wearing face masks when you're out and about, and again we see a very strong impact there. Another policy is tested, which I think is kind of silly myself, is face masks at home. I think that would be a pretty much impossible thing to enforce, and it turns out it's really not, at least according to this model, not very important. So this is very, very early research. We're busy adding all sorts of modifications and improvements to the models we go along, and we'll be looking at other policies. But going forward, and I think this is a common theme through all the presentations, is we're not out of the woods here by any stretch. We have to be thinking about policies going forward. There's lots of different issues, many of which have been discussed in this conference. But so I think one of the challenges, one of the objectives is, well, what sort of policies should we be putting in place going forward? And certainly masks are very important. Social distancing is very important. But there's challenges associated with maintaining economic activity with social distancing. And in the panel session earlier, we had a lot of discussion about where we might be heading. So I think the theme of this session has been largely basically, trying to develop much better tools to help us in exploring those policy questions. Just as one example, I mean, there's been a lot of talk about different apps, different sort of information we might be able to provide to people. This is just one example. What if you actually could tell people sort of what are more risky routes than others? How would that affect behavior? What sort of information might we be feeding back to people to alter their behavior to encourage safety and so forth? And so I think there's lots of potential for using information and information technology, but also using the sort of simulation models that we've all been talking about to try to inform these policies. So in conclusion, again, these simulation results, which are very, very preliminary, but I think they give very sensible, intuitive results that again, social distancing requires significant, a majority compliance within the city and within an urban region, or it just isn't going to work. We need to get it very high. That quarantining people who are infected obviously makes sense. And face masks are also extremely important. So again, maybe not surprising, but reinforcing messages. So I very much want to thank my colleagues at the University of New South Wales. This is really very much their work. They've just borrowed our model to a large extent, and so it's very early in the morning in Sydney, so they weren't able to. I don't think anybody has joined us from there, but it's been a joy and pleasure working with them on this project. So thank you, and that's the end of my slides.
Great, thank you very much, Eric, and thank you to all the speakers. We actually do have a few minutes for the session, so I wanted to maybe ask the speakers to go in turn and say and ask what comes next. So what are your future ongoing plans in terms of enhancing the model, validating the model, and applying the model. So Oded, if you could start off, we can just go in order.
Sure. So following up specifically on the virus spreading model that I've presented, I think the main points that we may follow up on are how different demand patterns may result with different contact graph structures, and how can one also cater for on-demand transportation for these parts of the demand that cannot be accommodated with mass transit.
Very, very interesting. So, Hani, or sorry, Christian?
Yeah, so we are mainly looking into the spread. So what we are trying to look into are super spreaders and what happens if people have individual viral load. So in our model, every person has the same infectiousness, and we want to see what happens if as it is in the real world, if some people are more infectious, and how that relates to super spreading, and what are the strategies to avoid super spreading.
Yeah, interesting. Okay, thank you. Hani?
Yeah, many aspects, and I've mentioned some of them, but trying to capture essentially the kind of mobility of essential workers and spatializing some of these locations, I think would be important to kind of modeling a certain area realistically from so that's one element. Also, interaction with the outside individuals. We so far have modeled as a closed system, but really there's interaction with the outside, and that would be another element that I'd like to add. And the whole issue of calibration and there's improvements that we could clearly see in that aspect that we probably will be working on as well. And,
very cool.
The other element, of course, is trying to find a sponsor.
we're all in that boat, yes. Shinwoo?
I think so what we're doing right now actually echoes what Oded just mentioned. So what we're trying to do next is actually go back to the source and trying to see how we can alter the transportation network slightly to really solve the problem, to make it more resilient, or trying to find a way to reshape the overall mobility distribution of the people. Because these are the two driving forces that to enable how people get contact in a transportation system.
Very cool. And Eric?
Yeah, we don't really have very good behavioral feedbacks in terms of changing the propensity to go to work or shop and these sorts of things in the model. So that's something we're implementing so that we can be testing various feedback effects on behavior. I think also getting to the point of we really haven't been looking at transit ridership yet. And that's something. And I'd actually like to bring this model system to Toronto so we could be looking at things in both the Toronto and Sydney contexts. Very cool.
Yeah, I was going to ask why you went all the way to Sydney to apply it and not applied it to Toronto.
Well, Taha talked me into this. As I say, we had already been collaborating to bring Tasha to Sydney, and then he emailed and said, "Hey, Eric, we got to do this, and we've got some Sydney data." So, and he's got a bunch of eager people, postdocs, to work on this stuff. So that's why Sydney.
So before we close, I was just going to ask. I don't think I saw this brought out explicitly, but I guess the advantage we say in terms of activity-based models and agent-based models is you know who the agents are. And I think there's been a fair amount of press about how certain segments of society, certain ethnic groups and racial groups have been more adversely impacted by the pandemic. Is that something on your radar to see how your models are able to bring that out from a social equity, environmental justice standpoint?
Yeah, I mean, absolutely. I think this equity issue is huge. And again, with the agent-based model, I mean, for example, in the Toronto/Sydney model, we actually don't have race or ethnicity, but we have income. And we know residential location, and we know industrial, employment type. So, there's a fair correlation with disadvantaged people there that we need to be digging into. But yeah, I mean, this is a classic argument for agent-based modeling that we know who the people are, or virtually we know who the people are.
Any other closing thoughts before we adjourn the session? If not, thank you very much. Appreciate the great presentations. Lots of good work in this space, bringing these different fields together. And so we'll look forward to more work in this space. So thank you to the audience.
Rebecca introduced me as, which has been a hot topic at BTR and in this particular session. And what we did was actually use a purpose-based sample to look kind of at low-level behavior modifications that people made during the pandemic and tried to compare these to historical data that we had in 2018. So I'll just move right along with a brief outline, but in the interest of time, I'll just keep going. So, the pandemic has wrought a lot of changes to kind of all aspects of human life. Right now, I really wish I could get a haircut, but that's kind of small time. But, particularly with retail shopping patterns, I think it was actually in Hani Mahmassani's webinar a few months ago that somebody mentioned that, for the retail e-commerce industry, every day has been Cyber Monday, which is the biggest shopping day of the year. And that's been for a few months. And so that comment was actually made probably right around this spike in retail e-commerce transactions in the US, which is what the left chart is showing us. And the right chart is demonstrating that these spikes in e-commerce, are actually more pronounced or less pronounced depending upon what is being purchased. And then, our data collection occurred during this little red window here. So not during the biggest spike in e-commerce, but still well above pre-COVID levels. And then if we look at trip making, these charts are a little bit cluttered, but I think it's important to notice that from a trip making perspective, non-essential trips, for retail like clothing or, other shopping were down in most of the Sacramento region, whereas grocery trips during our observation period were actually at pre-pandemic levels or above. And so again, commodity by commodity, it's really important to understand the changes. And, one other thing I want to call out is that we as researchers are kind of really appreciative of all of the previously privately held data that are now publicly available. And so this is all from Google. Apple has their own. But we really wanted to use this context to answer a few policy questions, again, in the SACOG region and really within some of the central cities. So particularly in an e-commerce space, curbside implications are very important. So we wanted to know, is curbside demand actually going up, or are people just not visiting downtown, and so there's a dearth of trip making? Again, commodity by commodity, restaurants have been doing pickup service for, as long as I've been alive, but bookstores prior to the pandemic had no infrastructure for this, be it on the curb or in their stores. And so how are these locations going to handle that if there is a spike? It's a similar question for grocery stores, which have, often massive parking lots, but didn't have any online ordering systems before the pandemic, and may not have curb space for it. And behaviorally, we're going to use substitution effects, complementation effects, induction, or just no impacts to look at these changes. So we, thanks to our partners at the Sacramento Area Council of Governments, were able to get access to their raw data from their household travel survey, which was conducted in April and May of 2018. So this is a stratified sample of the 6-county region. And I think the important thing to note here is that the respondents that we are looking at provided 7 days of data. So they answered a daily survey about their shopping on a smartphone for 7 days and reported all of their trip making. And we went back to them in late April and asked if they wanted to participate in a new survey, which was a 1-day survey asking about their retrospective week. So we asked them to report numerical information about their prior week and also put that into context with a reference week in January and February before knowledge of the pandemic was really widespread. And there are some differences in the data that exist, so I really quickly want to highlight them. First of all, this HTS version is really kind of the state of the art right now for e-commerce variables. And so we have a level of detail not previously seen for non-food and food deliveries, as well as online shopping, which was unspecified. So we can't link deliveries to shopping, but we do know 4 days of the week when this occurred. Now, at the day level, I can actually count the number of trips somebody made to CVS, but I can only know if they received packages, not the number of them. And for that reason, we did some aggregation, which I'll talk about. What we did in our survey was expand these kind of coarser categories to look at both essential and non-essential items. So all food would be essential here. And then paper products, childcare items, and medication would also be essential. But clothing is a non-essential good. And this allows us to track, spending across these categories. And we also wanted to pick up these new or increased curbside events. So we asked people about their purchasing channel and their receipt channel to really break it out sector by sector. And so the preliminary results are kind of split into 2 categories. We started by analyzing the 2018 data to understand what patterns existed in the past. And then we looked to 2020 to see how these patterns had changed. And we took those 7 days for each household member and aggregated them into household weeks. So what we're analyzing are the shopping patterns of a household at a week level. And, this I think is more important to us than being able to predict, on any given day whether or not there will be a shopping event, but really what types of patterns are households exhibiting? Are they not shopping? Are they only shopping in person? Are they only shopping online? Or are they doing both? And we split this out both for food and for non-food items, but there was a relatively low prevalence of non-food e-commerce use in 2018. So the model that I'll present today is just on non-food shopping. So think about UPS packages, that kind of stuff. And the model results are relatively consistent with the literature. We see that smaller households and households at the lower end of the income spectrum are less likely to shop at all during a given week for non-food items. Didn't see a really strong effect of population density, but this is suggesting potentially that people living in denser areas are either doing in-person shopping only or online, but we would need more data to confirm that. Women have been shown to shop more, both in-store and in this complementary effect. And then interestingly, here, both for these larger household sizes and higher income households, we can say that there is a complementary effect of e-commerce shopping on in-store shopping, because there is a likelihood that these households will exhibit both in a given week against anything else. And so what we wanted to do is use these same demographic categories and carry them forward into 2020 and see if they were still important. And, you know, I'm not going to bury the lead, but we actually found no significant trends using those same demographic categories to explain weekly shopping behavior in 2020. And so we're still sorting through this, but that either means that, you know, the important variables that we're going to predict shopping in 2018, like the number of children in a household, the size of a household, whether it's a female-headed household or a male-headed household, just aren't important in a pandemic. And, you know, variables such as, do you still have a job? Are you working from home more often? Do you have increased childcare responsibilities? These types of questions that we don't actually have in 2018 are driving behavior. Now, it may also be that we have a small sample size here. As you can see, we have about 10% of the observations that we did before. But even with that 10% sample, if we look sample wide, I think some interesting effects start to show. And what this chart is showing is trip making for that entire observation week in the middle of May. And unsurprisingly, trip making is down across the board. And so we first see the categories at the SACOG level, and then below, there's no comparison to 2018 because we didn't have those data in 2018. But, you know, people are buying online and picking up in the store. And we see that pretty evident for food shopping and less evident for non-food shopping. So if we take groceries, for example, there appears to be not a significant decrease in the overall number of trips being made. So if there are more e-commerce purchases, that would be a complementary effect, which we'll discuss on the next slide. And so what we're seeing here, kind of unsurprisingly, is, you know, nearly a 400% increase in home deliveries in 2020 after the pandemic versus before for this small sample of people. And we're also seeing, you know, a large number of pickups as well, but we can't compare that to 2018. You know, of all food ordering, of all food e-commerce purchases, 85% are leading to trips being made. So particularly for groceries, where 48% of online purchases are leading to trips, there may be an overall increase in trip making because e-commerce is complementing in-store purchasing behavior. And then for non-food items, this other non-food category was mostly auto parts, so people were making some in-store trips for that. But we see people going to pick up medication, childcare items in person, likely because they need them in a timely manner, versus non-essential non-food items. We're seeing a substitution effect where people are shopping online instead of going to the store. So kind of all of this is as we might have expected. And before, you know, I kind of wrap it up, I want to comment on, you know, a thread that I've heard about data collection previously today and yesterday, which is that, you know, the value of different data collection methods has changed in the pandemic. And so stated preference, I think there's been some agreement for e-commerce is not really that useful at the moment because we're in unprecedented times. I do also want to, you know, shed some critical light on revealed preference here, because we're asking questions at a retrospective week level, which I think it would be hard for a lot of us to recall our prior week, although even we're not doing as much different these days than we used to. And this is actually borne out here, particularly for groceries. So we asked a question specifically to respondents: are you making fewer trips to the grocery store than you were before the pandemic? And 187 people said that they were. But when I actually got into the numbers, less than a quarter of those people did actually report a lower amount of trip making. So there's this perception and behavior mismatch. And my takeaway from this is that people seem to be trying to limit their time in the physical store, but they're not actually limiting the number of trips that they're making. They're limiting their in-store time by substituting or complementing e-commerce for in-person trips. But the total number of trips are still about the same. And this makes it important to repeat observations with these panels, which we do intend to do. And we ask them questions about their future intent, which helps us look at policy implications. And so interestingly, people seem to really want to go back and shop for non-food retail. And maybe they're like me and they just really want a haircut. Or maybe they just want to go back to stores that are closed and support them. Pickups and contactless deliveries are also likely to continue, which is an important trend to track. And these were asked for all commodities, not specifically for any other. And we do see kind of a caution against unknown modes here. So people are not very hot on drones, bundling grocery orders, or driverless delivery. So they're really going with what they know. But these, mind you, curbside pickup didn't really exist before the pandemic, and a majority of people are interested in continuing it. So I think that's an important demand that changed the supply that's good to remember. And so just quickly on the policy implications, because I know I'm running out of time, we saw, substitution effects and complementation effects vary by commodity. So there's a substitution for non-essential, non-food items. So these trips that we don't have to make, we're not making anymore. But the trips that we do have to make, not only are we still making them, but we're also complementing them with online shopping. And so regionally, that might mean an increase in VMT for specific types of items. And that might also mean locally curbside impacts at places with existing capacity like restaurants, but also at places that don't have capacity for that type of pickup behavior. Grocery stores have really large parking lots, but maybe not a lot of parking around them. And they also don't have the in-store infrastructure to just prop up curbside delivery to customers. And so there's been a lot of talk, I think, since the pandemic about converting unused parking lots into housing, which I definitely support. But I think in the short term, there's probably also some value into thinking about how to use those as, small time fulfillment centers at the neighborhood level, particularly for things like groceries that need refrigeration. So that's it for now. We do have a paper that will be coming out hopefully soon, but just want to thank all of my co-authors, everyone who provided comments on the manuscript. And obviously, this wouldn't be possible without financial support and the survey respondents themselves. So thank you. I think I'm under time.
Thanks, Teddy. You are under time. So there's some time if anyone has questions. All questions, please put in the chat box. And well, there haven't been any questions so far. But yeah, your presentation was very thorough and it had a lot of data in it. And it was very interesting to see everyone's attitudes on how they are looking to continue placing online orders and picking them up. So yeah, thank you again, Teddy. If you want to, check the chat box for any questions you get. Any other closing comments?
I guess, to kind of pick up on that thread, our next step is to go back and process some of these other kind of non-demographic, but important variables like, did you lose your job, or do you have lower income or increased childcare, and see if those are actually going to lead to significant changes in consumption. But we just wanted to start at the high level for this. But yeah, thanks everyone. And then that's a bus stop from Seattle that I thought is a good way to end.
That is, yeah, that's quite easy. Thank you. All right, our next speaker is Hassan Rahimi. He will be presenting Understanding the Impacts of COVID-19 on e-shopping in the Chicago region. All right, Isan, you're on. You can, share your screen.
Okay, hello everyone. Can you hear me?
Yes, and we see your screen.
Okay. Okay. Hello everyone. This is Ehsan. Actually, I'm going to talk about the impact of COVID-19 pandemic and the dynamics of online shopping behavior. But before going through the presentation, I want to talk a little bit about why we need to develop this kind of model to capture the different effects. Last year, if you remember, earlier yesterday, Ali was talking about the dynamics of working from home. Today, I'm going to talk about the dynamics of online shopping behavior. So there was a lot of discussion about what is the real impact of COVID-19 pandemic on the transportation network. So here in the TransLab, we have a very interesting simulation tool, Adapt. Which is among the few numbers of simulator that is dynamic. So we believe that every kind of decision due to the pandemic could be impacted. So we need to incorporate those decisions in the simulation or any simulation in order to capture such events if happened again, or because recently I read a news that there is a new version of the virus recently has been identified in some country. I don't know, but if we consider the COVID as a done virus, so again, we could have the similar situation. And so we need to be prepared for this kind of situation. So we need to have some kind of simulators to be capable of considering different impacts of COVID-19 on the network in order to be to enact some useful policies for the future. So with that, I want to start my presentation as on the shopping behavior, and specifically the online shopping behavior. And I want to first thank all of my colleagues from Univ of Illinois Chicago and Nimoit from Georgia Institute of Technology. We're all working in the TransLab, which is leading by Professor Mohammadian. So I want to briefly talk about the shopping behavior here in the United States. Actually, the online shopping has been increasing during past years, even without the COVID-19. As you can see, over the period of 2010 to 2019, the total retail stores in the U.S. has increased by more than 42%. And specifically, if we focus on the effect of, the online grocery shopping, you can see that here in the graph that the online grocery shopping witnesses a persistent rise thanks to the revolution of the ICT technologies recently. So the COVID-19 pandemic has happened, so it can be considered as some sort of actually fast forward button that it has been pushed and accelerate these transformations from the conventional type of shopping to online shopping. And a study earlier shows that more than 30% of U.S. households had used the online grocery shopping during the March 2020, which is interesting. It's more than 145% rise as compared to the August 2019, which is very huge in terms of the behavior shift. So here in this study, we aim to develop a model, a framework actually, which can dynamically consider the people's online shopping behavior in the era of COVID-19 pandemic. And most specifically, we are interested in understanding how people can actually adjust their grocery shopping behavior due to the pandemic, and whether this kind of change can be stay longer after the pandemic, or it's going to be bounced back to the pre-pandemic conditions. So it's a question that we need to answer in order to consider the dynamics of the situation. So here is our survey. We already designed a survey. Yesterday, Kouros presented this survey. I don't want to go through this survey, just I focus on the dependent variable that we already used. Here is the survey. We already have 15 valid observations in Chicago metropolitan area. So in this study, we focus on the three different dependent variables that we asked respondents in the survey. The first one was the frequency of online grocery shopping before the pandemic. The second one, we asked respondents to indicate what's the frequency of online grocery shopping during the pandemic. And I want to remind you that we ran this survey in the second phase of pandemic in Chicago, which was the total lockdown, excluding the essential businesses and grocery shopping. So we was on the worst situation in the Chicago at the time of the survey. And also, we asked respondents to express their opinion about the future behavior in terms of the shopping grocery online when the pandemic is over, hopefully. So here is the distribution of the variables. As you can see, the before pandemic, the top left graph, actually around more than 80% of individuals have expressed that they never ordered online, any groceries. So this person has been decreased to 72% during the pandemic. And also, if you can see the bottom picture, you can see that more than 50% of individuals have expressed that they will most likely, somewhat likely, up to very likely will continue buying online the grocery stuff. So to characterize this behavior, this dynamic, we need statistical tools to first, in order to consider the original nature of dependent variables, because we already asked this in a ordinal way. Also, we believe that there might be a correlation among unobserved factors because all different dependent variables are related to the shopping behavior. So the statistical tools need to consider such correlation. And more importantly, there might be some possible interrelationship among dependent variables, because we already know that individuals have different habits and it's hard to change the habit. So the hypothesis is that maybe the before pandemic behavior in terms of shopping can affect the during behavior and also the future. And in addition, the during behavior can also explain the behavior after the pandemic when it's over. So such a statistical tool could capable of considering such a kind of interrelationship between shopping behavior. So to do so, we choose to go for multivariate order probits with endogenous right-hand side variables, which could consider actually it allows to all different criteria that I earlier mentioned here. I don't want to go through the detail of the formulation due to the limitation in my time, but just quickly mention that there is some kind of correlation. There might be correlation, so this framework can capture that. Also, the dependent variables of different behavior can be endogenously considered in different utility functions of different states of decision-making process, like before, during, and after. So this framework can do it. Let's move to the variables. Actually, we already have, a wide variety of variables in terms of the social demographics, in terms of the COVID-19 situation in the Chicago, in terms of the restriction, in terms of the rules. And also, we incorporated the smart location data set. As you all know, that this is a very high resolution data set, and thanks to the fact that we already collected the location of the respondents, because we asked respondents to express where they are living, not the exact location, but we already have the closest maybe intersection or the closest building to where they are living. So we could connect the SPL data to our database in order to capture the effects of land use variable, because we believe that the land use variable, and lots of literature shows that the land use variable can directly affect the habitual decisions and the different decisions that one person can make. So here is the model. Our model has three different components: the before pandemic, the during the pandemic component, and also the after the pandemic component. I just want to quickly go through some of the interesting results that we came up during our analysis. For the first part of the model, which is the e-shopping behavior before the pandemic, before maybe for first 1 or 2 months of the year, we found that education level, household income, and working status are among the significant factors here in their individual decision. Also, and the other results that we found, the respondents who were retired or looking for a job, actually they were jobless technically. They expressed that they were less inclined to shop online for groceries before the pandemic, which could be related to the fact that maybe they have more time, or they are usually among the low-income population. So it could be a reason for that. And also, we found that those who live in area with higher worker density, specifically the dense area, are more inclined to shop their groceries online, which is, we expected that, because in those areas, usually the car ownership is lower, and there is a more congested situation, so people prefer to use other types of services instead of driving their cars or do so. So going for the second component of the model, which is the e-shopping behavior during the pandemic, where the survey is actually conducted, our results shows that the restriction by authorities, the imposed restriction, that at that time we already had the social distancing, the lockdown, the ban on large gathering, have motivated individuals to adopt online shopping behavior, which we expected that due to the perceived risk of doing shopping. Also, we found that low-income households are less likely to buy their groceries online during the pandemic, which draw the attention to the fact that the equity fact that yesterday there was a great discussion on this topic, the effect of equity. So here it highlights the fact that we need to consider the equity. The other point is that the respondents who live in areas with higher density in terms of the pedestrian-oriented intersections per square mile are more likely to purchase their groceries online during the pandemic, which is again related to the more interaction in those areas between individuals, perceive more risk to conduct online shopping and do so. So the last component of the model, which is the expectation of individuals for the future, we found that again the low-educated people are less likely to increase their online shopping frequency in the future. Also, the household who has a person with a disability will likely increase the likelihood of online shopping behavior. And also, we found that the higher number of vehicles in the household is associated with the lower chance of increased grocery shopping after the pandemic. So maybe due to the lifestyle of those individuals. And as I mentioned earlier, we already considered the effect of different behavior in the model. So in terms of the pre-pandemic shopping behavior, the effect of pre-pandemic shopping behavior on the forming shopping behavior during the pandemic, we found that those who had never used online services for grocery shopping were likely to break their habits, actually change their minds, and switch to online shopping, which is interesting result, really. So people, even the situation was not a long term, but it's maybe that people are changing their mind, changing their habits. And also we found that the impact of people online shopping habits before and during the pandemic is also affects the future behavior. So more specifically, our results shows that individuals who had the experience of online grocery shopping before the pandemic and are among the frequent online shopping users during the pandemic are likely to continue such behavior and stick to this behavior even more frequently than the previous situation. So it was another interesting point that we came up. With that, I'm going to finish my presentation. We will be releasing our publication soon in our webpage at translab.uic.edu/COVID-19, and hope you enjoy that. If you have any question, I would like to take that question and answer that. Thank you.
Thanks, Hassan. First of all, I totally forgot to introduce you, other than the title
no
of the
problem.
presentation. But Hassan is a PhD candidate and research associate at the University of Illinois, Chicago. He's also a member of TRB Standing Committee on Travel Survey Methods, which is a sponsor of this conference here. Okay, your first question was when you discussed respondents who were retired were less inclined to shop online. Less inclined compared to who?
Actually, let's go back to my presentation. Actually, it's not we compared two situations. So those who were retired were found to less inclined to shop online for groceries before the pandemic. So totally, the person who is retired is less inclined to engage. Less inclined to shop online. It's compared to other groups like the person who are the population who is working, the population who have a full-time job. There is a lots of categories in our data, but we compared actually this group with other groups that we already have, and this group, as compared with other groups, has expressed less inclined toward shop online.
All right. Thanks, Hassan. You have another question in the chat box, which I'll let you answer, and we'll move on to our next presentation.
Sure. I will take care of that. Thank you so much for your.
Thank you so much. Your presentation was super interesting.
Thank you.
All right, thanks. Our next presenter is Dr. Hong Yang, who is an assistant professor in the Department of Computational Modeling and Simulation Engineering at Old Dominion University. Dr. Yang leads the Sense Lane Transportation Lab at ODU. He is currently serving as a member of the TRB Standing Committee on Public Transportation Planning and Development. Dr. Yang, you need to unmute and share your screen.
Okay, let me share the screen. Okay. Can you see the screen now? Right now for the agenda of the conference. Let me.
Okay, yeah, I can see your screen. Your audio is a bit low.
Oh, okay. Let me raise this a little bit.
Yeah, that's a bit better. Thank you.
It's better now?
Yes.
All right. Okay. Thank you, Rebecca. Thank you for your introduction. Good morning, afternoon, evening, everyone. I would like to take this opportunity to share our work on investigating the COVID-19 infection risk among micromobility riders through our simulation-based approach. This work has been done with a collaboration with my students, Yang Liu, Qinyu Ma, and collaborators, Susanna, Dr. Gao, and Dr. Osby at NYU City Smart Center. So here is an outline of this talk. although there are different micromobility systems like e-scooters, this talk will use bike sharing systems as an example for the following discussion. But I think the concept should be able to applicable to other systems as well. And since yesterday, we have heard a number of wonderful presentations on the discussion of the changing transportation system during the COVID-19 pandemic. Indeed, the ongoing pandemic largely disrupted everyone's travel behavior, I guess, and reshaped the urban mobilities. This, of course, includes the micro-mobility systems. We haven't seen like disruptions in these systems. However, despite the initial disruption, the micro-mobility systems, including cycling, like quickly rebounded into an important like travel option for essential travel activities. We can see, frequently reported news on the sold out of bikes nationwide, the reported growth of the bike sharing trips and so on. And personally, I haven't been using my bikes for a while. Recently I just took it out from my garage and riding it almost every day with my families as an exercise or as a short trips to some like shopping plaza. I believe many of you are also doing the same thing. So let's take the city bike system in New York City as an example. You can see, from these maps, you can see a comparison between like 2019 and 2020, the week 14 of the year, each year, and you can see significant kind of changes on the ridership. So you can see in this year it's pretty low compared to the other years, especially like in Manhattan area. You can see the difference. And also, if you look at the daily trips after the lowest kind of demand by the end of March, and you can see the ridership of the system is keep increasing steadily. Of course, there will be other factors like the weather is getting better, and maybe more people are using it. If you break the data into like individual trips, you can see the riders are now actually using the bikes for longer trips as well. This can be seen from the extended kind of tails of this trip duration distribution, which is shown on the chart. So like pre-pandemic, you can see most of the trips actually, their trip duration is limited within like 20 minutes. But now you can see more riders are using it for trips over 20 minutes. So we can see many riders are relying on this kind of systems. So arguably, I think there is no question that like bike sharing provides a very resilient option for travel during this pandemic. So it enables individualized trips to avoid a high risk or crowd environment present in other like transportation modes like buses or subways in the cities. Of course, these systems provide us a lot of convenient options. However, they are not risk-free, this is mainly due to the high infectious risk of the coronavirus. So there is also a growing concern about their potential risk while using this kind of shared mobility system. So obviously, this is mainly due to the fact that this kind of virus is likely to be active on the surface of the shared bikes. And we have seen a number of operators using different like cleaning or disinfecting practices to clean their bikes, and also of course the riders are also recommended to take cleaning actions before and after using the shared bikes. I mean, despite these kind of efforts, it's still, I think it's still challenging to continuously maintain the, let's say, cleanliness of these massive shared bikes. There are a couple of reasons. For example, these systems are not like the, let's say, the subways. They were not kind of following the fixed schedule. Riders can pick up these kind of bikes anytime they want, and also in like cities like New York, you cannot assign a staff to each station to clean the bike at and during each hours. That's not practical. So, and also for riders, we may not be able to really bring the wipes or bring the sanitizers with us every day or every moment while we're riding this kind of vehicle. Even after we drop off the vehicles, we may not be able to, get a chance to wash our hands. So these all, brings the risk if, someone who was infected and they use this kind of bike, and the next riders use the same bike. So this motivated us to think about the possible risk propagation in this kind of shared micromobility systems. In particular, if these kind of bikes or the vehicles become like media for the spreading infections, what will be the impact of different levels of initial infection carriers among the riders? What will be the impact if the initial infection carriers were especially distributed in different regions? So this motivated us to take a look at this issue, especially, we don't have the data, we don't have the real kind of data about the, let's say, the cases due to this use of bikes. So we take a simulation-based approach to have a higher level kind of examination of this issue. So without providing the detailed description of the simulation model developed, I would like to use this high-level illustration to explain the main ideas when we're doing this kind of simulation. In general, our simulation model includes like three main kind of key components. The first one is about the initial status of the riders, whether this rider is an infected person or not before he or she ride the bike. That's the first thing we need to consider. And the second thing is about the bicycles. When we drop off our bike at a station, the bike might be left there for a while, right? Once the bike is there, it's idling. The longer you keep it there, maybe it's safer. So if somebody just pick up the same bike you dropped off right away, and the risk might be higher because of this close contact of the surfaces, like the handlebars or the saddles of the bike. So you will have higher risk. So we will consider this kind of idling time when the bike was picked up for the next users. And also, of course, the third component is about the transmissions. If there's a bike, if the bike is contaminated, then whether that virus will be transmitted to the next rider or not, there might be some kind of probability issues, right? Not everybody will be affected, even there's a virus. I think not everybody will be immediately affected. So we can consider different probability to model this. So this just leads us to build this kind of simulation framework to look at the propagation of the virus kind of infection risk in the system. So I will just use this let me see. Hold on a second. Let me just use this. So I will use this short video to illustrate the process how we are simulating this kind of system. Like the red one is like infected users. He pick up a bike, then he drop off the bike at the station, and the next user, like the blue dots means the next user use the bike, the same bike, and then he returns the bike, and the third user will use it again. So this process continues, and the new riders might be like this situation. The new riders will be infected rider, and then he drops the bikes. The next user will be affected. So we keep counting this kind of process and try to monitor the infections among these stations. And like each battery sign here shows the counted infections, the estimated infections. So this process will illustrate, will be run for each bike and throughout the days. And eventually we will be able to look at the patterns in the system. So together we have looked at two specific cases. So the first one is considering about the initial proportions of infections. The second one is about the spatial imbalance of the initial infections. We have used 3 months of data from the city bike system in 4 boroughs of New York City as a test bed to run our simulation model. So this slide shows you the comparison, the results. The comparison between the trips aggregated in different time resolution and the estimated infection ratios. So overall, we can see the infection ratio will increase with the ridership, and weekend and afternoon peak hours will be more risky while you're riding this kind of vehicles. This is I think this is mainly due to the higher demand in these periods, and also they include they increase the use of each bike. For example, the average monthly frequencies of each bike being used in April is about 50, but in June it's almost doubled. It's over 100 times a month. So these things will lead to different kind of risk. Especially, we look at the distribution of the estimated kind of infections in the system, and you can see the ridership grows, more estimated infections are found across all boroughs. Manhattan area dominates the infections in the system due to its highest intensity of trips. And of course, when you consider different levels of initial infections, like here we use the probability equals 0.5% or 0.4 or 4%, there are resulting different results. And with higher probability, more infections will be observed in the system. Similarly, we break down the statistic into daily metrics, and we can see the infections will be almost doubled comparing to the initial conditions if the systems continue to support the riders. So similar kind of a simulation scenario has been done to consider the imbalance of the high-risk zones. Here we consider like Manhattan or Brooklyn as a high-risk zone, while considering other zones as a low-risk zone. And we want to see how these kind of spatial patterns will affect the propagation of the risk. So if you compare the first 4 graphs with the last graph, and you can see the changes. So that will highlight how the high-risk zone will affect the labors or the entire system. For example, when Manhattan was considered as a high-risk zone, it will also affect the nearby, like Brooklyn area, Brooklyn downtown area, and also part of the Queens area. So this is mainly because if many of you know the connections between Brooklyn and Manhattan, the Brooklyn Bridge has a nice bike lanes, so that will promote the use of the bikes between these 2 zones. Obviously, this will help. This will facilitate the propagation of the risk between these zones. So similarly, we also look at the daily kind of estimations, and the results show that if you are considering Bronx and Queens as the high-risk zones, they may not be able to result in the overall high risk in the entire system. However, if Manhattan and Brooklyn were considered as the high-risk regions in the beginning, the estimated infections of the system will significantly increase. So, and also you can see the infections can grow faster if Manhattan and Brooklyn were considered as the high affected regions. So these are the main kind of things we considered. And this is a quick summary about these things. We have explored these scenarios, and we can see the infection can spread to the entire system. Different factors, such as the initial status of the riders and the initial imbalance can result in different outcomes of the risk spreading. And errors with strong riding activities and trip exchanges should consider more strict cleaning and disinfecting countermeasures. Certainly, we as a rider, if we're using this system, we should take more cautions. I have to mention, some limitations of the study. We were trying to use this system, but we have not considered many other facts. For example, the cleaning interventions of the vendors and the users. And also, some other more realistic assumptions, for example, the risk among the riders of different ages. But overall, the proposed system can be extended to other systems like micromobility system, like e-scooters as well. So this is basically finishing my talk, and I would like to thank my collaborators again, and also thank the conference organizer to develop this great online conference. And thank all audience, and enjoy your rest of the day. I'd be happy to take any question. Thank you very much.
Thank you, Dr. Yang. That was truly interesting. I found it very interesting just how many people have been biking lately. I mean, it's just grown so exponentially. And like, I had my kids bike to their dentist appointments last week. So if you have any questions for Dr. Yang, please post them in the chat box. And now I will be presenting our next speaker, who is Dr. Michael Levin, who is an assistant professor at the Department of Civil, Environmental, and Geoengineering at the University of Minnesota. Dr. Levin is a member of the Network Modeling Committee of TRB and is on the editorial board of the Journal of Intelligent Transportation Systems. His research focuses on traffic flow and network modeling of connected autonomous vehicles and intelligent transportation systems. All right, thanks, Dr. Levin, you're on.
Yeah, can everyone hear me?
Yes.
Good.
Can you share your screen? We can see it, thank you.
Awesome. Yeah, so along with my colleagues, Raphael Stern and Mingfeng Shang at University of Minnesota, we were looking at how short-term travel could be used to explain the spread of the pandemic around Minnesota. So we created a novel SCR model, and then we did a case study calibrating against Minnesota infections. So here's kind of a graphic of the reported infections in March versus June. You can see there's in March, but most of the infections are kind of around Minneapolis, St. Paul, which has most of the interstate and international connections from Minnesota. There's some other cases in other major cities. But you can see that by June it spread around most of the states. And so we expect that a lot of the spread is due to like short-term driving trips as opposed to like international travel. So we wanted to create a model to predict that. Looking at this, there was another thing that we wanted to add here, which was trying to predict the detection rate of infections as well as the spread of infections, because as we know, due to limited testing as well as a high percentage of cases that don't really show symptoms, there are many cases that are expected to not be detected, but those cases are still contagious and still spreading the infection. What we did was we built off the SCR model. This has been used in epidemiology to model disease spread for quite some time now. It breaks individuals into 4 groups of susceptible, meaning individuals who could become infected, exposed individuals who are the virus is incubating and they will become infected, and then after they are infected, they either recover or they pass away from the disease, and then they are counted in the removed category. This is network-based, so we count the number of susceptible, exposed, infected, and removed individuals at each node. Here the nodes were the counties of the states. The number of infected individuals affects the spread of the infection, which increases according to the rate of spread parameter, as well as the number of susceptible individuals, and then those individuals become exposed, and then as time goes on, they'll become infected. Now, the main change we made here was we added a additional term where people who are infected in some node J might travel to node I with some rate of travel mu J I of T. And then those people who are traveling might infect people in node I, but then they would go back to node J. And this is different from previous work that looked at like international travel, because for those types of travel, people normally travel and stay at their destination for a few days or longer. For this sort of trip, you can imagine like people driving 30 minutes to an hour from one county to another, just as like part of their daily commute and driving back, but they could still infect people as part of that trip. So what we want to do is look at this model, mu-ij or mu-ji, the rate of travel. That's based on travel data. We do include a C factor, which is reduced rate of travel for infected people, which we also want to calibrate. Now, in terms of calibrating this model, we could calibrate it just against reported infections, like try to minimize the sum squared differences between our predicted infections I and then our reported infections I hat. But like I said before, we know that there's a lot of infections that are just not detected. So instead, we assume that we only detect some proportion of infections lambda I of T. And so what we're really trying to do is minimize the reported or the predicted infections times the detection rate minus the reported infections. And the detection rate is a calibration parameter. So if we try to calibrate this model, we might be able to get some sense of how many infections are undetected. The idea here being that if there are a lot of infections that are undetected but still spreading disease, then we should see a large increase in the number of reported infections that corresponds to how those undetected infections are spreading disease. The other calibration parameters are the rate of spread, the reduction of travel for infected people, and an initial number of exposed people. The initial number of infected people is, of course, based on reported infections, as well as the detection rate. Unfortunately, this is non-convex. We used gradient descent to try to find a local minimum. So here's some calibration results. I guess first I should talk about the data we used. We have the reported number of infections per county. And we also have county-to-county travel from streetlight. Due to limitations in data availability and processing, we really use just 3 intervals. One interval represents pre-pandemic travel. Then we have several intervals during the pandemic up to May 31st, which is the last date data was available. We also have an observed reduction in vehicle miles traveled for Minneapolis-St. Paul. So we combined these, scaled the travel down. And so you can see that, that in our travel, we see that pre-pandemic, there was like about 3 million daily intrastate county trips. That drops quite a lot. And then it's gradually increased again. We used 5 time periods for the rate of spread, and we used 1 value of the detection rate per week. The reason for this is to avoid overfitting. We could have used 1 value of these per day, but that would kind of overfit the model in terms of getting a good estimation for those parameters. The 5 time periods chosen corresponded to different policy changes occurring in Minnesota based on when the stay-at-home order started and then when businesses started to reopen. The parameters of the incubation time and disease duration we took from a paper in the Lancet Public Health. Not sure how accurate these parameters are, of course, just because so little is known about the disease, but hopefully the Lancet had some of the most updated parameters. In terms of the calibration, it actually looks fairly good. So the orange is our predicted line here. The green is the blue dots are the number of reported cases, but like you said before, we expect some cases to be undetected. So the green line is reported divided by our detection rate. So that's the number of cases we expect after the calibrated lambda parameter. And you can see the orange and green match fairly well. This is for total number of cases in Minnesota. It matches fairly well for different counties. So we look here, we're just showing Minneapolis and St. Paul counties. These are different counties. You can see that it matches them fairly well, even though like St. Paul obviously has much fewer cases than Minneapolis. So we're getting a generally a good fit in the calibration. I should also mention that the short-term model fits the data quite a bit better than a typical long-term network model where people are expected to stay there for several days. We produced a kind of a timeline of how the COVID-19 spread through Minnesota. There's a longer video here actually, but that we would have, but I'm not going to show it right now for lack of time. But it's going to show kind of how the number of cases evolved. Not just number of cases, but how it kind of spread around the state. Number of cases was highest around May 1st, 2020. You can see there's the dark red here indicates a lot of cases in these counties. They're kind of around Minneapolis, St. Paul. And what we see is that as we go from May to June, that there are fewer infections overall, but they're more spread out. I mean, there's some counties in May that have kind of few infections, but in June, those counties actually have quite a number of infections, even though there are fewer infections in the Minneapolis-St. Paul region. Now, one thing we were able to do, of course, with the model is that since we calibrated it to short-term travel, we can look at how different travel scenarios might have affected the spread of the pandemic. The purple line is the observed travel, meaning what happens is that we use the same travel we use the same travel parameters that were observed. And then we looked at, well, what would have happened if the travel had been different? So one thing we noticed in terms of travel is that around April 1st to 7th, that first week of April, travel was really reduced. And so what we saw is that if people had remained traveling at that level, there would have been some fewer cases, not a whole lot, but some fewer cases. If people hadn't traveled at all between counties, the number of cases was predicted to be far lower, which is the red dotted line. So travel does have quite a huge impact on the spread. If people traveled, if people didn't change their travel patterns and traveled the same as they did pre-pandemic, we would see this yellow dashed line quite a lot higher number of infections, peaking at 11,000 versus say 7,000. And so this reduction in travel can be explained by different lockdown policies, as well as a huge shift to working from home. So you can say that those changes in travel behavior probably had a nice reduction in the number of cases. This graph shows, or this map shows the change in infections per county. So this is like the percent change in infections from observed travel minus no travel. You can see there's a huge change in a number of infections in a lot of the rural counties around Minnesota. Small change around Minneapolis, St. Paul, but the big effect is in a lot of the rural counties. So what that shows us is that a lot of the spread of the infection around the state can be explained by these short-term travel behaviors. If we look at pre-pandemic travel minus observed, we do see greater numbers of infections in some of the rural counties, as well as Minneapolis, St. Paul. Probably explains people, or is explained by people traveling between Minneapolis, St. Paul, and these rural counties. Not as huge an impact as observed by snow travel, but still a nice way to see that the travel has an impact on how the pandemic spreads around the state. We calculated the reproductive number. Now, something to notice here is that we calibrated for the rate of spread. The reproductive number is the number of additional infections per infection. Of course, you want that to be less than 1. We can calculate that just basically by saying how many new infections are there per day divided by how many people are infected. So that's like the number of infections, of new infections per infection. And then we multiply by that by the duration of the infection. Looking at this, so this green tells us the calibrated reproductive rate. You can see that it was quite high in the first week of April, over 2, kind of decreased. It was lower in May, and then it increased again in June. The last time period is after businesses reopened. It's not really clear. I mean, it's hard to say why the calibrated rates are as what they are, but this does kind of show us that we've, for the most part, been well above 1, a reproductive rate of 1. The blue is the lambda, the detection rate. So this kind of, if we look on the right axis, this kind of estimates how many how many infections were detected. It started off around 50% and then increased, and it's been about 75% since then. These maps show the reproductive rate per county and the detection rate per county, so we can look at how well different counties are doing in terms of social distancing, lockdowns, as well as detecting infections. Now, taking this model, we can look at how the number of infections would increase based on different travel scenarios up through December 31st. Looking at the last reported, or the last calibrated rate of spread, we see that there would be quite a few infections if we observed the observed travel from June. If the travel was reduced, that would to the April levels, that would be quite nice in terms of reducing number of infections. Of course, with no travel, the number of infections is lowest. But something else to notice, so if you look at the maximum here is about 70,000, the peak here is about 180,000. So this graph is what happens if we use a rate of spread that we saw in April. So the rate of spread obviously has a huge impact on the predicted number of infections. This prediction, if we have a high rate of spread as well as observed travel from June, we would actually predict over half the state becoming infected by December 31st. We can also predict the number of removed individuals who can no longer be infected. That unfortunately is quite low, or around 1.52% for most of the states. So we're well away from herd immunity here. So overall, the conclusions that I have for this model is that we created a novel SDR model, and we've calibrated the infection detection rate as well as some other parameters here. And we've shown that short-term travel has quite a significant effect on the pandemic spread, and can be used to predict that pandemic spread. In terms of the future work, what we want to do is, of course, once you have more accurate parameters, that would be nice to recalibrate the model. It would be really nice to verify this predicted detection rate just against like mass testing, if that becomes an option. Looking at different trip types might help improve the predictions, versus like commuting trips versus recreational shopping trips. And then if we included interstate and international travel, that might explain some of the spread in Minneapolis or St. Paul or other major cities. So thank you. And do you have any questions?
Thank you. That was an interesting presentation. Did you compare to the VMT reductions that perhaps the Minnesota DOT put out in terms of, ADT reduction for passenger vehicles versus commercial vehicles?
We did not have trip reductions by type. We did have the VMT reductions from the DOT though. Just the total reductions.
All right. Let's see, there's no other questions in the chat box right now. If anyone has any questions, please feel free to put them in the chat box. And thank you very much for your presentation. That was, it was really interesting to see how inter-county travel really can spread the virus into the rural areas. All right, thank you. Our last presenter, we actually are going to have co-presenters, so both Hassan and Amin. Hassan is a PhD student in the Transportation Engineering program at UC Berkeley, working under the supervision of Professor Joan Walker. His research interests are in the areas of causal inference and behavioral modeling in transportation, with applications in transportation demand modeling, mode choice, and activity behavior. Amin is also a PhD student in Professor Walker's group with similar research interests in causal inference and behavioral modeling. All right, thank you. You guys are on and you can share your screen.
Thanks, Rebecca. I'm sharing my screen now, but Amin is actually going to be starting the presentation.
Oh, very good.
Yep. Can everyone see the screen?
Yes.
Okay.
Perfect. Thank you, Hassan, and thank you, Rebecca, for the opportunity to present our work to you today and to the rest of the group. I'm here with my colleague Hassan to present to you our work on the behalf of our amazing group that you see here. Their names are listed, of course, here. Our work is focused on really understanding the barriers And the behavioral compliance with stay-at-home orders or shelter-in-place orders, wherever that name might be based on where you are, and social distancing directives surrounding COVID-19. So what I will do here is I will talk a bit about the motivation around our work and set up the foundation for Hassan to really touch on the research framework and some initial insights we have. As we all know, like COVID-19 is a very complex puzzle and a very large puzzle at that. We've really seen that through, the presentations in this conference and all the other research out there in different fields from biomedical research, logistics, etc. But our research group is really focused on just one of these small pieces, which we think is really important, which is behavioral compliance. Why is behavioral compliance even important? Well, unfortunately now we don't have a really effective vaccine. We don't have an effective treatment either. So flare-ups or really breakouts of the virus can happen really at any time and anywhere. And this makes behavioral compliance with social distancing directives or stay-at-home orders the only remaining solution to really contain the virus and manage this pandemic. And this is clear from all of these quotes here from different government and public health leaders from around the country. So just recently in one of her media appearances, Dr. Deborah Birx, which is part of the White House Coronavirus Task Force, if anybody here doesn't know her, said that that this is a signal, or these current flare-ups is a signal to the American people that we really have to change our behavior before the virus completely moves back through the north. And she was referring to all these existing spikes that we have across the country. But how do we really get people to comply? How do we get them to comply with these directives? For us to really understand that, we really have to understand behavior and this heterogeneity and these barriers that we have to compliance. And understanding this behavior really will allow us to give these insights to policymakers that will allow them to design these policies or social distancing or stay-at-home policies that will have these high adoption or compliance rates, and therefore will help in controlling the spread of the virus across the country until we have a vaccine or a treatment available. But behavior is also, not very straightforward. It's not consistent across different parts of society. And this has been really, really evident through different media reports about protests either against social distancing directives or the closing of businesses or mandates about masks, etc., or protests surrounding racial injustice or police brutality. Also, the Pew Research Center has conducted a few polls since the start of the pandemic in March that show this very, very clear partisan divide here in the United States about the perception around COVID-19 as a major threat to the U.S. public health. So you can see that, that divide between Democrats or Republicans has kind of gotten wider throughout time during this pandemic. So for us to really be able to understand this behavior, we've been very fortunate and grateful to strike a partnership with MB Mobile. MB Mobile is is a market leader in mobile audience analytics, consumer panels, and mobile sampling. And they've really allowed us to tap into their very rich data set to analyze and glean some behavioral insights from it. The data set that they have is more than 100,000 individual panelists across the United States. This panel is also very representative of the United States population across all the different states. And the data that MB is collecting is on two fronts. So first of all, the location data, which is at the individual level. So we know the individual places that people have been at, how long they've been at, the type of place, whether it's a restaurant, retail, whether it's a home, etc., and where it is, obviously, and of course, like the geolocation and all of that. Something else that they have is app and web use data, so we can figure out, what websites are people visiting, or are they looking into things that are related to news sources about COVID-19? What apps are they using? Are they using apps to shop more, et cetera, et cetera? Are they using apps to watch more videos, all of that other stuff? So there's a lot to get out of there from all of this data. And something else is that MB has already done is that they've kind of went through some initial analysis of the mobility data to really assess the business impact of COVID-19 early on during this pandemic, which was somewhat similar to what Google or Apple has kind of done. And they've really found that the business impacts are very, very different. And they found that, for example, the percentage of people that have really visited restaurants in between the periods of February and March early on during the pandemic has dropped significantly when compared to the percentage of people that visited retail locations. So that just to really emphasize that point, that behavior is super complex and heterogeneous, and for us, we really need to understand that.
Thanks, Amin, for the background. So now what I'm going to do is I'm going to zoom into the specific question that we're interested in answering and our approach that we're taking in order to do that. So as the title of the presentation suggests, our goal really is to identify these barriers that affect people's ability and willingness to comply with these social distancing and sheltering in place directives. And so more precisely, what we're interested in is identify these heterogeneous effects, heterogeneous treatment effects, the treatment being these interventions, these policy interventions, and how it varies as a function of demographics, socioeconomic factors, beliefs, political orientation, and all these other factors that we believe affects people's mobility and people's ability to comply with these directives. So here's a timeline representation of our approach. So as everyone knows, in March 2020 is when the World Health Organization declared the COVID-19 a global pandemic. Through the data that we have access to that Amin just mentioned, we have passive behavioral data that captures people's behavior from September all the way through now. So we have this ability to observe people's actual behavior and mobility patterns before and after / during the pandemic. So this would be our outcome variable. But as we said, what we're interested in is understanding this holistic picture of what affects this mobility patterns that people are exhibiting before and during the pandemic. So in order to capture all these factors that affect mobility, we started a survey data collection effort on these panelists that MB have. And we actually designed our first survey and deployed it a week ago. So the survey is still live and we're collecting data right now. I'll go into more detail about what the survey contained and what the purpose of the survey is in later slides. So in parallel to that, what we're also doing is we're doing this comprehensive policy tracking to track both the location and the timing of the various policy interventions that are taking place as a response to this pandemic. And lastly, we already started designing future waves of this survey to follow up with our panelists from the first wave to kind of try to capture this dynamic nature and the changing nature of both people's compliance and the pandemic itself. So between September and December, we're planning to issue 2 or 3 more waves of the survey to capture these changing dynamics. So quick words here about the policy tracking that we're tracking. So what we're doing, because our treatment itself is these policy interventions, and what we're interested in is the effect of these policy interventions on mobility, we're tracking every rule and guideline that's been put into place in all these regions. Tracking rules and guidelines on COVID-19. We're also tracking public health programs and closures and reopening. There's sound in the background. I don't know if...
Nice session. Thank you.
Can everyone please be sure that you're muted?
Yeah, I just muted him. Thank you.
Thank you.
Can people still hear me well? Great.
Yes,
yeah.
we can.
Cool. Yeah. So, but we're also tracking these other metrics that may affect mobility, like all the collective actions related to protests that have been going on since March. We're also tracking protests against vaccination, mask wearing, and all these things to, again, capture this holistic picture. And so moving back to the survey, which is like the meat of our effort, well, what I'm showing here is a high-level causal graph that reflects our beliefs about what affects these the people's mobility and this ability to comply with social distancing and sheltering in place directives. So as you can see here, this is our outcome variable. So we observe it through this passive behavioral data that we have access to. But what I'm showing here is like it's not only a factor. This compliance is not only a factor of the orders put in place. This compliance depends on many other factors like economic factors, psychological factors, modality styles, political views, and all these other things that we know affects behavior. And so our goal from the survey is to at least touch with at least one question on each of these notes to be able to observe these variables so that we can control for them and be able to isolate the effect and estimate the heterogeneity in the effectiveness of these directives and interventions as a function of all these factors. So to just give you a flavor of how we're doing that, we, for instance, to get at the economic factors, we asked people about whether or not they experienced a loss of employment because of COVID-19, and if so, when did that happen? Because we expect if someone did experience a loss of employment, we're gonna see that in their passive activity data, we're gonna see a change in their mobility, and we wanna be able to explain that correctly as opposed to attributing that factor to something else. For instance, on the psychological factors front, we asked people how much they think they can endure the emotional impact of the COVID-19 pandemic. In terms of like political views, we asked them where they lean, whether they lean left or right, moderate or conservative or liberal on the political spectrum. We also asked them about their modality styles, because we also expect that people who are more transit heavy or transit dependent for their mobility are going to be affected differently than those who rely mostly on private vehicles. And we also asked them about their level of involvement in all the activism and protests that have been going on throughout the country. And so, as I said, the survey is very comprehensive. We had 78 total questions in total. I'm not going to go over all of them here, but the goal is, again, to get at all of these factors so that we can more accurately isolate the effect of these interventions on mobility. We tried in our targeting to be reflective of the US population, both demographically and geographically. And our target response from this first wave of survey is about 1,000 responses. The survey has been live for a week. We already got 755 responses. And I want to just give you a flavor about some of the things that we're already seeing in the data that, again, gets at this heterogeneous nature of compliance. So some of the things we've seen, for instance, here what I'm showing is the people's belief about the impact of social distancing on jobs and how it's different between different political orientations. So what we're seeing here is that people who identify more as conservative leaning or conservative tend to agree more with the statement that social distancing leads people to lose their jobs, as opposed to people who are more on the liberal side or moderate side. And what this means, like really, like people's belief about social distancing is really going to affect the rate to which they comply with these things. So the other thing here I'm showing, which was interesting as well, is this ability to withstand the emotional impact of the COVID-19 pandemic as a function of having access to a private vehicle in the household. And what we're seeing here is that people who have access to a vehicle are reporting that they can endure the pandemic for longer than those who do not, which really, again, gets at this, at the fact that people who have access to a vehicle have more, are able to more safely keep doing their mobility patterns from before, as opposed to people who rely on other public modes or mode sharing for mobility. Other things, the reason why that's important as well is that also this people's ability to withstand the emotional impact also seems to correlate with other things. Here, the question has been, was like, over the last 2 weeks, what is the largest crowd, or what is the largest event that you've been to? And we see that people who are saying that they cannot endure the pandemic anymore are maybe starting to go, again, this is all qualitative at this point, but we can see a signal that these people are starting to go to larger events as opposed to those who report that they can endure the pandemic for longer, which is also interesting, and again highlights this holistic nature of this problem and the problem of compliance. And the last thing I'm showing, although it's obvious, but it's also interesting to highlight, is that the mask wearing behavior, for instance, is correlated, and it seems strongly with how worried people are about contracting the virus. And while this is obvious, people who are more worried about contracting the virus will maybe wear more masks. It also highlights the importance of not downplaying this virus and giving people the right information about how dangerous it is, so that they don't feel too comfortable about it, and which obviously affects their behavior and how they respond to it. So these are some of the initial findings. The other things that we had in the survey is we had this open section where we let people list other concerns that they have, and really the main takeaway here is that people are hurting and they're feeling unheard. And to us, what this is, it's a great opportunity to be able to understand what are the things that are on people's mind and that are affecting their behavior and their ability to comply. because otherwise these things would not be observed. And our goal here is to synthesize these barriers into insights to policymakers so that they take those into account when designing these interventions to ensure high compliance rates. So very quickly about next steps about the current effort that we're currently doing. So we're currently processing the passive behavioral data into mobility metrics. We are continuing our response policy tracking, which is going to be an ongoing process throughout our effort. And we are in this design phase of the future survey waves to capture this dynamic nature of the pandemic. And the goal is here to combine this mobility metrics that we extract from the passive behavioral data with our survey, and then start to leverage some of the causal identification techniques from econometrics, as well as some of the heterogeneous treatment effect estimation techniques, to be able to model this effect of interventions and how it varies as a function of all these factors that I already mentioned. So these are things that we're working on right now, and we're hoping to have some results in the next month or two. Lastly, I just want to say a big thank you to our amazing team. We had a really mixed group of undergrad, graduate students, as well as faculty who are across very different disciplines in Berkeley. So people in city planning, engineering, and public policy, that really reflect how complex this problem is and how it needs all this interdisciplinary effort to be able to answer these questions accurately. And lastly, I want to thank our sponsors and our mobility partners who made this effort possible. The Berkeley Engineering, the Berkeley College of Engineering, the Civil and Environmental Engineering Department, Citrus, MB, who gave us access to their data, and as well as the Human Research and Protection Program at Berkeley, who made the process of having access to this valuable data easy. And if people have any questions beyond what we're going to be able to answer now, feel free to email our principal investigator, Professor Joan Walker. Her email is on the screen. And that's it. I'm going to open it up to questions.
Okay, thank you very much for both of your presentations. Using survey panels is a fairly new thing for a lot of transportation researchers. Do you want to, one of you, go into a little bit background on what a market research panel is and how one goes about sending out surveys to them?
Yeah, I mean, you've been involved in that process more. Do you want to go ahead?
Absolutely. So I'm going to talk about this just from the lens of MB on this side. So what they do pretty much is that they collect this data about behavior to pretty much inform all these marketing products that are going to be rolled out from different companies. So for example, just figuring out what type of news sources are people watching, or what type of websites are they frequenting, to be able to target certain products to them and figure that out from a really optimized way. As we said, we haven't done any work on that front previously. So it was also a challenge for us to really understand how we're going to be able to target these panelists, etc. But on our end, we weren't really responsible on the terms of any of the recruiting of the panelists or anything along those lines. MB has been responsible for that. All we do from our end is figure out who are these panelists that fit some sort of like demographic criteria of interest to us and target the survey to them directly. I'm not sure if that really completely or holistically really answers the question, but hopefully it gets there. And if there's anything, we would love to chat. And if there are any questions about that in detail, we would love to take that conversation, on email or anything along those lines.
Thanks. I think that was a good overview. It might be worth noting that the next gen NHTS that's going to be starting here is also using a market research panel to conduct its main household travel survey. And then there's a separate OD data component that passive OD data component that University of Maryland's putting together.
Yeah.
Okay, here we go. Here's last chance for everybody. Are there any other questions for any of our panelists? All right, in that case, thank you very much for attending. Thank you very much to all of our speakers today. Every presentation was truly innovative, and it was very informative to everyone attending. Our next session in this track will be starting at 45 after the hour or 15 till the next hour on the COVID-19 impacts. So thank you very much for joining us and have a good rest of your day.
First speaker is Charisma Chaudhuri. She's an associate professor at the University of Leeds, where she leads the Choice Modeling Research Group. She's doing a research project with another university. She's got 4 co-authors. I won't even attempt to pronounce all their names. So she's first. Second is John Carlos Parodi. He's trained as an architect and an urban planner with expertise in urban transportation planning. He was visiting a lecturer at ETH Zurich in 2019 and is now a lecturer at the Department of Urban Engineering at the University of Tokyo, conducting research on the relationship between built environments, social networks, and travel behavior. We're the third speaker, myself and Sadi Sabari, Shima Hamidi, who is the lead author of the paper, the peer-reviewed and published paper that we'll be discussing, couldn't make it, but Sadi and I will do it together. He'll present the results, I'll present the background. And the fourth speaker, and then I'll turn it over to Max, is Abdullah Alafarj. Sorry about that, the way I butchered your name. He's a PhD candidate in civil and environmental engineering at Carnegie Mellon. And his focus area is energy and the environmental impacts of advanced mobility. He's interested in climate change and mitigation, petroleum product demand, infrastructure, and the refining sector. So those are our 4 groups of speakers. And Max, turn it over, if you will, please, to the first speaker in the program.
Hello.
Oh, there you are. Good.
Yes. Can you see the right screen? Do you see the presentation screen, or because sometimes? Okay. Yes.
Yes.
Yeah. So that PowerPoint screen is shared, so you can just go. Yeah, there you go.
Okay. Is it okay? Okay. Yeah, so good evening, everyone from UK. And so as it was mentioned, I'm Charisma Chaudhuri from University of Leeds, and this is a joint work with my colleagues from Leeds, Zia Wadud, and also 3 colleagues, 3 collaborators from University of Indian Institute of Technology in Kharagpur. So we basically have a joint project with IIT Kharagpur on the impact of different factors on ride hailing. And when COVID-19 struck India, we thought that it would be really interesting to look at how actually the COVID-19 is affecting the mode choice behavior in India. And so just in terms of the motivation, as we are all aware, the COVID-19 pandemic was a big shock to the world, and it led to significant variations in activity and travel behavior. So one notable thing in this regard is, in terms of the changes in activity and travel behavior, there were actually significant spatiotemporal variation. The other aspect is actually this infection rate was also different in different countries at different point of time. So the unique thing about the Indian case study is actually in India, the COVID-19 started its spreading in mainly from March. So by the time the infection rates were growing, there was already a significant awareness about the deadliness of the virus among the people. So even before the semi-lockdown or the full lockdown was imposed, actually people were aware that COVID-19 is infectious, it's deadly, and there were some natural response in the activity and travel behavior. So they consciously changed it in order for their self-protection and also for the protection of the others. So we, when we looked at the passive data sources in India, we were observing these changes in activity and travel patterns. So we saw, for example, in the Facebook movement data that starting from March, there were a decrease in the number of trips. Then the Apple data showed that actually there were drops both in the number of people driving and the people of number who were walking. And contrary to the trend in the other countries, in India, actually there was a higher drop in the number of people who were walking compared to the driving, which was a bit different from the other countries. And I will come to it when I explain the results. And also, when we looked at the Google Mobility Report data, we can also see that the activity patterns were changing and there was a significant reduction in the public transport usage, which is similar to many other countries. But the problem with the passive data sources is it's aggregated, it's anonymous, and it does not provide really behavioral insights, especially like the heterogeneity in responses of different groups of people in terms of the infection rate and the influencing factors. These were quite different, and the passive data did not capture that heterogeneity because it's anonymous. So that motivated our study, and we were interested particularly, as I mentioned, on how it was changing the mode choice pattern, because the other data sources were indicating that the number of cars are less, but also the number of people in the buses and trains are less as well. So actually, how is the preference changing? So our a priori hypothesis was basically that the risk of COVID-19 is affecting both the number of trips and the choice of mode. So basically, we are looking at the change in the mode-specific trip frequencies. And the other a priori hypothesis we had was actually this trend of change. It is going to be different for commute and non-commute trips, or commute and discretionary trips, because the nature of these trips are so different in India. So the particular research questions we tried to address, first of all, how is the COVID-19 pandemic affecting the trip frequencies and the choice of mode? And then how they're varying between the commute trips and the non-commute trips? And then what are the implications in terms of the future transport demand and planning? So our approach was we wanted to develop a mathematical model to quantify the relationship between the mode-specific trip frequencies and the influencing factors. In particular, we wanted to quantify how this the mode preferences were varying among different socio-demographic groups, depending on age, gender, and income, and also depending on trip attributes, both the purpose, but also the trip length. And also, and the other thing is, which I won't cover in this presentation, but we also collected data on that, is how it is changing depending on the number of people who were infected in that area and what was the mortality rate in that area. So in terms of data, we did our own online survey data collection, and it was we had 498 individuals who participated in the survey, and this was a mix of both like recruitment through social media sites, but also a bit of paid advertisements as well. So we got quite a balanced sample. And then in the survey, we asked about the weekly frequency of travel by different modes in the pre-COVID days. So pre-COVID, we meant January, so when there was no threat of COVID-19 at all in India. Then we asked about the mode and the trip frequencies during the early COVID days. So this basically is the week before the 24th of March. So the data was collected from 24th March, and from 25th March, actually, the nationwide lockdown was imposed. But in our questionnaire, circulated in 24th March, we were asking people what were their choices made in the week before. So we were basically collecting the data when there was no restriction in place. And in addition to the travel behavior data, we asked about the person level and household level socio-demographic information. So in terms of the descriptive statistics, when we looked at how the mode usage was changing, we had several interesting observations. First of all, we saw that in the case of on-demand private vehicles, for example, like the Uber or Ola, the local ride-sharing company, as well as the shared vehicles, so this includes the buses and rails, we saw that there was a similar trend both for the commute and non-commute trips, and there was a kind of quite a marked reduction. But, and we also saw that in case of the virtual medium, so this includes the working from home and the shift to online shopping or online leisure activities. In this case, we saw that there was a shift in both for the commute and the discretionary purposes, but the shift was much higher in case of the work purposes. So we saw that more people moved to working from home compared to like online shopping, for instance. And then for the other category of trips, of modes, for example, the non-motorized transport modes and the private vehicles, personal cars, motorcycles, we saw actually the trend was different for the commute and the non-commute trips. For the commute trips, we saw that there was a reduction, but for the non-commute trips, actually, there was a kind of an increase in the use of non-motorized transport and the private vehicles. And this was attributed to the fact that it's linked to the fact that for the commute trips or for the work trips, more people were shifting to the virtual medium, and that was leading to the reduction. The next thing we looked at was actually how is this change happening? So what is the inertia towards different modes? So still before modeling, we looked at the data to see how the inertia was differing among different modes. So for the commute trips, we saw that actually the working from home had the highest inertia as expected. And also the working from home was the medium which attracted most of the diverted trips from the other modes. So for example, both for private vehicles, for the on-demand private vehicles, the shared vehicles and NMTs, people were moving to the working from home mode. And we also saw that when we compared it against the inertia towards the other modes, the on-demand private vehicles like the Uber and Ola, they had less inertia compared to the shared vehicles like public transport and non-motorized transport. And as I mentioned, the interesting fact about the non-motorized transport in India is actually the sidewalks are very often very crowded. So people did not really perceive that actually non-motorized transport is the safest mode because there was also a risk of coming in contact with others because of the crowding levels, basically. So then we looked at the inertia in case of the discretionary trips. And here we saw some similar trends. So for example, like there was more inertia in case of the private modes and the non-motorized transport in this case, but there was also a higher switching propensity to NMT compared to the online mediums and the private vehicles. So this basically motivated us that, okay, we need to dig deeper because it seems that inertia plays a big role, but there can be also interactions or heterogeneity depending on the sociodemographics. So we wanted to develop a mathematical model so that we can quantify the heterogeneity. And because of the nature of the data, we had the discrete choice of modes and the continuous choice of the frequencies of trips by that mode. We decided to do an MDCEV model, which is the multiple discrete choice extreme value model. So in this case, we assume that the baseline marginal utility of choosing the modes and the frequency of the trips, it was being influenced by the set of attributes that it includes the attributes of the alternatives and the characteristics of the decision maker. And also there were unobserved heterogeneity associated with that. And we assume that the satiation parameter in this case, which kind of captures if people are kind of satiated when they're consuming more of a particular good. In this case, we assume that this is not going to be a big factor. So we assumed it to be fixed across the alternatives. And similarly, so both the alpha and gamma parameters, which are related to the satiation, we assume that they were fixed to ones in this case, but in particular. And we estimated the other coefficients. So now coming to the results, we developed separate models for the commute trips and the discretionary trips. And we saw that in the commute trips, so the inertia played a big role, but the inertia also depended on the trip distances, which was quite interesting. So we saw that the inertia was quite high for the taxi, the ride hailing and ride sharing options. And ride hailing is basically where people did not have to share their Uber or Ola, whereas ride sharing involved sharing it with other users. So we see that the inertia was lowest for the ride sharing modes. Then when we looked at the personal vehicles, the car and the motorbikes, we saw that the inertia was higher for those compared to the on-demand vehicles. And the interesting fact here was it varied depending on the trip distance. So we saw for the commute trips, for the long distance trips, which were more than 5 kilometers, we saw that the car had a higher inertia, whereas for the shorter trips, we saw that the motorcycles have a higher inertia. Then when we compared these with the inertia for the non-motorized modes and the shared modes like bus and railway, we saw that they were lower compared to the personal vehicles. But the interesting fact here was actually the railway had quite a high inertia. And the reason for that, we think, is in a lot of the commute trips, people are captive railway users. So if they're making long distance trips, actually in our data, we saw that everyone using railway for their commute purposes, they were making quite long distance trips. So they did not actually have the option to use the other modes. So maybe they did not have a car, and the modes like ride sharing or non-motorized transport were not really feasible options. So we saw that there was still a high inertia. Then we looked at the sociodemographic variables, and we saw that actually not all sociodemographic variables were significant, but there was significant impact of or significant change in case of the gender, the income, the age, and the occupation between the pre-COVID and the early COVID days. And we saw that, for instance, for the female respondents, we saw that in general, they had a lower preference for car, which is related to the fact that in India, it's not super common that females have a driving license and they drive the car. So compared to the males, they had a lower propensity to use cars. But in the early COVID days, there was a even significant drop in that preference, and that is possibly due to the fact that more females were actually working from home in the early COVID days. Then in terms of the income, we saw that actually the higher income groups, they had a higher propensity to use the cars and ride-hailing modes compared to the other modes, but that propensity decreased in the early COVID days compared to the pre-COVID days. Similarly, depending on the occupation, we saw that the people who initially had a higher propensity to use bus in the early COVID days, the salaried workers had a drop in the propensity to use buses, and they were already kind of having a lower propensity to use the NMTs, and it reduced, but that kind of was a bit more favorable in the early COVID days, basically. So now when we move to the discretionary trips, we observed that actually many of the trends were similar, but the inertia variables were somewhat different. So in this case, for instance, we again saw that the inertia for the car and the motorbikes were different, and they were very significant. But in this case, we saw that actually the inertia was higher for the longer distance trips, both for the cars and motorcycles. So this kind of was a bit interesting because it was different from the pattern we saw in the commute trips. Then we looked at the inertia for the taxi and the ride hailing and the ride sharing, and they were actually quite comparable to the cars, but slightly less than the motorcycles. And in case of the shared modes, like the bus, railway, and the NMTs, we saw that there was less inertia, but again, the inertia for the railway was quite high. Then looking at the socio-demographic variables, we saw again, like the income, age, and vehicle ownership were significant, but the gender in this case was not significant. But we saw in general that the higher income people were having a shift in their preferences. So initially, the higher income people were preferring the ride-hailing and the cars, but in the early COVID days, they actually were avoiding the ride-hailing modes. So this is expected to have an impact on the ride-hailing demand because the main rider pool is coming from the higher income groups. So we saw some age-related differences as well. So in particular, we saw that the young millennials, they were having a significant disutility for the non-motorized modes compared to the pre-COVID days. But the middle-aged group, they were actually seeing a slight change in their propensity to use cars compared to the pre-COVID and the early COVID days. So, and the other thing we looked at is we found that the vehicle ownership has a significant impact on the choices, and we, I think I don't have a lot of time to go to the details, but basically this was very significant as well in the choice, both in the pre-COVID and the early COVID data. So now in coming to the policy implications, we saw that the model results actually can be utilized a lot in the transport planning. In particular, like it gives indication that what is the percent change likely to happen in the private vehicles, and what is the percent change going to happen in the public transport, and how it's going to vary depending on the different demographic groups. So this can be used to kind of target specific socio-demographic groups who are having a kind of drop in their preferences for certain modes. So for example, we were focusing mainly on the transport network companies, the Uber and the Ola, what it means to them. And we saw that the main problem was they're going to experience a drop in their shared options. So shared like Uber Pool and the shared Ola. So this is going to have some implication. But we saw that maybe for them, the online food delivery market can be a potential market where they can invest more. So now just wrapping up. So this is, we have written a paper based on the modeling results, but we are now looking at more at the regional variations and incorporating the effect of the context. So in particular, how the number of people infected, the mortality rate, the type of advisory that affects the choices. And in the long run, we also planning to combine it with passive data sources so that the biases in our sample can be accounted for. And we also plan to quantify the energy and the emission impacts based on these results. So now come to the questions. And I would just like to mention, actually, 3 of the co-authors are also present in the session. So if I'm stuck, maybe they can pitch in. And for the Indian co-authors, actually, it's quite late at night, 1:15 a.m. But they also are present in the session.
Okay, so thank you. This is Reed again, the moderator. There were 2 questions, one of which was answered by one of your co-authors, and it was a more technical question. This question is one I'd like you to address very quickly because we ran over our time a little bit. I didn't see a definition of inertia, so I have no idea what most of your results were. I'm quite familiar with multiple regression. That is not a standard term. Is this some term that is specific?
So in this case, we defined inertia that if inertia is basically inertia compared to the pre-COVID and the early COVID days. So if someone's main mode was suppose car, the propensity to carry on using car after the COVID-19, that is defined as the inertia towards the car mode. Is that clear now?
Okay, thank you very much. I'm clapping.
Thank you.
Okay, so Max, thank you. That was good, and I have a question for you, but I don't have.
The COVID-19 in Japan. First, some context. I'm pretty sure everybody's very familiar with this by now, but by March of this year, more than 100 countries have imposed some sort of mobility restrictions in their population that range from partial or total lockdowns to actually recommendations or non-binding requests for staying at home. The case of Japan falls in the latter category and starts with in February 26, when the central government issued a request to cancel or postpone large-scale events, and culminated in a full all-Japan level emergency state declaration in April 16. Certainly, there were some changes in response to these measures. This is data from the COVID-19 mobility report of Google. And we can see here is the changes in response to 3 key events. So from left to right, the 3 vertical lines indicate the first one, the Tokyo Metropolitan Government and the 4 adjacent prefectures in the capital issuing a joint stay-at-home request. The second line is when the central government declared a state of emergency for 7 prefectures across Japan, which include the greater Tokyo area. And the third one is when the central government expanded the target of the emergency state declaration to the whole country. So we can see here that for retail and recreation, for commuting, and for the use of transit stations, there's been a decrease in terms of usership. Not so clear in the case of parks or in the case of grocery stores and pharmacies. You can also see a consequent increase in activities around residential areas. question that we ask in this study is that given that stay-at-home requests are non-enforceable and non-binding, what factors affect the observed self-restriction behavior at the individual level? I think this is a key issue in the context of Japan, because since you cannot legally enforce a lockdown, the success of your policies actually depend on the compliance by the population. So to evaluate this, we conducted a web survey, a panel data web survey in the capital region, targeting the northern Kanto area, which is these prefectures around here, and the greater Tokyo area, which are these prefectures around here. So Tokyo Station will be somewhere around here. We use a quota sampling method due to the speed that we can actually gather data as compared to if we had to actually use the basic residence register data to be able to conduct a random sample. The first wave we gathered 800 responses, and the second wave we had a participation rate of 9%, so we gathered 722 responses. And the quota criteria was based on region, gender, and age. Basically, the data we collected is listed here, and I'm going to be discussing in more detail the ones that are in black. So measures for social anxiety, risk perception, perception with degree of going out, self-restriction, and then as a trial behavior measure, weekly trip frequency by purpose, before COVID-19 spread, which was measured retrospectively, and then after the spread before the emergency declaration, which was wave 1, and then after the spread and after the emergency declaration, which was wave 2. So in terms of risk recognition, we measure risk perception of COVID-19 using 3 questions related to the level of dread, familiarity with COVID-19, and the perception of the hazard controllability. We measured this using a 5-point Likert scale, and then we also measure other hazards to evaluate the relative risk perception of COVID-19. So these are the results for wave 1. As you can see here, COVID-19 is actually second to earthquakes in terms of level of dread, and I say considered the most uncontrollable hazard at that point in time. It's interesting because COVID-19, of course, has been a lot in the news. So relative to, for example, nuclear power plants, or there's a big difference here. And there's also the fact that elderly driving accidents have also been in the media a lot. So you can see here the relative standing is very high, again, compared to cancer or compared to nuclear power plants. So I think there's some sort of availability bias here as well. And then for the behavioral analysis, we codify these variables, so they take value 1 if the rating was 4 or 5, and 0 otherwise. We're going to be talking a little bit about that later on. To evaluate the perception of the degree of going out self-restriction, which is basically the social influence, we measured as a 7-point Likert scale the response to the question, to what extent do you think you and others are practicing going out self-restriction? So we measured this for relatives, friends, neighbors, work, school, friends, the general population, and then also for reference at oneself as well. So for the behavioral analysis, we use principal component analysis to extract a single component of perception of degree of going out self-restriction of others. That means, of course, excluding oneself. And then for ease of understanding, we normalize the variables so that the possible ranges of values fall between 0 and 1. We're going to see a little bit about that later on. So in terms of changes in trial behavior, these plots show the changes from T0 to T1. So T0 is before the spread of COVID-19, which was measured retrospectively. T1 is the first wave, and T2 is the second wave. As you can see here, from T0 to T1, there's a large share of the sample that reported reductions in activity frequency across all types of activities. There was largest change for no change. Sorry, the largest share of no change in behavior was for commuting and grocery shopping and other types of shopping, which makes some sense. We also saw that at T2 there was a rebound for shopping activities. So we suggest that maybe people are compensating for the fact that at the beginning they just overdid it, and they say, well, I can still go out, I can still go to the supermarket, etc. So that explains the level of increases from T1 to T2 observed for grocery shopping and other types of shopping. When you look at across all time periods, you can see that for the majority of activity, for most activities, there was a decreasing trend. And then when you exclude the individuals who had constant zero frequencies, which means that they never conducted the activity, you can see that the reductions, the percentage of people that actually reported reductions is very large. So it ranged from 34% for grocery shopping, again, the one that is one of the most necessary activities, to 87% for eating out for business. So this is the mean and standard deviations of each trip frequencies over time. And then I'm going to briefly discuss what kind of modeling did we conduct. So for grocery shopping and other shopping, which, as you can see here, had the highest frequencies, the distribution was actually allowed us to conduct some sort of linear regression analysis. We use trip frequency as the dependent variable. So we had three types of models with different assumptions. We have pooled OLS, which is a simple regressions. We had a random intercept model that allows us to have an intercept for each respondent. And then we have a first difference model that allows us to have a correlation between the explanatory variables and the unobserved fixed effect. So what we wanted to test is how sensitive are our results to the different assumptions. In the case of eating out and leisure, so notice that we're focusing on non-work trips, because in the case of work, the decision doesn't fall completely on you, right? So it depends on what type of work you're doing, what's your company, etc. So we excluded work-related activities here. So for eating out and leisure, both alone and in groups, the frequencies, as you can see here, are not that high to begin with. So what we did was we modeled the probability of actually self-restricting. So we have three models as well. The first two models are a pooled multinomial logit, where the choice is actually to go out or stay home. Those are binary logits, right? And then a mixed logit model with an error component at the individual level to account for correlated choices across the same individual. Again, the choices are go out and stay home. And then we also conducted a multinomial logit analysis of changes in frequency. So we use the first difference variables to create three categories that are increase, and no change. So the explanatory variables are also a first difference before introducing the models. I'm jumping right into the results. I'm going to be basing our discussion completely on elasticities and marginal effects, which is what we're really interested in. So we report here the elasticities of the perception of degree of self-restriction of others and the marginal effects of COVID-19 dread for each of the models estimated. And you can see here that although elasticity, the perception of the degree of self-restriction of others, that means how much you think other people are actually conducting self-restriction, was negatively associated with grocery shopping and other shopping frequencies, the elasticities are very small. So for example, for the pooled model of grocery shopping, a 1% increase in the principal component of perception of self-restriction of others will result in a very small 0.07% reduction in trip frequencies. And even smaller if you use the first difference model, which was, in terms of goodness of fit, slightly superior to the other models. For other shopping, we see a similar relation here, so we cannot say that the effects are very large. When you look at the marginal effects of COVID-19, the effects were estimated high uncertainty, so we cannot make any inference about this, but we can actually explain these results by the fact that shopping is necessary to some extent. And maybe leisure shopping, you still have to go to the convenience store, you have to go to the supermarket in spite of the risk. So that's why these activities will be less susceptible to social influence in the case of the perception of what others are doing, and then also less susceptible to the level of threat. So what you can see is actually what might choose to engage in physical distance or wear masks instead of just reducing altogether or stopping altogether shopping. Look at the discrete choice models, we can see different results, right? So here I'm presenting the comparison of the pooled binary logit model of self-restriction behavior and the error component mixed binary logit of self-restriction behavior, right? So the choice is to stay at home or not. And what we can see here is that the perception of the degree of self-restriction of others is positively associated with increases in probability of staying home. And that's the case for both models. You can see that the elasticity estimates are actually very similar for the pooled binary logit and for the mixed component, mixed error component, mixed logit. And what we see here is a 1% increase in the principal component of self-restriction perception will result in for the case of eat out alone, in a 0.17% increase in the probability of staying home. So while the effects are moderate, they are not negligible. We're going to see some simulations conducted later on. In the case of marginal effects of COVID-19 dread, we can also see that the significant positive effects, right? So what we see here is that people that consider COVID-19 to be actually dreadful are more likely to actually engage in self-restriction, right? So these effects, for example, these are marginal effects, so it's the absolute change in probability. So on average, a person that goes from thinking that COVID-19 is not dreadful to thinking that COVID-19 is actually dreadful will increase its probability of staying home by 10 percentage points, right? So this is, again, absolute changes in probability, not relative changes in probability. So these marginal effects are actually quite important, right? They're non-negligible effects. When you look at the multinomial logic model of changes in frequency, you can also see similar effects. So again, the perception of the degree of self-restriction of others was positively associated with increases in the probability of reducing your frequency of activities for eating out and leisure. And the marginal effects of COVID-19 dread indicate also are positively associated with decreases in frequency of these activities, right? So again, I'd like to point out here that these effects, while they are moderate in size, they are still non-negligible effects. So to drive this point home, which is the whole purpose of this paper, we conducted some simulations using our model results. And then in this simulation exercise, this is a simulation of the effects of perception of the degree of self-restriction of others and COVID-19 dread on going out self-restriction, namely stay at home. So its probability for eating out and leisure, and a comparison between the binary logic and the mixed logic results. And so the first thing I'm going to point out is that you can see a similar trend across all types of activity, in this case of eating out and leisure for these activities. And there's not a very big difference in terms of the logic model estimates. So either pooled or mixed, effect sizes are actually very similar. And again, pointing out that these effects are actually non-negligible, right? So they are important in terms of size. You can see here, so the point at 0 here indicates the case where you think that all the people around you are doing nothing about self-restriction, and the point 1 will be the maximum level value. So basically everybody around you will be engaged in self-restriction very earnestly. So you can see here the difference in probability for this case. The covariates of all the variables are fixed as shown here. But you can see here is a difference in terms of this represents the size effect of the perception of the degree of self-restriction, and the vertical difference between these two lines represents the effects of considering COVID-19 dreadful or not. And again, either being alone or in groups or eating out or leisure, you can see a similar pattern of important effects here.
Max, this is Reed. I think we are at the end point of this presentation. I'm sorry to have to cut it off, but it looks like it's going to go on for quite a while.
Yeah, for sure.
So what I think we should do is go on to the next presentation. So this is a little different. This is a paper that's already been published. Let me show you the entire screen. It's very different from the first two in terms of its emphasis. It's based on data. We originally gathered data at the county level on infections and deaths. Then very soon after we did it, and it took, a day to do a full survey of the United States, Johns Hopkins and CDC and others began collecting data, which we then used to model two things: infection rates and death rates. Shima Hamidi is not with us. She's at Johns Hopkins. She can't be with us for this presentation. I'll start off with background, and then Sadi Sabari, who's a doctoral student, will finish up with methodology and results. So starting now, to model something, you need to be able to measure it. We've been measuring sprawl, urban sprawl, as we defined it since really the early 2000s. You could even go back further than that. Kara Kockelman has been doing the same thing at the neighborhood level. So we've had a great interest in the United States in the effect of the built environment on particularly travel outcomes, but increasingly other quality of life measures. What I'm focusing on today is the first dimension of sprawl, low density. So low density equates to sprawl, medium to high density equates to compact. And I'll be using those two terms, sprawl and compactness, interchangeably with density and sprawl. I'm gonna show you me, even though you may not want to see me. What is being shown here are articles that were published in the popular press right after we released our sprawl metrics, and specifically how sprawl affected obesity in the United States. It was a big deal because no one at that point, that was 2003, had looked at the built environment and its effects on obesity and hypertension and diabetes and so on. So we published our paper, and then others and ourselves followed up with other quality of life investigations. We're trying to find out how sprawl or low density affected physical activity and traffic fatalities and air quality. And what we found is that the sprawl generally has costs relative to compact development. There are also benefits. There are lower housing costs, for example, is a benefit of a sprawling metropolitan area or a sprawling county or a sprawling census tract. But for the most part, all of these you see here are costs. Like, for example, emergency response times are longer in sprawling areas than compact areas. This is just one graphic we're showing you just to kind of indicate the way we're approaching sprawl. These are satellite images. New York on the upper right is the most compact metropolitan area in the United States. Hickory, North Carolina is the most sprawling. And even at this elevation, you can see marked differences in urban form, with the grayish tone being developed and the greenish tone being undeveloped land. So we came out with, in 2014, NIH funded us to update our sprawl metrics and our cost of sprawl studies. We found that, for example, in this first one, that people were much more likely to walk to work in a compact area than a sprawling area. They were more likely to take transit. That shouldn't be a big surprise, but we quantified the effects. In this particular study, we looked at 3 levels of crash severity. And again, this is related to health, like our paper is to COVID. We found that severe crashes specifically those that resulted in a fatality were more likely in sprawling areas, maybe because people drive so much more than they do in compact areas, and also they drive faster, and we measured that. We found that while housing is more expensive in compact areas, like think San Francisco, transportation costs are much lower compared to Houston or Atlanta, where the housing costs are low, but transportation costs, because you have to own 2 cars, you have to drive miles to do anything, transportation costs are much higher. And on balance, compact areas have a slight advantage. So these are all studies, and just a few of them looked at body mass index, hypertension, etc., and confirmed our earlier results that people living in compact areas, when you control for their race and their age and their gender and education and so on, people in sprawling areas tend to weigh more than people in compact areas. So generally, as I said before, sprawl is a negative thing, and compact development measured in terms of density and the other dimensions is a good thing. So it was a very natural extension when the COVID pandemic hit to ask the question, does the pandemic spread faster in compact areas or sprawling areas? It was just a natural extension of work we had been doing for 20 years. We made it our mission to publish the first paper on the subject of COVID from the standpoint, the first published peer-reviewed paper on COVID and its effects on the or its relationship to density. So we published in the Journal of the American Planning Association, or JAPA, which is the flagship journal of the planning profession in the United States and actually worldwide. We published, does density aggravate the pandemic? And with the subtitle, Early Findings. So we're not saying that these findings will hold up. We basically studied the pandemic as of May the 25th in how other variables affected number one, the infection rate, number two, the death rate. And, you know, it could be different today. We're going to go back. So very quickly here, the pandemic, this is from the New York Times, has been particularly devastating to the biggest cities as the virus has found fertile ground in the density that is otherwise prized, saying dense areas have more infections and deaths. That's not what we found. We found that big cities, big metropolitan areas do have more deaths and infections, but not dense counties within those metropolitan areas. Here's another example. This is from CNN, where we find another example of this idea that people should get out of cities and quickly go to the suburbs. This is Andrew Cuomo, governor of New York, saying it's very simple. It's about density. It's about the number of people in a small geographic location, allowing that virus to spread. Dense environments are its feeding grounds. So that had become sort of the conventional wisdom, that you don't want to live in a dense area. I'll skip this next slide because I think I'm running a little into Sadi's time, but how you measure the infection rate and the death rate becomes very important. We did it per 10,000 population. This one is, I think, my last slide. making this distinction between metropolitan area size measured in terms of population and density. So it turns out that the least dense counties in the New York metropolitan area have low density, but they have high death rates compared to the most dense counties in these smaller metropolitan areas, which have lower death rates. So confounding population of the metropolitan area with the density of sub-areas is a common problem. It's not New York because of its density, it's New York because of its overall size that was the epicenter originally of the pandemic. Actually, one last distinction. So I made the distinction between size and density, also between density and crowding. In the suburbs, in the low density suburbs, a bar is likely to be crowded. A school is likely to be crowded. A beach is likely to be crowded if it's a nice day. So crowding is different from density. You can have social distancing, and in fact, our results suggest that you do in a dense area to a greater extent than in a sprawling area. And with that, I'm going to make one last point. This has been studied before. It was studied after the Spanish flu of 1918, and there was no consensus whether dense areas were more likely to promote the spread of the Spanish flu or less likely. So that's our question. That's our research question. And Sidi will take over now.
Okay, thanks Reed. Thanks Kara and your colleague for organizing this conference. So if you look at the literature, we see that we realize that the dynamics behind this pandemic or all pandemic spread are very complex. There are so many confounding variables. There are so many things that play, like in terms of socio-demographic characteristics, age and other variables are important, social inequalities, access to resources, and all these things which we, in our study, we try to somehow control, at least for most of them. In terms of the modeling approach, we use structural equation modeling, or SEM. The main reason for using this is that SEM is the perfect approach because we have both direct relationship and indirect relationship through our mediator, which here is COVID-19 infection rates. So here, as an example, you can see that the county density is directly related to the COVID-19 mortality rate, but also indirectly related to that by the COVID-19 infection rate. So the common sense here, or what Reed showed you in the newspaper, is that county density, increasing county density will lead to higher infection rate, which will lead to higher mortality rate. In terms of explanatory variables, we try to control for many confounding variables. In terms of socioeconomic, population, and in terms of connectivity, we try to control for both internal connectivity through metropolitan size or population and employments per 10,000, which is our external connectivity. Some other variables, for compactness, we use activity density, which is population plus employment per square mile. And for percentage of staying at home, we use the variable which was developed by Maryland Transportation Institute, and some other variables related to health characteristics like ICU beds, COVID-19 testing rate, and so on. This map shows the counties in our study, except the ones that are in Alaska and Hawaii. We, at that time, May 25th, we had 913 counties that had at least one confirmed death and confirmed infection case. And our unit of analysis is at the county level. In terms of our dependent variables, so we have two variables. One of them is coronavirus per 10,000 population, confirmed cases and confirmed deaths. We try to use a natural log of these two variables because to make them to be more normal, it's just a basic assumption in linear regression, which we try to control for. This is our final causal path diagram. As you can see, some variables are directly related only to death rate. Some of them are only related to virus rate, and some of them, like activity density, which I mentioned, you can see the causal path from the activity density on the top to both death and virus rate. And here is our results. Unfortunately, because of time, I will only talk about two of the important variables. So in terms of the density, activity density, it has positive relation with COVID-19 infection rate, but it's not statistically significant. One possible reason for this insignificant relationship is that maybe density is playing two conflicting roles. On one hand, density increases like contact with other people and likelihood of the transmission of the diseases. But on the other hand, density can facilitate the implementation of social distancing orders because of the better like home delivery services and also higher perceived susceptibility to threat and therefore more precautionary behaviors. But on the other hand, you can see the ln of MSA population, which is natural log of metropolitan population. It's positively related to COVID-19 infection rate. So in fact, I should mention this, that this variable has one of the most significant relationship to the of all of our explanatory variables with the infection rate. So this means that the pandemic spread is with the movement and interaction of people is in large metropolitan areas will lead to higher infection rate. But in terms of the mortality rate, you can see that natural log of activity density is negatively related to COVID-19 mortality rate, and that's because of possibly because of better healthcare facilities and system. But in metropolitan population is positively related to the mortality rate, and all of these signs are statistically significant, which means that the connectivity is more important than density. This effects of our variables on COVID-19, only COVID-19 mortality rate. Notice that since we are using natural log, these variables, these numbers are elasticities. What that means is that here, for instance, if we double the activity density of a county, we should expect to see 11% reduction. Look at the total effect, 11% reduction in COVID-19 mortality rate. On the other hand, if we double the metropolitan population, we should expect to see almost 22% increase in the mortality rate. So that was our first study. We tried to have one follow-up research, and this time, instead of using cross-sectional data, we used longitudinal data or time series data, and our analysis was again, it's also growth curves model. We used data since the first case was confirmed in each county till May 25th. And our results show that we have almost consistent findings with our previous study. And our study showed that large metropolitan size will lead to significantly higher COVID-19 infection and mortality rate. County density not only decreases the death rate, it will also lead to lower COVID-19 infection rate as well. So I only have like 30 seconds. Let me wrap it up by saying that what is happening in reality is that, like we are seeing that according to one survey, about 27% of adults, 43% of millennials are trying to go or move to suburban and exurban areas. And even businesses are following them with suburban office relocations. But what we found in our studies, in both of our studies, which are published in prestigious journals like JAPA and the Journal of Health and Place, is that planners should continue to advocate for compact development, and this is our synopsis. The fact that density is unrelated to confirmed virus infection rates and inversely related to confirmed virus death rates is important, unexpected, and profound. It has implications for community design, regional planning, transportation expenditures, urban redevelopment, tax policy, congestion pricing, smart growth, affordable housing, and nearly every other front burner issues important to planners. Thank you so much. Below you can see the link, our papers, our references for this presentation.
Yeah, and they are available free of charge.
Yeah.
Real quickly, last thing, you can go to the JAPA website and download the JAPA paper. You can go to Health and Place and download that paper. We have 0 minutes for questions and answers. Let me see if there is any question that's shown up in the chat. My computer is slow, very, very slow. Sorry.
So Reed, this is Cara. Rebecca had asked, was there any consideration of changing city population? For example, everyone in New York City was able to move out if their job, allowed them to, so that reduced their population.
Yeah, that is such a cool question. That is so cool. That's sort of not the point of our paper. The point of our paper is that if you're thinking, I live in the central county of the Salt Lake metropolitan area. I could move to Draper and the density would fall and I would probably feel safer, maybe or maybe not, but I'm perfectly safe where I am. In terms of some sort of conclusion about whether and to what extent population should be concentrated in metropolitan areas or dispersed from larger metropolitan areas to smaller metropolitan areas, we didn't address it. We also don't think it is a particularly relevant idea because people are going to go to where there are jobs. That's the primary driver of growth. And if Salt Lake City, and we do, have lots and lots of new jobs, people are going to move here. And if Detroit doesn't, people are going to leave Detroit. They're not going to base that on whether the area is large in population or small in population. Whereas density is different. Density is something where I chose to live where I do in the densest part of Salt Lake City for a host of reasons, and I'm perfectly comfortable living here with the pandemic. That's the choice that at least the media says people are contemplating. Do we move not from one metropolitan area to another, but out of the city into the suburbs? And our answer is no.
Right. And Giovanni Tirtella had mentioned that we also have to plan for the long term, and he thinks COVID will leave us within the year or something. Although they do expect other types of viruses to emerge, partly because of human settlement and sprawl in China and lack of refrigeration and all sorts of things that go on there. So I think that's correct. Planning, there's lots of reasons. It's not just COVID transmission. There's a whole benefit cost analysis. And I had asked in the chat box, maybe you or your co-author can answer this question, how much worse is obesity and healthcare costs in those low density settlements? And is it really continuously changing with density? Because when I've looked at VMT per capita, which would be a big, I think, metric for walking and active travel, it wasn't until the top decile or the top 10% most dense in terms of population and jobs locations in this country, maybe census tracts, for example, the top decile census tracts, that you really saw the VMT per capita actually fall, and VMT ownership or vehicle ownership per capita, they really didn't seem to move at all until we got into that top decile.
Yeah, we did not do that. We treated density, we logged density. So we didn't treat it as a linear relationship, but we did not look for cut points. And that's a very interesting area that should be explored. And apparently you have. I wasn't aware of that. In all the work we've done, and we've done so much related work, we've treated density as if it's continuous rather than a step function, and did in this study, but there will be hundreds of other studies. We know this from our original work on sprawl and obesity. Everyone and his brother is going to be researching this from now on, and there will be hundreds of papers, and this is a great suggestion for someone who's thinking, should I research something new? I think we're out of time now, and we should move on very quickly, Mac.
Okay, thank you everyone. I'm Abdul Alfaj from Carnegie Mellon. Today I'm gonna present to you our work that I did with my professors, Professor Michael Griffin and Kostas Samaras, on using robust decision-making RDM to assess the pathways that lead to decarbonization of the US light-duty vehicle sector under uncertainty, and also considering the impact of COVID-19 on these robust pathways. So this is an area of work that we did in 2019, but then with the pandemic, unprecedented conditions, we revisited our results and considered some COVID scenarios. So the reason we are talking about light-duty vehicles, passenger cars, and light trucks is because light-duty vehicles account for about 60% of the US greenhouse gas emissions. So any transportation sector decarbonization strategy must address light-duty vehicles as a primary component. And given the advantages of incumbent vehicle and refueling technologies, as well as the growth of ride sourcing and vehicle automation, any major shift to other modes would require social, technological, and infrastructure changes, and that would be challenges. The fuel with the highest potential, the alternative fuel with the highest potential to gasoline is electricity. In the United States, according to EIA, in 2050, it's expected the carbon intensity is expected to go down by about 38%, but still needs to go down a lot further. In terms of electric vehicles, the global EV market share in 2040 is expected to reach about 58%, according to Bloomberg. Currently, we have about 7 million electric vehicles on the road globally, but this only makes about 1% of the global fleet. So the time required for fleet compositional changes can constrain options and strategies, and it will depend on the pace and scale of vehicle electrification and electricity decarbonization to determine the future transition. In terms of travel demand, it has always been increasing and only decreased slightly during the last recession. So in normal times, travel demand is hard to bend. However, we don't live in normal times. EIA expects in year 2020, the US GDP to go down by about 8% because of the pandemic and the lockdowns. And with the reduction in travel, the demand for gasoline and the supply of gasoline is also expected to go down by about 10%. This shows you how deeply tied the US economy is to petroleum-based transport. We're also at the beginning of a new era of advanced mobility in terms of electrification, ride sharing, and ride sourcing enabled by transportation network companies like Uber and Lyft, and also vehicle automation coming in. So all these revolutions can change travel. We don't know how vehicle sales, ownership, VMT, and the level of sharing will be, and ultimately this will affect fuel consumption and emissions. So we need to think about all these factors when we address such uncertainty and when we examine the future pathways for decarbonizing passenger transport. So our research question is, what are the robust strategies for transportation decarbonization under uncertainty? How can we identify the most robust decisions for decarbonization? How will the future US LDV look like? So our goal is to decarbonize the mobility services, and if we consider an 80% reduction in CO2 by year 2050, this is a common mid-century decarbonization benchmark target. And also we considered 90%, 100% reduction. And we also considered 50%, an interim midterm goal of 50% reduction by 2030 from the 2005 level. So we have 250 million metric tons by 2050, 570 million metric tons by 2030 as goals that we will see if different futures can achieve this or not. So we need to identify the robust pathways to achieve those targets. In traditional decision methods and traditional problems, the predict and act framework makes sense when we don't face much uncertainty and when the future isn't changing fast or it is not hard to predict and doesn't generate much disagreement. However, in our case, we need to rely more on robust decision making because it works better under deeply uncertain conditions, like the issue of decarbonizing passenger transport, where we start with proposed strategies and then we use multiple model runs and identify conditions that best distinguish futures where our strategy work or meet our goals or don't meet our goals. And then we identify the steps that can be taken so strategies may succeed over a wide range of futures. And then we identify the vulnerabilities. So we want to look at the clusters of different simulated futures, successful simulated futures, and look at the combination of different parameters that make them successful. So we have a large uncertainty surrounding different parameters and variables related to the light-duty vehicle transport in the United States. For example, we don't know about the automation market entry and impact of automation, things related to the market penetration of electric vehicles, the rate of decarbonization of electricity, and so on. So we started creating a simple and representative model for the US light-duty vehicles that can generate internally consistent samples drawn from the possibility space. We collected data from historical data for things like VMT and vehicle sales, and also from projected data, and created distributions for the input parameters. And then we considered two scenarios. So for the three parameters that we see in red, the introduction of fuel economy improvements, the electricity decarbonization, and the rate of EV adoption, we considered two scenarios of when these interventions that are deeply tied to policy making will be introduced. In the immediate action scenario or strategy, they start in 2018. In the delayed action, they are delayed by 6 years and only start in year 2024. And for COVID-19, we considered three scenarios. These scenarios vary on the basis of the rate of recovery and the previously projected recovery from the previously projected trajectory for each case. So we have COVID-19 A, B, and C. In all of them, we have a 50% reduction in new vehicle sales and VMT per vehicle in years 2020 and year 2021. The reason we used 50% reduction is because we saw in the earlier literature this year that looked at the impact of COVID-19 during the peak of the lockdowns in April and May, that there was about 50% reduction in surface transport activity. And then the difference between these cases is in the rate of recovery. So COVID-19 A returns the original pathway for each case in 2022. B returns by only 75% in 2023 and 2024, and then after the year 2024 it returns completely. The third scenario can be thought of as a hypothetical scenario when the pandemic causes a permanent paradigm shift in passenger mobility. We applied all these three COVID-19 scenarios to the immediate action scenario, and we acknowledge that this is a short list of scenarios that doesn't nearly cover the wide range of possible impacts and rates of recovery from the pandemic. However, we need to include some plausible and even test cases scenarios when we do RDM. It expands our thinking to include these tail end situations that might expose some vulnerabilities. And COVID-19C can be thought of when the conditions of the pandemic cause some permanent sustained change throughout 2050, with the 50% reduction becoming a result of a structural change where working from home and relying on things like e-commerce, or in another scenario where we have a large mode shift from passenger vehicles becomes a more permanent change. So we start with the results of the immediate action scenario. We simulated 1,000 future cases. So each case is an evolution of the US LDV sector from now to 2050. What we found is that only 23% of the simulated futures meet climate goals. 17% meet only the 80% reduction target, 6% meet the 80% and the 90% target. So meeting the 90% target, the more stringent one by default, or meeting the 80% target. For year 2030, for the midterm goal, we showed the goal of 570 million metric tons by the horizontal black line, and only 6% of the cases, of the 1,000 cases, barely meet that goal. And these cases, when we follow them to 2050, they maintain low emissions trajectory. But some of them do not, but most of them maintain low emission trajectory. So meeting the 2030 target is not required for meeting the 2050 target, but it helps because so many cases, as we can see, didn't meet the 2030 target, but ended up meeting either the 80% or the 90% reduction by 2050. What we need to look for the combination of parameters or the requirements that make some cases successful. So we found that the maximum allowable electricity carbon intensity is about 220 grams of CO2 per kilowatt hour. Remember that currently we're at about 400 grams of CO2 per kilowatt hour. So we need to cut our electricity carbon intensity by about half. For the electrification of travel, we need about minimum 69% electrification of the travel, of the miles. And we can also see that the 90% cases that are more clustered towards very high electrification of travel and also very low near zero electricity carbon intensity. Now we look at the delayed action scenario and the COVID-19 scenario. Remember that the delayed action scenario represents a 6-year delay in the introduction of 3 interventions. These 3 interventions are the annual new vehicles fuel economy improvement relative to the baseline, the first year to decarbonize electricity leading to the simulated 2050 carbon intensity level, and the first year of the EV market adoption curve. What we saw in the delayed action, before we consider anything related to COVID, no cases would meet the stringent goal of 90% reduction in 2050 with the delayed action. And also the overall number of successful cases goes down from the percentage goes down from 23% to 13%. So about 44% reduction. And as I said, the stringent target becomes infeasible. When we look at the COVID-19C with its permanent impact caused by a 50% reduction in sales and VMT per vehicle from now to 2050, we see that the share of successful cases approaches 100. And for the COVID-19 A and B scenarios, given their fast recovery, almost 30 years prior to 2050, we did not see any meaningful change to the immediate action scenario when we look at the 2050 goals. And such scenario, the COVID-19C, it can be perceived as less likely or only possible through unprecedented shift to other passenger travel modes, or when working from home and relying on e-commerce and food delivery becomes the norm for decades. We need to also consider a major caveat here is that there is an expected leakage of emissions when we consider structural changes like this. So other uses and other sectors like e-commerce and so on, they will pick up the emissions. Also, when we talk about mode shift to public transport, emissions from public transport will increase if we shift all these miles. if we look at the 2030 goal now and compare all these different scenarios, we saw earlier that the immediate action only 6% of the time meet the 2030 goals. With the delayed action shown in blue, you cannot meet the 2030 target in all the 1,000 cases. With the COVID-19 A and B, the 6% increases into 17% and 24% respectively. And with the COVID-19 C, the one with the permanent change, you meet the 2030 goal in all the cases. So the reason why only 6% of the cases under immediate action, even with the immediate action, met the 2030 goal is the short time period because of the need for stock turnover and changing the vehicles, which takes time. But if the pandemic impact on travel is sustained for the next 2 to 4 years, with the assumed levels of reductions in number of vehicles and travel, the challenge of the stock turnover might be offset. So overall, the pathways that facilitate early and stringent emissions reductions are more robust in achieving climate objectives under uncertainty. So far, we saw different cases that can meet the mid-century goals.
Yeah, excuse me, I think my job as moderator is largely one of timekeeping. Could you close your remarks in maybe
yes,
2 or 3 minutes?
Yeah, that's enough. 3 minutes is enough. Okay. So since climate change is a function of cumulative emissions, we know policies that should be guided towards pathways that both meet the climate goals and also achieve minimum cumulative emissions overall. So we looked at the different cases and we looked for ones with the minimum cumulative emissions overall. And we found a case with number 883, for example, that shows an example of a low cumulative emissions and also meets all the goals. So we tried to look into it and see what makes it successful. And it's a case where everything went right, where the total stock of vehicles was only about 278 million vehicles by 2050. This is about 17 million vehicles lower than the EIA base projection, a whole worth of about 1 year of new sales. Also, this case had a limited increase in VMT when we introduced automation and so on. So you can think about it with, this is a case when we have some shift of some miles to other modes and also higher sharing of the miles. Also high adoption curve for EVs, deeply decarbonized electricity grid of about 24 grams of CO2 per kilowatt hour, so near zero electricity, and almost doubling the fuel economy of the new vehicles every year relative to the baseline. So these are the attributes that made it successful. As we can see here in the green line, reaching full market penetration of EVs by 2030, and the fleet average fuel economy in miles per gallon of gasoline equivalent was higher than 120 miles per gallon by 2050. So this combined with deeply decarbonized power mix go a long way in accomplishing the climate mitigation goals. And examining this case also reinforces the need for the synergy between the multiple policy interventions. So in conclusion, we saw that we need early action for high vehicle fleet electrification, fuel economy increase, and deep grid decarbonization as they expand the feasible future space and open up options. When we looked at the COVID-19 and we saw how structural changes to passenger vehicle travel, they could enable decarbonization. Of course, we don't want to do that through a pandemic, but this shows you the power of a paradigm shift with ride sharing and mode shifting and also working from home. And finally, what we saw with the example of this case 883 that shows that a robust pathway where synergy between the multiple policy and technology levers was required, and it hedges against the uncertainties of the future. With that, I will end my presentation, and thank you very much.
Thank you very much. We've run over time. I'm not sure exactly how that happened, but I don't see any in the chat room. I don't see any questions except one for us, which should have been clear. I guess I didn't make it clear, but our death rate is relative to the population. It's per 10,000 people, not per 10,000 cases. So that's the answer to that question, which Richard Young asked. I want to thank Charisma, Juan Carlos, Abdullah, and again, Kara for arranging this and becoming aware of our paper and inviting us to participate. Kara, are you thinking that Juan Carlos will now present live? Oh, you're muted.
Yes. Sorry. Yes, absolutely. So Max is making him co-host right now, and because his recording was pretty choppy and people may have some questions, and of course his recording maybe went a little long, so we're going to have him presented, hopefully sticking to about 20, maybe 22 minutes, and we'll clip that recording and put it into the proper place and then post those online next week for people who missed the track. So there's lots of ways to catch it. You can stay here with us right now, or you can catch it next week when it's posted online.
Okay, well, thank you very much for attending, everyone who did, and stay safe. Wear a mask, wash your hands, etc. Even if you live in a large metropolitan area, which is less safe than a small metropolitan area, you can take precautions.
Yeah, go dense and go electric. Let me know if you have any questions about the Tesla Model 3 or my Prius, and hopefully all of you are driving electric ASAP to help make those good scenarios come true from Abdullah's and Michael and Konstantin's terrific work on the carbon crisis that we're confronting. So Giancarlos, tell us a little bit about yourself. We know you're in Japan and you're going to be talking about, the risk perceptions and social influence effects there. Go ahead and share your screen and tell us a little bit about yourself.
Okay. First of all, I want to apologize for the mess up with the time. I know I used 4:45 here, but for some reason my calendar became 5:45, and then when I started the presentation, the chat was already going on. So sorry for that, but thank you for sticking up. I am a lecturer at the University of Tokyo in Japan, and I've been working mostly on built environment and travel behavior, and recently moving on to social networks and social influence. So what we wanted to do today was basically try to evaluate how the perception of other people, like the social influence, affects the decision to stay at home, which is what we did in this study. Can you see the screen?
Yes.
Okay, so let me put it in. Do you see the full screen here or the presenter screen?
Yes, we can see the full screen.
Okay, thank you. Okay, so the title of my presentation is Analyzing Risk Perception and Social Influence Effects on Self-Restriction Behavior in Response to the COVID-19 Pandemic in Japan. And so I don't need to explain this, but as you know, most of the large parts of the population of the world are in some sort of mobility restrictions due to the COVID-19. And some of them are mandatory and some of them are not legally binding. So Japan falls in the second category, where the government only sends a non-binding request for cooperation, right? So it started in February 26, when the government issued a request to cancel or postpone large events, including concerts, sporting events, etc., and culminated in April 7, when the government declared a state of emergency for 7 prefectures across Japan, including the Tokyo area, and then expanded to the whole country in April 16. And then when we look at the data this is data from the Google Mobility Project, you can see that these requests are actually successful to some extent. So the red lines that you see here are actually requests. The first one is from left to right, is the call for the Tokyo metropolitan government and the adjacent prefectures in the capital to stay at home and avoid unnecessary travel. The second red line here is the central government declaring the state of emergency in the 7 prefectures across Japan, which include the Tokyo metropolitan area. And the third line, vertical line here, is when the central government expanded the emergency state to all the prefectures in the country. So you can see that for retail and recreation and for commuting and the use of transit, there's been a relatively considerable decline in usership, but not so for grocery stores, which are necessary activities for subsistence, and then the use of parks, which are the open spaces where people are recommended to go to avoid crowded places. And then we can also see the consequent increases in activities around residential areas. So we did notice that this in the aggregate level, we did observe these changes, but our research question was, given that stay-at-home requests are non-enforceable and non-binding in the context of Japan, what factors affect the observed self-restriction behavior at the individual level? So when I mean self-restriction, is basically the decision to stay at home and avoid unnecessary travel. So to evaluate that, we conducted a web survey in the Tokyo metropolitan area and the prefectures around it. So this point over here, where you see the lot of black spots, this is the Tokyo metropolitan area, and then we gather information about 7 prefectures. It was a quota sampling due to the convenience. We wanted to get data as close as possible to real time. So we have a 2 waves. So the first wave was 800 people, sample based on region, gender, and age cohorts. And the second wave, we got a participation rate of 90%. We measured basis of demographics, social anxiety, risk perception, weekly trip frequency by purpose, which is our dependent variable in this analysis, and behavioral changes in response to COVID-19, as well as the perception of degree of self-restriction, which I'm going to explain now. So first, in terms of risk recognition, we asked, Slovak proposed a much more complex scale to evaluate risk recognition, but we actually used a simplified version to reduce the response burden. So we asked questions about the levels of dread of COVID-19, the familiarity, how well do you know this disease, and the perception of hazard controllability. And then everything was measured at Likert scale. So basically, just to give you an idea of the relative perception of risk, you can see here that in the x-axis in the first plot, you see dread and then unknown. So how unfamiliar do you think it is? So the COVID-19 is second after earthquakes in terms of dread. So I think that's kind of expected, but it was surprising. And I think this relates to availability risk, that elderly driving was considered very dreadful in Japan. And this is the case where this kind of accidents where elderly drivers lost control of the car and resulting fatalities has been a lot in the media lately. So you can see that it's being perceived as more dangerous than even cancer, a smaller degree. And then it's also COVID-19 is also considered by far degree the most uncontrollable hazard. So for the behavioral analysis, we don't codify these variables. And then in terms of the perception of the degree of going out self-restriction, so we asked respondents, to what extent do you think you and other people are practicing going out self-restriction? And then we measure that for themselves, for relatives, work and schoolmates, neighbors, other friends, and the general public. And you can see the plots here, where you see that for oneself, I think people think they are doing pretty well relatively compared to like perhaps friends, the general population, and neighbors. And there is a little bit change of increase in that perception from the T1, that is the period before the first wave, and T2, what is the second wave. So for the behavioral analysis, we actually use principal component analysis to extract a single component of degree of self-restriction of others. So we excluded the oneself. And then we normalize these variables so the possible ranges fall between 0 and 1. Here is unnormalized results. And then, okay, so just to give you a brief idea of how changes in the key variables occurred, these are changes in key travel behavior, right? So we can observe here that, for example, from T0 to T1, from wave 1 to wave, sorry, T0 is retrospective. So we measure retrospectively activity frequency for these different purposes. And there's a large share of the sample reported reductions in activity frequency. But the activities that changed the least were commuting for work, and then grocery shopping and other shopping. So you can see that these large shares of people that did not change. From T1 to T2, we actually observed that there was a rebound in shopping activities. So I think there was a sort of adjustment process where people maybe at the beginning just stopped too much and then started to relax a little bit once they observed the situation. But in general, we can see large shares of the sample reporting reductions in all activity patterns. When you look at changes across all activity time periods, we can also see the same trend, and the share of decreasing when excluding people that had zero frequencies, it ranged from 34% for grocery shopping to 87% for eating out for business. So how did we model this? Well, when you look at the frequencies in this table, you can see that some activities are actually relatively not that frequent. So leisure activities, eating out, the average frequencies are not that high. So we built 2 types of models. So for grocery shopping and other types of shopping that have relatively higher frequencies, we conducted a regression analysis. And to test models with different assumptions, we did a pooled OLS model, we did a random intercept model, and then we did a first difference model. And then for eating out and leisure, we had much lower frequencies, as you can see here. We built discrete choice models of probability of self-restriction. So we built a pooled MNL model where the choices were to go out or stay home, a mixed logic with error components with the same choices, and then a multinomial logic choice model of changes in frequency, where the choices were to increase frequency, decrease frequency, or no change. We also included covariates of gender, age, population density, household size, number of cows in the households, number of infections at the city level, and commuting frequency. So, well, due to time, I'm only going to talk about elasticities and marginal effects of the key variables, which are self-restriction and COVID-19 dread. And what we can see here is that although we see a negative relationship between perception of self-restriction of others and frequencies of shopping, the marginal effects are actually very small. So we're talking about 1% increase in the perception of perception of the degree of self-restriction of others, resulting like from 0.03% to 0.07% reductions in grocery shopping. We can see the same trend in terms of other shopping as well. And then for the effect of COVID-19 dread itself, we can see that there is too much uncertainty to make any kind of inference. So our interpretation of this is that shopping is a necessary activity for daily life. So in that case, people probably take some measures like engaging in physical distancing, using masks, instead of actually stop shopping altogether. We not reported here, but we did not see a lot of change to online shopping, which is a little bit surprising. However, when you talk about these discretionary activities such as eating out and leisure, we did see a difference. We see larger effects, right? So we did see that, for example, the elasticity of perception of the degree of self-restriction for eating out alone, we can see that 1% increase in this will be associated with 0.15% or 0.17%, depending on the model you use, increase in the probability of restricting, so the probability of staying at home. So these magnitudes are not that large, but they are still moderate, and they are still important. The same thing can be thought about when we look at the model of changes in frequency. We can see the similar trend where, for example, of course, the elasticity of perception, right? So the elasticity is positively associated with the probability of decreasing your frequencies. And we can see here that, sorry, I forgot to mention in the previous one as well, that the marginal effects of COVID-19 dread are actually significant as well. So in this case, because these are marginal effects, we're talking about the case where, on average, one person going from not thinking that COVID-19 is dreadful to thinking so, would on average increase its probability of reducing your activity frequencies, like, for example, in this case, by 0.15%. And by 15 percentage points. So just to visualize these elasticities and marginal effects, we conducted a simulation exercise of the effects of perception of degree of self-restriction of others and COVID-19 dread and going out self-restriction. So basically on staying at home probability for eating out and leisure. And then we compare the results between the binary logic and the mixed logic. And we can see here that, as I mentioned again, first, the difference in the vertical lines is the difference between considering the COVID-19 dreadful or not. So the full line here is when you think that COVID-19 is dreadful, and the dotted line here is when you think it is not. So we can see here that the difference between this, which is consistent across all activity types. And we can also see that to the degree that you think other people are actually engaging in self-restriction, your probability of staying at home will also increase. We observe the same thing when we look at the simulation of changes in activity frequency. Increasing activity frequency were very low to begin with, so that you can see that the effects are not that large. But we do see the difference here between decreasing your activity frequency and no change, right? So again, the difference between the full line and the dotted line is the difference between dreadful and not dreadful. And the colors here, the yellow line is a probability of decreasing that increases as you think the other people around you are actually engaging in self-restriction. So in terms of policy implications, I think that in the context of non-binary requests, soft measures such as campaigns to promote the reduction of non-essential travel might be more effective if they properly convey the severity of the threat posed by COVID-19 as well as the coping mechanisms. So there's a lot of literature in terms of, in psychology, in terms of fear arousal and protection motivation theory. And then also they will be more effective if they appeal to the group rather than the individual, emphasizing the behavior or at least the perception of behavior of others. So based on the above, we believe that the persuading agency has the responsibility to guarantee that the fears claimed are legitimate and the coping measures are actually effective by relying on sound science and effective science communication. But at the same time, too strong a free appeal might result in discrimination and prejudice. So in Japan, it's being called the self-restriction police, but we have actually private individuals trying to coerce individuals and businesses into complying with government requests. So there is a need to achieve a difficult balance between effective threat appraisal while avoiding discrimination and prejudice. And of course, we need sufficient policy support to minimize the costs of the coping behavior we are suggesting. So I think the takeaway message is that as a measure of social influence, the perception of degree of going out self-restriction of others was consistently associated with a small reduction in shopping trip frequencies and non-negligible increases in the probability of going out self-restriction for eating out and leisure purposes. As a measure of risk perception, COVID-19 dread was also associated with non-negligible increases in the probability of going out self-restriction for eating out and leisure purpose. And in the context of non-binding self-restriction requests, soft measure campaigns to promote the reduction of non-essential travel might be more effective by properly conveying the severity of the threat as well as the coping mechanisms and appealing to the group rather than the individual. Thank you very much.
Thank you, Giancarlos. We're so glad that you were able to present. Reed, did you want to read him the questions, or would you like me to do that?
You go ahead. Thank you, Juan Carlos, for giving the presentation live. I guess it's 6 in the morning your time.
Now it's 6:40. Yes.
What is it?
6:40.
6:40. Okay, so that's really early. Go ahead, Kara.
Right. So Richard has asked that you, if you feel that your model might be over parameterized. So I don't know if we want to unmute Richard to get a bit more into this issue, but do you see that question there in the chat box, Giancarlos?
Oh, sorry, let me stop the screen and I cannot see the chat. I think we don't have actually that many parameters though. If you look at with the covariates that we use are basically social demographics and the commuting frequency, because we believe that if we are commuting, you already took the risk to go out, right? So might as well do anything, other activities, and then number of infections as a measure of risk. And then we actually did out of sample validation. So we split the sample, we did repeated learning testing, and actually the models perform actually rather well. Of course, we're using the same data, so it's not a strong validation as saying a truly independent sample, but still we did some basic validation testing and the models perform really rather well outside the calibration sample as well.
And Junia was wondering if your work is already at arXiv or someplace else that we could read it?
Yes, actually we got it published recently in TRIPS, the interdisciplinary perspective one. So let me share the slide here again, sorry. Which one is it? Here. So can you see the screen?
Yes.
Yes.
Yeah.
Okay, so there you go. So in transportation research interdisciplinary perspective, it's already in press and it's open access, so it's available for anyone.
Thank you for doing that. I wrote in the chat box that I'm not really a big fan of elasticity, usually because the X variables have very different behaviors, very different units, of course, and much harder to change one variable by 1% than some other variables. But I think all of the work you showed us was always on this Likert scale, which is a 1 through 5 integer variable. So they're much more comparable maybe than like density and income and gender or something like that would be.
Yes, we agree. That's why we decided to limit the analysis to these two variables. We have other variables in the model. We have the effects of densities, which I don't remember now. the direction of the effects. But yeah, I think it is comparable, and that's why we did the simulations in the end as well, because sometimes it might be difficult to grasp just from that. I mean, it was actually hard for me to assess, okay, 15, the elasticity was 0.16. Is that a big number? Is that a small number? We don't really know how effective it will be in changing people's minds. So
what I recommend to everybody, and so my students always have to do this in our papers, is do a 1 standard deviation change. And so on some of those Likert scales, you'll see a lot more variability or heterogeneity in your population than on others, where people are very rigid. And so a 1 standard deviation change kind of normalizes it, and you can take whatever that person's response was, bump it up by 1 standard deviation, which I know is a little strange because this is an integer, but you do that for every person in the data set, and you see how their Y variables change, and you average those Y value changes and compare it to a 1 standard deviation change in the Y variable across those people. And so that'll give you a much better sense of what's practically significant. And I think it's just a better way to present results, but most people do use elasticities. So
I love elasticities.
Yes, Reed is famous for his
as you know from working with Cervero, 1997, 2010, etc. Give me an elasticity any day.
Yeah, they're very nice because the dimensions are there, but 1 standard deviation over 1 standard deviation, I think you could get used to that, Reed. So, Carlos, I do recommend it to help you feel a little more confident in identifying that.
Well, this was great, and I thanked everyone. Carlos, thank you for giving the presentation live, and I forgot to thank my doctoral student, Sadi Sabari, who is going to be graduating at the end of this coming year and will be looking for a job, and I couldn't recommend him more highly. So you keep him in mind.
Okay, well, you guys, thank you so much. This was 2 full days of COVID-related talks, and hopefully you got into the other tracks as well. I know I was back and forth all the time, so this Zoom conference makes that easy. But you're all fantastic BTR participants because you're here at the end of a long day. Some of you are waking up early like Jean Carlos, and we really appreciate it. And we hope to see you next year, and that research and health goes well for you and everyone in your community in the days ahead and the months ahead. So get some rest, and thank you.
Thank you.